Good evening and a warm welcome to everyone. Team Ayur APTA invites you all to the final day of Siragrandhi, a national level paper and poster presentation. Now I would like to invite our respected faculties to join with us. And before get start, let me remind you something. Dear participants, your maximum time limit is 8 minutes for the presentation and kindly follow it. Now we can start with our first participant. So now I would like to invite Dr. Prajakta Aravind Taru to
Yes,
present with
ma'am.
the paper on the topic Importance of Agni in Chikitsa. Doctor, please start.
Yes, ma'am. Good evening to all. Myself, Dr. Prajakta Arvinda Tharu from CRC, Nigdi, Pune. My topic name is Importance of Agni in Chikitsa. Next. Introduction. Ayurveda has described an important factors of digestion and metabolism in our body as a Agni. Agni is responsible for all vital functions of our body. Therefore, Ayurveda considers that Deha Agni is the cause of life. Complexion, strength, health, nourishment, luster, oj, tej, and pran. Acharya Charak state that the Agni is a mool of life. Acharya Charak also state that when the Agni of, of an individual in Samavastha, then that person would be absolutely healthy and leads a long, happy, healthy life. But if the Agni of a person variated, the whole metabolism in his body would be disturbed, resulting in disease. Acharya Charak has mentioned about 13 types of Agni. One Jathar Agni, five Bhutagni, and seven Dhatagni. Jathar Agni is responsible for the digestion of food, has maximum potential because other Bhautik Agni are dependent over it. Objective of the study. Ayurveda considered that no disease ever ever be developed without the dearrangement of Agni. Therefore, the management of each and every disease, Agni gets primary focus. Through in Ayurvedic literature, a detailed explanation of Agni available, but the lack of practical utility. So the paper is sincere effort to elaborate the practical utility of Agni. Concept of Agni, Kayasya Nam Antaragni. Acharya Charak mentioned that it thus the Chikitsa based upon Agni and regulation. Agni Kamukta, uh, Ahar, Ahar and Jataragni, um, Ahar Ras, Bhutagni develop, Saptadhatu Poshan depend on it, Dhatvagni, Panchamahabhut Poshan depend on it. Health concept in Ayurveda, Dosh, Agni, Dhatu, Malakriya, whose Atma, Indriya and are happy considered as a healthy individual. Formation of Agni, Panchamahabhutas or five elements of nature are chronological created. Agni is created from Vayu. Importance of Agni, Mandagni. When Agni stops, individual dies. Samagni, healthy and long life when the Agni is normal. Vishamagni, health and disease when the Agni is variated. Importance of Agni, proper food, balance Agni, Bala, Arogya, Ayusha. Role of Agni, Ayu, Varna, Bala, Swastha, Utsaha, Upachaya, Prabha, Oj, Agnya, Pran. स्क्रीन नहीं पड़ा जाता. स्थान of Agni, Amasha, upper part of GIT, Grahani, middle and location of Agni, Pakvashaya, lower part of GIT. Types of Agni, four types of Agni, Samagni, Vishamagni, Tikshnagni, Madnagni. Dhatvagni, all the seven dhatus, seven elements tissue of the body contain their own Agni, metabolize the nutrient material supplies them through their own srotas. First, Rasagni present in Rasadhatu. Second, Raktagni present in the Raktadhatu. Mansagni present in Mans Dhatu, Medagni present in Meda Dhatu, Astyagni present in Asti Dhatu, Majjagni present in Majja Dhatu, Shukragni present in Shukra Dhatu. Dhatu. Each Dhatwagni or bioenergy present each Dhatu synthesize the transform essential Rasa Dhatu required for the particular Dhatu or cell from the basic nutrient present in the Anna Rasa or essential diet we consume. Each Dhatwagni has got specially synthesized the transform constituent suitable particle Dhatu. Thus, action of selective action. Acharya Charak has mentioned the fact that that the seven dhatus that are the support of the body contain their own agni, and by their own agni they digest transform the material supply to them to make substances alike to them assimilate, assimilation of nutrition. Toxicity. Incomplete digestion food or partially metabolized element or substance residing in the body, thus like toxin or foreign object, which are not good for the health. Variated agni, variated form the variated dosha, improper digestion form, improper metabolism, formation of form disease. And Agni, improper digest food regimen, improper digestion, formation of Ama. Agni as a Pitta. Origin of Pitta from Tap, which means digestion to give nourishment to the body by digestion of indigested food and to maintain heat by means the heat. Uh, Agni as a Pitta. The origin of Pitta from Tap, combine digestion and to maintain heat. Types of Pitta and relation of Agni. Agni represented the body in the form of Pitta, which is located in Grahani. Primary takes part in the digestion of food and controls other subtype of Pitta. Pachak Pitta. The fire in the form of Pachak Pitta, which located in Grahani and primary takes part in the digestion of food and control the other subtype of Pitta. Ranjak Pitta. Fire located in Yakrit and Pilya and takes part the hemoptysis, imparts color and complexion. Alochak Pitta. The Pitta or fire located in eyes take part in processing processing vision. Types of Agni. Charak mentioned as 13 Agni, Jatharagni 1, Bhutagni 5, and Dhatvagni 7. According to Acharya Shushruta, five types of Agni are insulated. Pachak Agni, Ranjak Agni, Alochak Agni, Sadak Agni, and Bhajak Agni. However, their indirect reference to five Bhutagni underlying in brief description to make the transformation of foodstuff. Charangdara, Acharya Shrarangdara has recognized the five pittas only: Pachak, Bhrajak, Ranjak, Alochak, and Sadak. Um, Agni has divided into 30 types according to function and site of action. Jathar Agni. Once Agni present in stomach and duodenum. Bhutagni. Five Agni, five basic elements. Dhatvagni. Seven Agni present in each seven dhatu. Importance of Dhatvagni in all types of Agni. Jathagni is a digest the anything for in the said kind of all Agnis. The other types are totally depend on status of Jataragni and have similar impact to other Agnis of body. Jataragni is also classified into four categories according to performance or digestion in human being: Vishanagni, Tikshnagni, Mandagni, and Samagni. Physiological aspect of Agni. Malfunctioning of Agni result in majority of disease. Proper functioning of Jatharangni result in normal functioning of digest, circulatory system, strong immunity. It is the source of intelligence, nutrition in body. It coordinates many physiological processes of body from digestion. This act not only physical function, also mental and spiritual level. Pathological aspect of Agni. If Jaఠાragni is not function properly, person suffer from digestive problem, improper blood circulation, low energy, etc. etc. Ama and Agni, basic pathological factor for many diseases. After maintain the proper function of Agni, one can prevent the root cause of disease. Chikitsa wise aspect of Agni. Agni plays an important role in maintaining health and cause of many diseases. Management of Agni. Drishti may leads to normal healthy life. Also, normal function of Agni can prevent Amajanya disease. So, Agni is important factor for the human body. Chikitsa wise aspect of Agni. The morbidity of this dosha in the form of pathological increase or decrease always depend on the states of Agni. If the Agni functioning normally, the doshas also remain undisturbed from support of body, mind and life. On the contrary, if the Agni get disturbed, the dosha too will get disturbed, cause many diseases by attacking body defense. Hence, under understanding of Agni once of important concept for the understanding of disease process as well as prescribed principle of treatment. Intervention of Agni in medical examination function state of Agni. It can be examined with following performer per Agnim Jaran Shakyata Parichatte concept which given below the table. Examination function of state of Agni. Characteristic appetite in Samagni normal, Vishamagni sometimes poor and sometimes increase. Mandagni always poor, Tikshnagni always in, intensified. Quality of food in Samagni normal, in Vishamagni sometimes less than normal, sometimes more than normal. Mandagni always less than normal, Tikshnagni always more than normal. Homologation heavy light food particle in Samagni mixed quality of food suitable. Vishamagni sometimes even heavy food digest and sometimes light food remain undigested. Mandagni light food if taken more quality remains undigested. Tikshnagni heavy food even more quality digest easily. Bowel habit in Samagni normal, Vishamagni mostly constipation and rarely normal. Mandagni evacuate normally but stool often containing undigested food particle with foul smell. Tikshnagni frequently evacuate. Nature of person in Samagni enthusiastic, Vishamagni irritable, Mandagni lazy, Tikshnani delicate. In Saman Chikitsa, deepen. Without digestion, the armor improve the digestion secretion. Pachan digest the armor but does not secrete digestive secretion. Deepen and Pachan digest the arm and improve digestive secretion. Conclusion Agni apart from the digestive function and is also responsible for the production of strength, strength, which has two aspects, namely, first is strength to raises the occurrence of disease and decay the normal decay in the human body. If the Agni is functioning normally, the dosha also remain undisturbed from the support of our body, mind, and life. On the contrary, if the Agni get disturbed, the doshas too will get disturbed and cause many diseases by attacking body defense. Hence, understanding Agni is the one of the important concepts for the understanding of disease process as well as to prescribe principle of treatment. References. First one, Kashinath Kanekar Shastri and Dr. Gorakhnath Chaturvedi, Charak Samhita of Charak with व्यवस्थित हिंदी कमेंट्री चरक संस्थान रीप्रिंट एडिशन वाराणसी चौखंबा भारतीय एकेडमी चैप्टर 15 2009 3 thank you
Thank you, doctor. Next, I invite Dr. Sayani Bansode for the presentation. I invite Dr. Sayali Bansode.
Good evening, ma'am.
Good evening, doctor.
Can I share my screen?
Sure, sure.
Is my screen visible?
Yes, doctor, it's sharing now.
Okay. I myself, Dr. Saidi Dattare Bansode, I'm here to present the article to study the additional effect of Rasona in Siragrandhi with special reference to varicose veins. I have completed this under the guidance of Dr. Kanchan Shekokar ma'am and Dr. Anand Kumar Shekokar sir. Abstract. Ayurveda is known as ancient traditional Indian system of health science. According to Acharyas, Ahar Vihar, Apatya Ahar Vihar causes dosha dushti leading to deformities. In normal circumstances, the blood flows from lower limbs into the heart against gravity because of unique posture of the humans. Varicose veins are dilated, tortuous, elongated superficial veins of limbs. It is caused by incompetence of the walls in the veins. The failure of one wall pushes on neighbor walls, causing retrograde flow and varicosity of entire local superficial venous network. According to Acharya Sushruta, Acharya Vagbhat, and Acharya Charak, varicose veins resemble to the condition known as Siragrandhi, Siraj Kautilya, Siragatvat. Till today's era, there is no significant conservative treatment for varicose in modern science. The line of treatment includes surgical and non-surgical methods. According to Ayurvedic literature, Rasuna is considered as Amrut Rasayan. It is Pancharasatmak, excluding Amlaras. It has Snigdha, Pichela, Guru, Ushda Gun, which acts as Vatagna. Tikta Ras, which penetrates in the dhatu and enters tissue and repairs the dosha dushya samurjana as well as Khavaigunya of the varicose veins. Hence, an attempt is made to evaluate the effect of Rasona fried with teethel as with along with modern drugs. If Rasona is used with modern medication in varicose veins pathogenesis, the palliative curation efficacy may increase. Introduction. The term varix means twisted, and varicosity is a penalty that verticality against the gravity. Varicose veins and its clinical signs are classified as follows. These are classified in class 6. According to Acharya Sushruta, Acharya Vagbhat, and Acharya Charak, varicose vein resemble to the condition Siragrandhi, Sirakotilya, and Siragatvat. Due to apatya ahar, we are followed by the patient causes dosha dushti and dhatu dushti. Vikruta vat when causes rakta dushta dhatu kshaya leads to sira shaitilya. Till today's era, there is no significant conservative treatment for varicose. As per clinical review and discussing with the practitioners, we have concluded that oral medications are 50 to 60% effective. Non-surgical includes oral medications like flavonoids, diosmin, hesperidine, calcium propycillate, bandaging, injection therapy, etc. While surgical includes operative like Trendelenburg, endostapling, etc. The operative procedures mentioned here are cost-wise effective, whereas have major complications and efficacy is not worth better. The operative procedures are even avoided by the patient itself due to the psychological factors, longer hospitalization, and economical expenses. They do not cure the disease but prevent the delaying of the progress of the disease. Acharya Sushruta, the pioneer of surgery, has stated the principle of Shatakriyakal, which states that the disease should be treated in its initial phase so that it will be easy to break down the pathogenesis of the disease and prevent the further progress of the disease and complications. Bhav Prakash states that Rasona, when given with Teethel and Sendab, reduces all the Vata Roga. Hence, we cannot deny the positive influence of Rasona. This made us to inspire to select and present the title as Study the Additional Effect of Rasona in Siraj Granthi with special reference to varicose veins. My aim is to evaluate the additional effect of Rasona with calcium propycillate in Siraj Granthi with respect to varicose veins management. My primary objective is Rasona effect in varicose veins, and secondary objective were to avoid surgical intervention to provide cost-effective, patient-friendly treatment modalities and to study Siraj Granthi with special reference to varicose veins. Material matters. Number of patients were 20. Treatment details. I made two groups. Group A was treated with calcium robisolate 500 mg BD with Rasona 40 gram divided in 2 hours, fried in Teethel once a day in the morning. And group B was only treated with tablet calcium robisolate 500 mg BD. Mode of administration: tablet calcium robisolate 500 mg 2 times a day with water orally, and Rasona formulation 40 grams once a day in morning with a pinch of sandal sprinkled over it with a lukewarm water. Duration of administration for 30 days. Follow-up was taken on 7th, 14th, 21st, and 28th day during the treatment. Additional treatment, elastic wrap bandaging over the limbs all over the day and leg elevation at night, pillow 2 pillows for the boy group patients. Drug formulation. According to Kashyap Sahita, Lashun Kalpa Adhyay, Rasona is taken in 40 gram quantity. Each piece of Rasona will be divided in 2 parts and fried in detail. Repeat the procedure each time when it is given to the patient. Clinical study, research study, randomized control trial, study population and sample, patient with classical signs and symptoms of varicose veins, visiting OPD of Shalatantra department, previously known and freshly diagnosed cases. Sample size, a total of 10 patients of group A and group B of varicose vein willing to participate in this study. Design of study, prospective randomized clinical trial, screening of patients on the basis of inclusive and exclusive criteria in the institutional OPD and IPD, registration of patient with consent. Group A was treated and Group B was treated according to the criteria. Follow-up was taken on 0, 7, 14, 21st, 28th, and 30th day after the treatment. Statistical analysis, discussion, and conclusion. Inclusion criteria for me was both male and female, age group to 30 to 70, patient diagnosed with Siragrandhi or varicose vein in lower limbs having clinical features like venous turgidity, swelling, pain, skin color, etc. Unilateral and bilateral. Exclusion criteria were patients with diabetes mellitus and other systemic diseases, patient with coagulopathy or bleeding disorders, patient varicosity associated with complications like DVT, calcification, venous ulcer, congenital varicose veins. Community of special group who do not have garlic in meals and patients from group below 30 and above 70. Assessment criteria, cured above 75%, moderate 50 to 74%, mild 25 to 49, and no change 0 to 24%. Objective parameters were showed, skin changes, tortuosity, subjective parameters were stool and itching. These are the score from which I decided the after treatment and before treatment values. The subjective parameters were stool and itching. While tortuosity, a clinical examination, I did clinical examination of the patient in 3 tests. That was first was cough impulse test. When fluid felt, I observed, then test was positive. While when fluid felt absent, it was test negative. Tendelberg test A and Tendelberg test B. Observation. Total 20 number of patients were treated according to the treatment criteria. The symptoms relief in the patient is given below. Rate is calculated by the formula BT minus AT divided by BT into 100. AT is equals to after treatment and BT is before treatment. AT and BT values were respectively taken from the score given by the patients during the follow-up visit. In group A, I observed that on the 7th day, the pain relief was 23% and on the 28th day, it was 77%. Edema was 50 until 28th day, it was also 50. Itching was also 50 and it reduced till 75. Skin changes was 0% on 7th day and 28th day, it showed 50%. Tortuosity was 33% in 7th day and on 66% on 28th day. This was the group A. This was a 10 patient which I was treated with Rasona and versus calcium robicelate. Group B was only treated with calcium robicelate, and here I observed that pain was 20% to 70%, while edema, itching was a little bit different. Edema remained 40%, itching remained 66%, skin changes 50%, and tortuosity were reduced to 60%. Discussion. Since a clear-cut description about the action of Rasona is available on an attempt was made for the same on the basis of symptomatic relief obtained from clinical trials. Probably there may be reduction in signs and symptoms due to the Rasona with calcium droplets due to its unique properties. Itching, stool, color changes, tortuosity, etc. have shown a marked reduction in maximum patients. Conclusion. In clinical study, it can be concluded that Rasona when given with calcium robicelate is more effective rather only with calcium robicelate. This was the references I took from Kashyap, Charak, Sushrut, and Bhav Prakash. And these were the references.
Thank you, doctor.
Thank you, ma'am.
Next, I invite Dr. Sneha Kapkade. I invite Dr. Sneha. Hello, Dr. Sneha.
Hello.
Good evening, doctor.
Uh,
Please start the session.
Good evening, ma'am. Just a second. Hello.
Yes, doctor.
मॅम स्क्रीन दिसतीये का?
No, doctor.
ओके, एक जस्ट अ मिनिट.
Hello, Doctor
Hello.
Sneha. Doctor, please
Hello.
start. Doctor, please
Hello, ma'am. There is some technical problem. I can't share my share हो ही नहीं रहा है.
start.
Just a minute.
It's okay, doctor.
नहीं हो रहा क्या? ये दिसतंय का? Screen. Start now. Hello. Hello.
Yes, doctor. It's visible now.
Good evening, everyone. I'm Dr. Sneha Kabgate, MS Shalyatantra from Sane Gurji Hospital and Smriti Bai Shaha Ayurved Mahavidyalay, Hadapsar, Pune. My subject is therapeutic aspects of Agni Karma and its importance in current Ayurveda practice. My guide is Dr. Kamlakar Gajre sir. Abstract is Agni Karma practiced in India for more than 3,000 of years. Agni Karma is one of the superior parasurgical techniques mentioned in Ayurveda. It has been given special place in surgery by Sushruta, and it is believed that disease treated by Agni Karma never reoccurs. In modern time, also it is used and termed as therapeutic burns or cauterization. This study concludes that Agni Karma is very effective, easy, and simple procedure that can be employed as outpatient procedure. Agni Karma means application of Agni directly or indirectly with the help of different materials to relieve the patient from disease. Agni Karma is the prime parasurgical procedure to treat chronic diseases which are mostly difficult to manage because of antagonist property of doshas like disease caused by Vata and Kapha. Atharva Veda also has identified Agni as god and treatment for disease. it is clear that Agni was used to protect the body from invading microorganisms. Nowadays, also the sterilization by healing process can be interpreted as the above idea of Atharva Veda. We are going to see classification of Agni Karma. It is classified in various ways. First of all, according to Akriti, Valaya, Bindu, Vilekha, and Pratisarana. In Valaya, circular shape encircling the root of the deceased portion. Second is Bindu. Bindu means dot, made with the tip of Shalaka. Third is Vilekha, straight, curved, or horizontal lines drawn with Shalaka. And Pratisarana is rubbing with the side of Shalaka. Secondly, according to Acharya Vagbhata, in Ashtanga Sangraha, following points are mentioned. According to Acharya Vagbhata, Ardha Chandra, Swastika, and Ashtapada are the types of Agni Karma. In first of all, Ardha Chandra, it is semi-lunar or crescent shape. Swastika is swastika shape. Ashtapada is direct in 8 directions. Then, according to Dravya used, classification of Agni Karma is as follows. First is the Snigdha Agni Karma and second is Ruksha Agni Karma. In Snigdha Agni Karma, it means performed by means of Madhu, Ghrita, Taila, used for Agni Karma to treat disease situated in Sira, Snayu, Sandhi and Asti. Second is Ruksha Agni Karma, performed by means of Pippali, Shara, Shalaka, Godanta, used for Agni Karma to treat diseases situated in Tvaka and Mamsa Dhatu. Then third is according to site. Agni Karma is divided into 2 types, Sthanik and Sthanantariya. Sthanik means local, as in Vicharchika, Arsha and Kadar. We do local application. And second is Sthanantariya, as in Visuchika, Apachi and Urdhasi. 4 is according to Dhatus. That is Tvakadagda, Mamsadagda, Siradagda and Sandhi Asti Dagda. Now we are going to see Dahanopakarana used for Agni Karma. In past decades, Tvakadagda, Mamsadagda, Sirasnayu, Asti, Sandhi Dagda. There are 3 types. In Tvakadagda, for superficial diseases involving skin, Pippali, Ajashakrut, Godanta, Shara and Shalaka. In Mamsadagda, for disease involving muscle, Jumbo Osta and other metals like Kansya, Rajat and Tamra should be used. Sira, Snayu, Asti, Sanjigat, Dagda, Madhu, Guda, Sneha should be used. What are the indications of Agni Karma? These indications are according to all the Acharyas, Charaka, Shushut and Vagbhat also. Arsha, Granthi, Arbuda, Bhagandar, Apachi, Antravuddhi, Shlipad, Nadivran, Upadamsha, Gulma, Shirorog, Tilakalak, excessive pain in Sira, Snayu, Sandhi Asti, Siracheda, Snayu Asti, Sandhigat, Vatvikar. Then what are the contraindications of Agni Karma? There are various contraindications according to Sushruta Charya, Charakacharya and First one on, according to Sushruta, we should not do Agni Karma in case of internal hemorrhage, rupture of internal organs, bleeding disorders, perforation, retained foreign body, fearful persons, old-aged persons, debilitated and children. In persons with dominant pitta traits and the persons contraindicated for Shvedana. According to Charaka, Vrana of Snayu, Marma, Netra, Ushta and Vrana with Visha and Shalya should not be treated with Agni Karma. According to Ashtanga Sangrahakar, who take Virechana, suffering from Atisara, who has Shalya in his body, who is contraindicated for Kshara Karma, should not take treatment from Agni Karma or should not do Agni Karma. Then Agni Karma Kala is mentioned by our Acharyas. Agni Karma can be done in all seasons except Sharad and Grishma due to increased heat in Pitta, which generated out of the excessive hot climate. But in emergency, Agni Karma can be done in any season. As per Dhatu's feature of proper Agni Karma, Toka Dagda, production of crackling sound, found smell, contraction of skin. Then Mamsa Dagda, dark, ashy dark gray color like pigeon, less swelling and pain, and dry contracted wound. Sirasnayu Dagda, black color, elevation of sight, stoppage of discharge, and Sandhi Asti Dagda, dryness, dark red discoloration, roughness, and stability of part. Then what is the procedure of Agni Karma? Preoperative. In preoperative, Pipali, Shalaka, Plota, Pichu, Grita, Madhu, source of Agni should be Agni Karma. You should take it ready. Pichila Anna should be given before the procedure. Patient should be empty stomach in case like obstructed labor, fistula in ano, urolithiasis, abdominal diseases, piles, and disease of oral cavity. In operative, before performing Agni Karma, chanting of mantra should be done. According to our acharyas, before starting operative, we should say the mantras, and the patients kept in suitable positions by keeping head in the east direction and hold by expert assistant to avoid movements. We can use an proper anesthesia here. Exact side of Agni Karma should be marked, cleaned, and then it is performed at the expected site as per the condition and up to the optimum sign of cauterization. Hence, up to the Samyak Dagda Lakshan. Then what is the post-operative? After completion of Agni Karma, Madhu and Grita apply on the part where Agni Karma has done for Ropan of Dagdavran. Effects and superiority. Acharya Shushrut, Acharya Vagbhat, and the Sangrahakar both given superior place to Agni Karma than Veshaj, Kshara Karma, and Shastra Karma. Chances of recurrence not present. Disease which cannot be cured with medicine, Kshar, and surgery can be cured with Agni. Also have effects of sterilization. Agni Karma eradicates disease from its roots. It shows some effects on both Vata and Kapha. It causes coagulation and closure of bleeding vessels, and this helps in hemostasis also. Mode of action of Agni Karma. Agni Karma is Ushna, Tikshna, and Sukshma, having Sukshma Guna. Activate Dhatva and digest the aggravated doshas. Release of Sang means obstruction of Vayu and pacifies Vata and decreases the pain. Stimulates Dhatva and stimulate tissue metabolism, remove Avaran and do Amapachana. Sira Sankochana help for Rakta Samstamban, hence hemostasis. Conclusion and results. Agni Karma is used for pain management procedure described in Ayurveda. From ancient periods, its procedure performed in different ways. Techniques and equipment have become advanced, but basic principles are still the same. This procedure is superior than others. References are as follows. And thank you, ma'am. And thank you all.
Thank you, doctor. Next, I invite Dr. Prathamesh Pratap Rathod.
Hello.
Hello,
Dr.
doctor.
Prathamesh, please unmute another device from your place.
Yes, yes.
Please reduce the volume of another device. Please mute that device. And doctor, please share the screen, doctor.
Sir, just to wait me, I'm sharing.
बरं मी तू दुसरा कोणावर बोल
दूसरा सिस्टम काम कराना।
Hello, Dr. Prathamesh.
Yes, sir. Some technical issues,
Doctor,
sir.
Doctor, please mute the another device in your place, Doctor.
Okay, sir. I'm unable to share screen. Hello, sir. Hello.
Hello,
Hello,
doctor.
Doctor.
Yes, sir. Sorry, sir. I was unable to share my screen, sir. Yes.
Okay, Doctor. Doctor,
Doctor,
can you share? Can you
Sir.
share me in WhatsApp?
Okay, okay, sir. Okay, sir.
Okay, Doctor. We will call you on
so
after
doctor,
next.
Okay, okay,
doctor,
sir.
you can present next.
Yes, yes, sir. Yes.
Next, I
Sure,
invite
ma'am.
Dr. Vishal Patole. I invite Dr. Vishal Patole for the presentation.
Good evening, ma'am. Good evening, ma'am. Good evening, ma'am.
Good evening, doctor.
Doctor, please share the screen, Doctor.
Good evening, ma'am. I'm now going to share the PDF. Hello.
Hello, Doctor. Your screen.
Hello.
Hello, Doctor. Your voice is breaking, Doctor.
Okay. Am I audible?
Audible, Doctor, but
Yes, you
your
are
voice is
audible,
breaking.
but your voice is breaking.
And I think you have some network issues.
Okay, ma'am.
Your screen is now visible, Doctor.
Okay. Okay.
Please start the session, Doctor.
Okay, ma'am. जागरूक है. Hello.
Hello, Doctor.
Yes, doctor.
Am I sir very audible, sir?
Audible, Doctor, but
Now I'm going to share screen.
okay, Doctor.
Yes, please, doctor.
Your screen is visible, Doctor. Please continue the session.
Okay. Okay, sir. Now I'm Dr. Vishal Pantale, sir, from Saniguruji Hospital, Pune, and my topic name is Nadivran Sinus. This is a review and literature. My guide name is Dr. Yogesh Nalkade. So now introduction. I'm going to start with the introduction, sir. That is a Nadivran. Nadivran is the name is given to the Nadivuran is given to the describe the sinus occurring in the anal region. Nadivuran is nothing but the tract due to not being treated as the Varnashopa as per Ayurveda. It is a blind tract which communicate the from one surface to another, lined by the granulation. This is the modern aspect of Nadivuran, and the Nadivuran can be correlated with the sinus tract at the any part of the body tissue. Now, Nadivuran is said to be difficult to treat, and present era it is difficult to treat due to its recurrent nature. Acharya Sushruta has given the elaborative descriptions regarding to the Nadivuran, and that is a Nirharana, of followed by the Margava Shodhan and the Ropan. This is a classical Ayurvedic treatment given by the Dr. Acharya Sushruta from the ancient science. Then Nadivuran is said to be a Kricha Sadhya, means it is difficult to cure, and hence it is a successful management of this disease depends on the nature, knowledge of pathogenesis, and the presentation and the knowledge on the treatment aspect according to the Ayurveda and the modern aspect. Sushruta has described that the hair can be the root cause for the formation of the sinus and also mentioned the various methods of the management, including Agni Karma and the Kshara Sutra. Then I'm going to start the causes of the Nadi Vrana according to the Ayurveda. That is Shof Upeksha. The first of all, the very classical cause of the Nadi Vrana is the Shof. Sushruta has described the Nadi Vrana in Sushruta Nidanasthana 10 Adhyay, which is the main cause of a Nadi Vrana is the Shofupeksha. When the form and the right pus cavity or the abscess or the swelling is considered to be the unripe one and neglected. Okay, then the pus that is the infected and contaminated materials are not finding the exact exit traverse in the reverse direction and penetrate the deeper tissue and the organs. The pus make it own track to travel deep into the body, and the track or the pathway through which the pus travels deep into the tissue called as a nadi. The ulcer causing such a nadi are called as a nadi vrana. These are the compared to the sinus explained in the modern sciences. Then the type of a nadi vran, according to the Sushrutacharya, there is a Vataj nadi, Pittaj nadi, Kafaj nadi vran, Vata Pittaj nadi vran, Vataj nadi vran, Kafa Vataj nadi vran, Tridoshaj and Shalyaj nadi. So in the Vataj nadi, the sinus associated whitated vat, rough on a touch, narrow opening, and associated with the pain, foamy discharge at the night. This is the characteristics of the Vataj Nadivran. Then Pittaj Nadivran, Pittaj Nadivran, it is also always associated with the whitated by the pittas, associated with the thirst, rise in the body temperature, pricking pain, body fatigue, fever, and splitting pain, hot and yellow discharge during the daytime. Then Kafaj Nadivran. Kafaj Nadivran, sinus associated with the whitated by the kapha, hard, itchy, associated with the mild pain, thick, viscous, colored, and obtuse discharge during the daytime. Now, then Vata Pittaj Nadivran, the sinus associated with the whitated Vat and the Pittas, present with mixed symptoms of Vataj and Pittaj Nadi. Kafaj Nadivran, the sinus associated with the whitated Pitta and Kapha, present with mixed symptoms of Pittaj and Kafaj Nadi. Kafaj Nadivran, sinuses associated with the whitated cough and Vat, present with the mixed symptoms of the Kafaj and Vataj Nadi. Then we are going to discuss about Tridoshaj Nadi, the sinus caused or the associated with the whiteation of the three doshas, present with the burning sensation, fever, dyspnea, fainting, dryness of mouth, and the other mixed symptoms of the whiteations of the three doshas. This is the dangerous and the life-threatening condition which had crossed the limitations of the treatment. Shalya Janya Nadi, the sinus caused due to the foreign body or the foreign substances is called as a Shalyajanya Nadi. If a foreign body like as a thorn, etc. are entering into the skin and muscle, causes the damage leading to the formation of pus cavity and disappears. The tract formed by the such foreign substances is called as a Shalyajanya Nadi. Sadhya Sadhyatva, the Sushruta and the all acharyas has mentioned the Shalyajanya Nadi and the Sadhya Sadhyatva of the Nadi Vrana. According to the Yoga Ratnakar, the Nadi Tridosha Prabhava na siddhe chhascha tastraha khalu yatnya sadhya. This is referred, the Sanipatik Nadi Vrana is said to be asadhya to treat as there is a Tridosh Prakopa, and rest of the four Nadi Vrana, that is Ekdoshaj, Shalyajanya, is a Krusha Sadhya. Then Samanya Chikitsa of Nadi Vrana. The Acharya Sushruta has given a great treatment plan and the Samanya Chikitsa for the all the Nadi Vranas. That is, Ya Dvivraniye Abhihitastu Vartyaha Taha Nadi Taha Sarva Nadishu Bhishak Vidyataha. So Acharya Sushruta has mentioned the worthy application in the Vrana Karma and the management of a Nadi Vrana. Tailavarti, which having the purification, that is a Shodhan property, is used in the management of Nadi Vrana. Shar Sutra Vidhi is a classical treatment given by the ancient science by the all acharyas. That is, the Acharya Sushruta mentioned the 8 type of the sciences as a Nadi Vran, and he had explained the Shastra Chikitsa with the intervention of Shar Sutra as the one of the treatment for the Nadi Vran. The Kshar Sutra is an ideal procedure to be adopted for the management of sinus tract, for not only in destroyed the fibrous wall of a tract, but also helps in its curettage. Vishesh Chikitsa, Vatajnadivran, initially the Upanaha and the poultice of the medicine paste should be applied over the nadi so as to enable the accumulation of the pus at one place. Later, the entire length of the sinus should be cut open and make sure that the entire quality of a pus is drained to the optimum without any pus remaining in the tract. Later, the paste of the til, that til, apamarga, and the saindavalepana is applied over the area and bandage. The decoction of the Bruhat Panchamula, greater 5 roots, should be used to cleaning the wound on daily basis. Pitajnadivrana. Initially, the upana or the poultice should be applied with the utkarika, prepared with the ghee and the milk. Later, the applicated part, affected sinus tract, should be cut open with the sterile instrument. After draining the contaminant and the morbidity of the sinus, the wound should be filled and dressed with the paste of til, nagadanti, and the yashtimadu. The decoction of the somalata, nimb, and harira shall be used for cleansing the wound on daily basis. Kafajanyanadi. Initially, the Upanaha and the poultice made by the Kulatha, Sarshapa, Saptu, and the Surabij, accelerated of the fermentation processes, should be tied as to soften the sinus. Later, the tract is probed with the probe and the cut open to its length using the sharp sterile instrument. The wound should be filled with the paste of nimba and the til, Saurashtra Murtika, and the Saindavalavana and bandaged. The decoction of the Karanza, Nimba, Jati, Bibita, and Pilu should be used for the cleansing the wound on daily basis. Shalyajanya Nadivrana. Shalyajanya Nadivrana, initially the sinus should be cut open and the shalya or the foreign body removed. The wound should be cleansed and filled with the tilkalka mixed in the ghee and honey and bandage. This cleanses the heels, the sinus tract, and the wound. As we sharing this picture here, the sinus modern, according to modern science, the sinus is a blind ending tract lined by the granulation tissue leading from an epithelial surface down into the tissue. In this picture, we have seen that the blind tract which is open and goes deep into the tissue and lined by the granulation tissue leading from an epithelial surface down into the tissue. Then this is the another picture, as we can give the example of sinus like as pilonidal sinus according to modern science. This is a pilonidal sinus which now later affect the body tissue and deepen into leads to pilonidal abscess. This is another classical example, which is a skin and the sinus blind tract lined by the skin and epithelium, which later get fluid filled or the foreign body as a modern aspect, which we clinically correlated with the pilonidal sinus or the tuft of hair in this, which is pilonidal cyst. Thank you, sir.
Thank you, doctor.
Thank you, doctor.
Thank you, ma'am.
Next, I invite Next, I invite Dr. Meghna Sopan for the presentation.
Good evening, everyone.
I invite Dr. Meghna. Good evening, doctor. Dr.
Yes,
Meghna.
good evening. Is my screen is visible?
Yes,
Yes,
doctor.
doctor.
Visible.
Hello.
Visible, doctor. Screen is
Yes,
visible,
yes, it's
doctor.
visible.
Please start the session, doctor.
I, Dr. Meghna Darwadkar, PG of Subject Kriya Sharir from the SSM Hadapsar College. Today, we are going to discuss Dinacharya as a preventive aspect of lifestyle disorders. Introduction. Ayurveda is one of the ancient science and Upaveda of Atharva Veda advocates about the preventive, promotive, and curative aspect of the health. The science of Ayurveda helps us to learn to balance our body with external environment, which keeps on changing according to different seasons. Ayurveda explains about Dinacharya, Ratricharya, Rutucharya, Dharaniya and Adharaniya Vegas, etc., which help us to keep our body in balance. Aim of this topic is to study the concept of Dinacharya and its characters with special reference to lifestyle diseases. Objectives: to study Dinacharya from different Ayurvedic compendia, to study the concept of Dinacharya, to study how Dinacharya, that is daily regimen, has got emphasis on the prevention of lifestyle disorders. Material and method: lifestyle diseases. Lifestyle diseases are elements that are primarily based on the day-to-day habits of people. Habits that distract the people from activity and push them towards the sedentary routine can cause a number of health issues that can lead to chronic non-communicable diseases that can have near life-threatening consequences. Definition of lifestyle disorders. Lifestyle diseases are elements that are primarily based on the day-to-day habits of people. Dinacharya. This can also be understood as lifestyle modification to live healthy life in present context or following ancient way of day-to-day activity to maintain the health. Dinacharya, the systemic schedule from waking up early in the morning, that is in the Brahma Muhurta, to eating light diet in the evening and going to bed. Step of Dinacharya are waking up in the morning, prayer before you leave the bed, Mukha Prakshalan, washing of face, mouth and eyes, Shaucha Karma, evacuation of bowel and urine, Vyayam, exercise, Jivva Nirlekhana, tongue scraping, Danta Dhavan, cleaning of teeth, gargling, Tambul Sevan, chewing of betel leaf, Nasya, installation of oil in nose, Karna Purana, head and body massage, Abhyanga, bathing, dressing, use of perfume, pranayam, meditation, breakfast, doing daily work or study, lunch, evening exercise and prayer, Swadhyaya, that is self-study, dinner, going to bed, etc. Importance of Dinacharya is Dinacharya works as a primordial prevention in the non-communicable diseases. Here is the description of Dinacharya habitats. Brahma Muhurta, waking up early in the morning before sunrise, comparatively more oxygen level is present in the environment. Also, as the environment is quiet and calm in the morning time, concentration level is high and helps in memorizing easily. It helps to increase the life and protects our health. Ushapana, drinking water in empty stomach. Water should be at the room temperature, but in the winter season, lukewarm water can be used. This helps to kill the unwanted bacteria present in the buccal cavity and maintains oral hygiene. This also helps to release the constipation, but drinking more of water during daytime or in short period of time may cause water intoxication. It is very effective as preventive aspect of treatment of skin disease, also help in weight reduction. Shaucha karma, that is evacuation of bowel and bladder. One of the most important part of the Dinacharya is evacuation. Early morning evacuation is body's natural process. If the person is lazy to defecate and keep sleeping at this time, the impulsus rectum gradually becomes dull. Every person should eliminate the natural urges of feces and urine daily in time. Defecation at proper time helps to clean the rectum, increases Jatharagni, and prevents various manifestations like constipation, foul-smelling flatus. The most of the Gudrogas arises due to accumulation of toxins in the body and disturb Malavisarjan Vidhi. Danta Dhavana, brushing of teeth. Oral health begins with the Oral health begins with the clean teeth and buccal cavity, including gums. Keeping the oral area clean can prevent gum diseases and activates. Sorry. Oral health begins with clean teeth and buccal cavity, including gums. Keeping the oral area clean can prevent gum diseases and cavities. With the change in time, we have to transfer ourselves from Dativan to toothbrush, toothpaste, which is the cause of gum irritation. Dantadhavan twig that has properties like katu, tikta, kashaya ras, that is pungent, bitter, and astringent taste, which keeps the buccal cavity healthy. These rasa aids the digestion too. Dantadhavan should be done twice daily, once in the morning and next before going to bed. This also helps in saliva secretion, which contains salivary amylase. This amylase helps to dissolve the food particles stuck in between the teeth, further saving from the gingivitis and tooth decay too. Jiva Nirlekhana. After Dantadhavana, Jiva Nirlekhana is advised. As we all know that tongue is one of the indriyas which has adhisthana of bodhak kapha, which is responsible for the taste recognition. So for good taste, one should regularly do tongue scraping. It also helps in digestion. Mukha prakshalana. Washing of face for beautifying or cosmetic use, it should always be done with cold water using milk, Triphala Kwat, Yashtimadhu Kwat, decoction of Triphala and Yashtimadhu. It is also indicated depending upon the condition of acne, like acne, wrinkles, blackish patch, etc. But for healthy skin, plain water should be used. Next is Anjana. Anjana is of two types. Ayurveda has explained Saviranjana and Rasanjana. To keep the eyes healthy, one must apply Anjana. In today's context, our eyes get too much stress due to workload. So to protect the eyes, Anjana is much more important. Saviranjana should be applied daily, whereas the Rasanjana should be applied once in 7 days. As it is too tikshna, Rasanjana helps to elevate accumulated kapha dosha. Next is Nasya. Pratimarsha Nasya is advice in healthy people. 2 drops of oil, Anu Taila, Shadbindu Taila or Badam Rogan oil can be used daily for Nasya in empty stomach. In present context, due to atmospheric pollution, Nasya is also indicated before being exposed directly to the environment, which helps to prevent the effect of dust and fumes on respiratory tract. Kavala. It is always done after Nasya. Both Kavala and Gandusha have similar effects. It is done to elevate accumulated kapha dosha, which is increased by Nasya. It can be done with plain warm water, salt water, oil, Triphala Kwat, amla juice, long oil, lemon, etc., depending upon the condition. After that, Dhumapana is there. In the sequence, Dhumapana is done after Kavala and Gandusha. Kapha dosha, which cannot be elevated by the Kavala and Gandusha, is further subside due to Dhumapana. Prayogik Dhumapana is advised for swastha purpose and it can be practiced daily in commonly used. Commonly used drugs are Haridra, Gugul, Vacha, that is turmeric, Gugul and sweet flag. Has disinfectant property, cleanses the respiratory tract, oral cavity and pharynx. Tambula Sevana. Tambul Sevan can be understood as chewing of betel leaf. It is done to remove the Nasa Daurgandhya, foul smelling from nose, which may be increased due to Vata Kapha, and it helps to mask the bad breath, absorbs increased saliva, brings clarity in the mouth, useful for sore throat, cough, and also it is best remedy for toothache. Abhyanga, daily Abhyanga or massage, the whole body helps to alleviate tiredness, increase Vata in the skin, decreases aging, good for eyes, increases ayu, good for skin, and improves quality of sleep. Abhyanga should be specially done in head, foot, and ears. It is specially advised for children, old age people, and undernourished peoples. Vyayama, even who has recommended Vyayama? Who has categorized 3 groups, that is 15 to 70, 18 to 64, and 65 above. Help to build the body, increases body strength, and should always be done depending upon the bodily strength. Acharya Shushruta has contraindicated Grishma Rutu, that is summer season, whereas the Acharya Charaka has contraindicated Grishma and Varsha Rutu. Chankramana, that is walking. Chankramana is indicated for those who are contraindicated for Vyayama. There is exertion in Vyayama, whereas Chankramana, there is no body exertion. It is like brisk walk around. It does not give any trouble to body, increases Ayu, body strength, intelligence, improves digestion, and improves normal function of Indriyas. It is also considered as Laghu Vyayama, that is light exercise. Snana, bathing enhances the power of digestion and lifespan, improves body strength, removes itching, dirt, exertion, sweat, fatigue, thirst, burning sensation, etc. Regular bathing keeps the body and mind healthy, fresh, and energetic. In Manusmriti, it is explained as Snana Nityam Samacharit. That is, Snan should be done daily. A person should bath head and with cold water and body with warm water. Udvartana. In Swastha, Udvartana, that is dry powder massage, is always done after Abhyanga. It may be Snigdha or Ruksha, depending upon the body condition. It is Vata Kapha Hara, makes body parts strong, makes skin bright and lustrous, opens up pores and skin, and stabilizes, normalizes Bhrajak Pitta, which is situated on the skin. Elevates foul smell, heaviness of the body, removes drowsiness, brings freshness, elevates itching, relieves dirt from the skin, relieves testlessness, removes sweat, increases glamour, opens up the blocked pores on the skin. Material and method. This review article is based on different classical textbooks, journals, internet sources, experiences, and observations like Charak Samhita, Sishrit Samhita, Ashtang Samhita, Ashtang Hridaya, with their commentaries and concerned topics. Research article related to this topic. Result and discussion. It is understood that the following dinacharya help us to remain healthy. It works as a primordial and primary prevention. In prevention of lifestyle disorder, daily activities of people make their lifestyle easy. Following dinacharya help us to maintain good lifestyle. The change in lifestyle and following modernization and behavioral pattern of the people responsible for the occurrence of non-communicable diseases like hypertension, BP, asthma, cancer, obesity, chronic obstructive pulmonary diseases, heart diseases, etc. Non-communicable diseases are the result of faulty dietary and behavioral pattern of person. Dietary and behavioral pattern of should be modified for the management of these lifestyle diseases. Here, stress should be focused on the health and promotion of the diseases rather than management of the disease. Here is the short form of all brief details in which dinacharya and its all elements are explained with their uses. Brahma Muhurta is used to decrease the mental issues like anxiety, depression. Vyayama improves blood supply in the remote tissue, strengthen muscle, and increases ability to do work. Ushapana boosts digestion, helps to relieve constipation, boosts skin health. Shauchakarma, it keeps gut healthy and digestion proper, helps to prevent anorectal diseases like hemorrhoid, rectal cancer, fistula, etc. Danta Dhavana and Jiva Nirlekhana, it helps to improve of it helps in improvement of our digestion, promotes normal saliva secretion, imparts bad breath, and also helps to cover foul smell of mouth, helps to prevent halitosis, gingivitis, and indigestion. Anjana helps to keep our eye healthy and prevent from diseases. Nasya and Dhumapana helps to prevent eye, ear, and nasal diseases, early graying and falling of hair, migraine, any type of headache, sinusitis, etc. Kavala and Gandusha helps to promote the health of vocal cavity, prevents burning sensation of mouth, tooth sensitivity, ultimately shaking of teeth, mouth ulcer, excessive thirst, etc. It strengthens teeth, avoid cracked lips, prevents bad breath, and improves voice quality. It should be done daily for good and lustrous skin, improvement of vision and delaying of aging, etc. Abhyanga works as a acupressure, help to improve blood circulation and even subsides pain. Snana helps to prevent skin diseases, burning sensation of body, pruritus, excess sweating, etc. Udvartana, it is Vata Kapha Hara, makes body parts strong, makes skin bright and lustrous, open up pores of skin, normalizes Bhrajak Pitta situated in the skin, elevates foul smell, itching, heaviness of the body. Conclusion. Hence, Dinacharya provide proper solution in achieving better health, positive attitudes, and prevents lifestyle disorders by keeping physiological functions in normal condition. Whatever points presented here, it is only for the well-being of human life. Lifestyle disorders can be easily prevented by applying these in day-to-day life. Thank you.
Thank you, doctor. Next, I invite Dr. Amran Chand Sheikh. I invite Dr. Amran Chand. Hello, Dr. Amran.
Hello. Hello.
Hello, Doctor.
Hello.
Doctor, please.
Hello. Good evening, ma'am. Am I audible, ma'am?
Audible, doctor.
Start.
Doctor, please start the
Yes,
session,
doctor.
doctor.
Yes.
Please start the session, doctor.
Okay. Okay.
Visible or not visible?
Hello. Good evening, everyone. My name is Dr. Amrin Chand Sheikh. I'm from Sani Guruji Hospital. My topic is Bhagandara, Fistula Nano Management by Kshar Sutra. Next slide, sir. Introduction. The word fistula is derived from a Latin word reed, which means the pipe or fluid. A fistula in ano is an abnormal tract which has an external opening in the perianal skin and internal opening in the anal canal or rectum, and this tract is lined by the unhealthy granulation tissue. When Vedna Yukta Shofo, that is painful swelling, is formed in Buddha Pradesh within the vicinity of 2 angul, which becomes pakwa and causes dharan in Bahya Buddha and Basti Pradesh, then it is called as Bhagandara. Prevalence of fistula in ano is considered second to hemorrhoids among all anorectal abnormalities. Next slide, sir. This disease causes discomfort and pain to the patient, which creates problems in routine work. As the wound is located in anal region, which is more prone for infection, thus takes long time to heal and the condition remains troublesome. Operative procedure often leads to the complications like recurrence and incontinence. Treatment of fistula in ano is always challenging situation for the surgeons as well as for the sufferers also. To overcome such complications, Ayurveda is explored. Acharya Shushruta gave various treatment approaches for Bhagandar. One such technique is Kshar Sutra, which was later elaborated by Acharya Chakradatta. The method of preparation of Kshar Sutra along with its application has been narrated in Chakrapani Tika and Rasatarangini. Acharya Shushruta has mentioned that Kshar is best among all surgical and parasurgical measures. Kshar prepared with his method is said to have Tridoshagna property because it is prepared with many drugs. The principle of Kshar Sutra is to maintain adequate drainage of the tract as well as excise tract gradually. Kshar Sutra proven as the boon for the treatment of anal fistula. Case history. This is the case of 32-year male patient complaining of boil near the anus. On and off was discharged from the boil since 1 year. Condition aggregated since 1 month. Per rectal examination revealed the fistula with the external opening at 11 o'clock position with internal opening in the anus. This is the MRI fistulogram of the patient, which shows the transsphincteric fistula, which is having external opening at 12 o'clock and internal opening at 11 o'clock position. Preparation of the Kshar Sutra. Kshar Sutra was prepared by the standard method at the guidelines using Apamarga Kshar, latex of Snuhi, and Haridra powder, and linen number 20. Next slide. Sir. These materials are used for Kshar Sutra preparation, that is Snuhi, Haridra, and Apamarga Kshar. Procedure. The patient was made to lie in the lithotomy position. Under aseptic precaution, after Lord's anal dilatation, probing was done and Kshar Sutra was tied with a moderate tightening. Patient tolerated the procedure well. There was no bleeding per rectum, dressing was done, and thread change once a week. Patient was prescribed with the internal medications for 2 weeks, like Gandhak Rasayan 2 tablets 2 times before meal and Sukshma Trifala 2 tablets 2 times before a meal. Gandharva Haritki 2 gram with a warm water at bedtime, externally Jatari tel for local application, and hot seat bath was advised twice a day, and buttermilk morning and night. Result: the patient has no pain, boils, and first discharge when examined after 8 weeks of Shar Sutra. Discussion: the Shar Sutra is the hallmark of Ayurvedic surgery in present era. Shar Sutra is probably one of those modalities in Ayurvedic surgery which has gained popularity and acceptance globally. Ideal surgical treatment for anal fistula should aim to eradicate sepsis and promote healing of the tract while preserving the sphincters and the mechanism of incontinence. Virechana is the initial line of treatment mentioned by the acharyas for treating Bhagandar. Once the tract got obliterated due to Kshar, Virechan Karma was planned to remove the vitiated drugs. Gandhakrasan and Sukshma Tripala helps in postoperative wound healing and found equally effective in preventing the secondary infection, as the secondary infection is high because there is a presence of discharge from the tract till the thread is in situ. Avgaha Svet, that is hot seat bath, promoted relaxation of the anal sphincters and also the relief from soreness, burning, and inflammation. Do's and don'ts advised by the Acharya Shushrut. Shushrut has advised that even after the healing of fistulous wound, the patient should avoid heavy exercise, sexual intercourse, riding on animal, and heavy food for year. These are the activities which directly or indirectly have effect on anal region and therefore can lead to recurrence, an area which is often ignored or contemporary science. Conclusion: cases of fistula have been raised in few decades. Char Sutra therapy is radical cure in the treatment of Bhagandra without complications and recurrence. Char Sutra therapy can be done in small setup with minimal equipments and instruments. The patient remain ambulatory during the whole course treatment. It is simple, safe, and sure short treatment for anal fistula. Bleeding during procedure is minimal. And these are the references of my paper. Thank you.
Thank you, Dr. Amrit.
Thank you.
Next, I invite Dr. Aishwarya.
Good evening, ma'am.
Good evening, Doctor.
Am I audible, ma'am?
Yes, yes.
Ma'am, I need to share the screen or they will share?
If you can, then please.
Hello, ma'am. Can you see my screen?
Yes, Doctor. Yes, it's visible now. Please start.
Okay, ma'am. Good evening, everyone. I am Dr. Aishwarya, third year PG scholar, Department of Shalya Tantra, Sri Jayendra Saraswati Ayurveda College and Hospital, Chennai. Today, I am here to present on Ayurvedic approach on clinical research. Research in common parlance refers to search for organized knowledge. It is a movement from the known to the unknown. It is an original contribution to the existing stock of knowledge, making for its advancement. A research process is to find a solution to a specific health problem, to compile the existing knowledge, to formulate hypotheses and objectives, then to decide about a study design, and to get ethical clearance. Clinical research is basically a branch of medical science that determines the safety and effectiveness of medications, devices, diagnostic products, and treatments. It can provide insight into the diagnosis, cause, care, and cure of a disease. There are various references about the research process, specifically in Ayurveda. In the 8th chapter of Vimanasthana, Roga Bishakjitiya Adhyaya, Acharya Charaka has mentioned 3 different means of gaining knowledge of science as Trivida Jnana Upaya. Adhyayana, which refers to learning, Adhyapana, which refers to teaching, Tadvidya Sambhasha, which refers to discussion. The Ayurveda tools and techniques of research and modern methods of research protocol both depends upon observations and experimentation, but the approaches are specifically different. One among the traditional approach of concept of research in Ayurveda is Panja Avayava Vakya. It is described in 44 Vada Marga. It is not only a way to conquer a Vigrahiya Sambhasha, but it is also a way of proving one's research in front of the scientific committee. Coming on to Pancha Avayava Vakya, the Pratignya, it is a statement of a research problem or the hypothesis, whereas Hetu refers to research method, technique, lab tools, a plan of work, collection of data. And the Udharana refers to previous works done regarding the research. And Upanaya is the discussion part of the thesis, and the correlation aspect, assessment, observation of result, everything comes under the Upanaya. And Nigamana refers to conclusion, revalidation of the hypothesis. And next, the Dashavida Pariksha Bhavas, as per Charaka, are the tenfold of investigation in planning for a research. These can be interpreted in a comparative manner. Karana refers to a researcher, whereas Karana means instruments or tools used for investigations. Karya Yoni is a research problem or the formulation of hypothesis in the research. And Karya means aims and objectives and what is the exact purpose of the research. And Karyaphala, expected outcomes of the research and primary secondary endpoints. Anubandha is the long-term effects of research study, impacts of research on society. Desha is the study site, geographical distribution, selection of a representative sample. Kala is the time period of study, whereas Pravriti, it is the initiation of the therapeutic action. And coming on to the last Dashavida Pariksha Bhava, that is Upaya, it is the excellence of researcher, overall planning like formulation of hypothesis, proper selection and definition of a research problem. From the Ayurveda view, the major important term is the Anusandhana. Karya Karana Bhavasya Dravyanam Guna Karmano Pariksha Stapanam Samyak Anusandhanam Uchyati. The study of cause and effective relationship between the Guna, Karma, Dravya after various observation and thorough examinations, and then coming to a final conclusion is the Anusandhana. Clinical research protocol basically describes the background, rationale, design, methodology, statistical considerations, etc. The Department of Ayush, that the Ministry of Health and Family Welfare, the Government of India has published a clinical research protocols for traditional health sciences. So here is an example for the clinical research protocol writing in Parikartika, that is fissure in ano. The background, the anal fissure is a tear in the anal lining. So basically in background, the detailed description about the disease and its references and what are all the common treatments and the complications and the drug to be used and its efficacy of the procedure or drug. And then objectives to find a simple, ample, safe and cost-effective treatment and therapeutic regimen in the management of fissure in ano. And then the sample size has to be estimated and it has to be mentioned 40 subjects per center. And if any group classification is there means which has to be mentioned here. And the duration of the trial is about total 6 weeks or how many days the researcher gonna do the project. Then study of the design, it is an open trial, and criteria for inclusion is selection of cases like irrespective of the age, sex, chronicity, prakriti, type of fissure, pain with or without bleeding per rectum, and or after the defecation, with or without other symptoms like itching, discharge, and constipation. So what are all the researchers' points of inclusion and exclusion criteria has to be mentioned along with the withdrawal criteria. And criteria for exclusion, which are all the disease conditions the researcher want to exclude from the study, that has to be mentioned here. And the criteria of withdrawal, then the basic routine examination and assessment of the drug as well as the disease, then the pain grading scale and the assessment parameters. Then coming on to the statistical analysis, that is based on the intensity of the pain, duration of the pain will be tabulated, analyzed by using appropriate statistical methods. At last, ethical review should be added. It is by ethical committee, data and safety monitoring board, and the laboratory investigations. So after the complete protocol, the following attachment has to be added. That is a written informed consent form, case pro forma, laboratory investigations, consolidated data on periodical observations. Then what is the importance of research here is that it is the backbone for the progress of a medicine to overcome the gap between our education and the recent advances in the medicine, to bridge the dissociation between the research, education, and research practice. Clinical literature of Ayurveda has encapsulated wisdom of protocols for documentations and research in Ayurveda. By making use of the reference of research process in Ayurveda, more studies can be conducted to enhance the understanding and application of Ayurveda using Ayurveda protocols, which has been mentioned by our acharyas. Thank you.
Thank you, doctor.
Thank
Thank you, doctor. Next, I invite Dr. Prathamesh. I invite Dr.
Yes,
Prathamesh Pradap
yes,
Rathod.
ma'am. Hello.
Hello, doctor. Please start.
Yes,
So,
doctor.
myself, Dr. Prathamesh Rathod, PG Shalyatantra, Sumtibai Shah, Ayurved Mahavidyalaya, Hadapsar, Pune. Today's my topic is Jalokacharan in the management of ankle sprain, Vata Kantaka. Next slide. Introduction. Ankle injury are a huge medical and socio-economic problem in many people have traumatic injury of ankle, most of which are results of sports. An ankle sprain results when the ankle is twisted and inverted. The term sprain signifies injury to soft tissue, usually the ligaments of ankle. We are correlated ankle sprain with a Vatkantaka. Initially, ankle is swollen, painful, ecchymotic, initially swelling actually bleeding into the surrounding tissue. The ankle swells and extra fluid continues leak into the surrounding tissues. Leeches have been used for medical purpose since the era of Ayurvedic medicine. Acharya Sushruta and Vagbata describe Jalokacharana for the Raktamokshana. Acharya describe Raktamokshana for the Varnoshopa reduce pain, avoid suppression of Agantuka Shota, described in Ayurvedic cases, symptomatologically such as Shud, Sparsha, and Daha. Whereas the ankles describe a modern size can be correlated with a Gulpa Pradeshi Agantuk Shota traumatic injury. Next test. Case history. A 32-year male patient allied history of trauma by falling around 2 days before. Now patient complains of pain and swelling over right ankle joint. On examination, tenderness at right ankle joint, swelling present and restricted movement present. Radiographic diagnosis. If the injury has been simple sprain, the talus remains stable in the mortise. If the lateral ligament tears is complete, the ankle occur with greater trying talus. So actually, next slide graphically problem is hello.
Only 4 slides are available in your submitted
Next,
PPT.
sir, there are continuous slide will be shared. With a technical issue, so cannot be answer. Thank you,
1
sir.
minute, doctor.
Thank you, sir. Hello. Hello. Hello.
Hello, doctor.
Hi. Hello. Huh. Next slide, sir. Procedure. Purva karma. The patient have disorder to be treated with application of leeches should be made to sit or lie down, and the site of the lesion is painless. It should be dried by rubbing with powder earth and cow dung. Pradhan karma. The leeches then have been anointed with a mixture of mustard and turmeric paste in water should be taken. Place in a water pot for a muhurta, and when refreshed should be applied to the diseased site. Their mouth should be covered with a fine wet white cotton swab. In case if they do not suck the blood, a drop of milk or blood should be applied. Even if they do not suck the blood, another way will be applied. When it enters the opening, the mouth like horse hoop and raising its shoulder, it is sign that is sucking the blood. At the stage, it should be held after covering with mostyn cloth. On covering with mostyn cloth, the leeches is relaxed and sucks the blood quickly. Leeches, by their nature, first draw heated blood as the swan takes only milk from the culture of a male and water. If at the site needling pain and itching appears, it indicates us that the leeches is seeking the pure blood and then it should be removed. If does not leave due to the smell of the blood, its mouth should be sprinkled with powder of rock salt. Next slide. Next slide. Paschat karma, when fallen is bowed, should be anointed with the rice chaff and mouth massage with oil and salt. Then holding by tail with left thumb and a finger, it should be gently passed upward to the mouth with the right thumb and finger so that it vomits till sign of proper vomited. On placing in a water pot, it moves around with desired aid. The one which is depressed and does not move should be known as improperly vomited, since such as list should be vomited properly only. By improper vomiting, an incurable disease occurs to them known as Indramada. The properly vomited must be preserved as a before. Next slide. Result: patient had no plain spelling and restricted movement when examined after 4 days. Next slide. Please. Discussion. Jalauka is one of the oldest methods used to extract deeply rooted, contaminated, and pacify doshas to cleanse the body. Diseases are induced due to the dosha's variation. According to Ayurveda, dosha get accumulates in strotas, causing the strota overgrowth and leading to many illness. Saliva leeches contains a variety of bioactivity components that have antioxidant, anti-inflammatory, anticoagulants, vasodilator, anesthetic, antibiotic, and properties that function under the various conditions of illness via multiple mechanisms. Jalokavacharana increases the blood flow through its anticoagulant properties, which improves the local circulation and also suffices the nutrient. Jaloka's anticoagulant property was described by modern scientists in 1980, but our Acharya has had the knowledge since the Vedic times from scientific perspective. Next slide. Next slide, please. Conclusion. Leech or Jalauka therapy is an ancient technique of Ayurvedic blood letting that has the enormous ability to treat the condition of inflammatory, ischemic, and infectious diseases. Saliva leech contains a variety of bioactivity components that have anti-inflammatory, anticoagulant, anesthetic, vasodilator, anesthetic, antibiotic, and antioxidant properties that function in various conditions or illness via multiple mechanisms. Most bioactive ingredients are still unexplored knowledge of the mechanism of action of bioactivity compounds found in leech saliva limited. Extensive studies are therefore needed to find out the precise mechanism, the operation of a different bioactivity factor in order to restore conventional therapeutic ability to scientific basis. Next slide. Sir. These are the references, several references for Jalauka. Yes. Thank you, sir. Thank you, sir.
Thank you, doctor.
Thank you. Thank you, ma'am. Thank you.
Next, I invite Dr. Mayukha Madhusudanan.
Good evening, ma'am. Am I audible?
Yes, doctor, you are audible.
Yeah. Trying to share my screen. Is my screen visible?
Not visible,
No,
doctor.
doctor.
Uh, Now,
Not visible, doctor.
having a difficulty in share. Just a minute.
Doctor, you have any problem with screen sharing?
Yeah, screen sharing appears to.
Don't worry, doctor. I will share for you.
Okay.
Doctor, please start the session, doctor.
Thank you. Myself, Dr. Mayukha Madhusudanan, from the Department of Cardiac and Jayendra Sarkari Ayurveda College in Chennai. So my topic is foot arch deformities and leading to Kadara and its management. So these are the contents of my slide of my presentation. I'll go into the introduction. Right. So when we see cases in clinical practice, those who present with Kadara, almost 50% of the cases they come with they will have some kind of an associated foot abnormality, anatomical abnormality. So foot is one of the least understood structures of the human body. So it is a very complex structure with 26 elements and skeletal elements and numerous ligaments, tendons, and intrinsic and extrinsic muscles. So the foot is being increasingly studied as a multi-segmental structure with complex three-dimensional kinematics. So commonest presentation on a foot is a foot pain, out of which corn and plantar fasciitis are the most common presented conditions. So going into Kadara, it's a Kshuddha Roga, and the Nirukti is Vayuna, Pada Vishishta Bhagam, Drinati, Dareti, Nashyati, Iti Kadara. This is from Shabda Kalpatrumam. So the Nidana is Sharkara Unmathana or Kshata by a Kantaka or a thorn. So the dosha that is vitiated here is Vata and Kapha. Dushya, the Medas, along with the Medas and Rakta. So the presentation is like a Kola Matra Granthi with Ruk and Strava. So Kadra can be correlated to the present term foot corn, also called a heloma. So there, it is a hyperkeratosis of the skin in pressure pairing areas, most commonly found in the soles of the foot and in the interdigital web spaces. So the cause may be attributed to repeated friction over a certain area of the skin. So this symptom is caused by ill-fitting shoes or continuous walking and running barefoot or anatomical foot deformities. So the prevalence is around 38 in 1,000. This is a global ratio. It is found to be more in the labor occupied people here in India. So the types can be divided into a hard corn and a soft corn. So, so the causes in general terms can be broadly divided into lifestyle related and anatomic conditions. So in lifestyle related, it is improper biomechanics of the foot, high heeled shoes or foot that is it is in a less than ideal position for walking, shoes and or hoisery fitted too small or too big. And anatomical conditions, the arch deformities of pes planus and pes cavis. Then we have bunions and bunionettes, deformities such as hammer toe, claw toe, and also the loss of fat pad on the bottom of the foot. So going into the arch deformities, First, we will go into we will look at pes planus or the flat foot. So it is a loss of the medial longitudinal arch of the foot, heel valgus deformity, and median talar prominence. So it may be physiological or it may be pathological. So the prevalence, it is less than 1%, or in some age groups, it may go up to 28%. The females are more predisposed than males in pes planus. So etiology, it can be congenital or acquired. So the presentation here will be an uneven distribution of body weight with resultant one-sided wear and tear of the shoe, leading to further injuries like foot con. So here, the con mostly occurs in the medial aspects of the sole, both the heels and the balls of the foot. Next is the pes cavus or the claw foot. So here, the foot with abnormally high plantar longitudinal arch. So there may be too much weight and stress on the ball of the foot and all on the heel of the foot while standing and or walking. The spectrum of associated deformities are clawing of the toes, posterior hindfoot deformity, contracture of the plantar fascia, cock-up deformity of the great toe. So the etiology here is mostly, it is caused due to some underlying neurological condition. The cause and the underlying mechanism is still not very well understood. In pes cavus, the presentation of con is mostly on the ball of the foot behind the great toe as well as just behind the fifth toe. So now, if you look at the management, the line of treatment may be divided as the management of the arch deformity and the treatment of kadara. So the arch deformity can be managed depending upon the condition. It may be managed medically or just a conservative approach may be enough, or surgical intervention may have to be done. So treatment of kadara, agni karma, kshara karma, chedana, and lepana are the common treatment modalities used in Ayurveda. Whereas if we see in the modern, we will see salicylic acid pains, concaps, and sometimes surgical ligation also. But most of these conditions are found to be recurrent, causing recurrence. Next slide, please. So the management of pes planus. So if you look at a medical angle, the treatment is based on etiology. Whatever the causative is, will have to be treated. And NSAIDs may be given as a painkiller. So surgically, it is considered in rigid pes planus and cases which are not responsive to therapy. So here the aim is realign shape and mechanism. So surgery involves tendon transfers, realignment, osteotomies, and arthrodesis. Conservative here, some external support is given. So counseling on the use of proper footwear, recommendation of motion control shoes, orthotic have insoles. Sorry, I lost the screen. So insoles may be used or ankle foot orthosis can be used. Next slide, please. So in the management of a claw foot, again, medical, surgical, and conservative approaches. Medical is the same. Surgical reconstruction, this produces a plantigrade foot and pain relief. So if the deformity is considered, surgery may have to be done. Transfers and osteotomy. So the conservative approach is stretch of the tight muscles and strengthening the weakened muscles. Orthotic with extra depth shoes may be used, and lateral wedge sole modification may also be given to the sole. Next slide. So if we look at the concept of management with Ayurveda, here we will have to look for a management of the foot deformity. It is not completely reversible or corrective, but some supportive kind of management may be given for the foot. And then comes the management of Kadara. So here foot deformities as such, we don't have any direct references. So it can be considered as a Snayu Vikara since Ayama, Kubtatva all have a similar kind of a concept. So the principle there in Snayupata Vikaras may be brought in here also, where we can give Snehasvedam, Bandhanam, and some kind of a supportive factor. So if you look at the management of Kadara, Agni Karma is the most common and the most efficacious treatment here for Kadara. So Dahana is usually done after Chedana. And between the Ruksha Dahana and Taila Dahana, out of clinical practice, I personally found that Taila Dahana has a superior effect in comparison to a Salaka. So recurrence rate is lower than any other treatment modality. Any Agni Karma has a low recurrence rate. Next slide. So coming to the take home point. So the though direct mention of food abnormalities is not there, concept from Vata Vyadhi, especially Snayu Vata, can be applied here. And Ayurveda provides an alternative conservative approach to surgical management of food deformities. The conservative of food deformities should go hand in hand with the management of Kadara. So this will help in keeping the patient comfortable and also in preventing the recurrence. So next slide is the references. Then I acknowledge the support given by Dr. Vasudeva Reddy, Dr. Anita Patna, and Dr. Sapa from the Charlia department. Thank you.
Thank you, doctor. Next, I invite Dr. Rujita Lokchand.
Hello, ma'am.
I invite
Good
Dr.
evening.
Rujita. Hello,
Hello,
doctor.
ma'am. Good evening, ma'am.
Good evening, doctor.
1 minute, ma'am. I'm gonna sharing my screen.
Your screen is visible, doctor. Please start the session.
Okay, ma'am. Okay, sir. Thank you, sir. Myself, Dr. Ruchita Lukchand Kamgate, MD final year from Komar Bhutta Department, Yeshwant Ayurvedic Medical College, Kodoli, Kolhapur. My guide is Dr. P.K. Das, sir, HOD of the department. My today's topic is COVID-19, an approach to the prevention and management through Ayurveda. Introduction. The novel coronavirus, termed as COVID-19, belong to the coronaviridae family of viruses and consist of core of genetic material surrounded with an envelope of protein spike which gives the appearance of a crown. Coronavirus causes diseases ranging from common cold to severe acute respiratory syndrome, that is SARS, and the Middle East Respiratory Syndrome, MERS. Lung pathology found in CT scan of patients suffering from COVID-19 is similar to the other coronaviruses such as SARS and MERS that previously caused outbreaks. The first in December 2019, first COVID-19 case found, that is in China, Wuhan. WHO declared COVID-19 outbreak as a global pandemic in March 2011. As of 20 February 2022, India reported total 42851 confirmed cases, including 512344 death because of COVID-19 infection. Therefore, apart from the standard hygiene practices, prevention of the spread of viruses has become necessary. The beneficial effects of Ayurveda medicine in communicable diseases are known to improve the quality of life. As this critical period of limited therapeutic options, Ayurveda can play a significant role as an immune modulator and for symptomatic treatment of COVID-19 infection with an ultimate aim to save the people. Now, the concept of epidemic disease according to Ayurveda. According to Charak Samhita, Acharya Charak has described the concept of Janapadadhansa that is comparable with concept of epidemic diseases. Factors which are common for all people of a country are Vayu, that is air, Jala, that is water, Desh, that is habitat, and Kal, that is season. Either the season aforesaid, 4 factors will be vitiated, leading to mass annihilation of the inhabitants of the country. According to Sushruta Saita epidemics, Acharya Sushruta described about certain infections and contagious diseases, that is Sansargaj and Upasargaj Vyadhis, and the mode of transmission of these diseases from person to person. In view of above, according to Ayurveda, COVID-19 pandemic can clearly be considered as a Janapadadhansa Vikara. Now, the management of COVID-19 according to Ayurveda. According to Ayurveda, disease is resultant of imbalanced dosha and dusha, which happens due to low immunity, that is Shina Vyadhi Shamatva. So to get rid of disease, we should use those dravyas which are useful to improve the immune system. Rasayana is one of the branches of Ashtanga Ayurveda, wherein various formulations have been described for rejuvenation, immunity enhancement, and to delay the aging process. Such preparations are considered to be immunomodulators, which may be either disease-specific or general wellness. Rasayanas are believed to have antioxidant, anti-stress, and immune booster and modulator effect. Broad spectrum antiviral activity of herbs, that is Ocimum sanctum, Gingiber officinale, Tinospora caducifolia, Andrographis paniculata, Glyceriaceae glabra, Triphala, and Tricadu has been reported, and decoction of combination of these herbs is recommended. Mass prophylaxis use of Brahma Rasayan, Chavanprash Rasayan, or Amrit Bharlataki Rasayan can be useful, as these rasayanas are generally prescribed for respiratory tract infections. Next one is dhupan, that is fumigation, is one modality of disinfecting rooms and environment described in Ayurveda. Several drugs that are generally used for fumigation are gugud resin, Indian mustard seed, garlic peel, turmeric powder, hing, ajwain seeds, devdaru, and loban. It may prove to be useful tactic for disinfection. Now the government of India, Ayush department, prescribed some immunity boosting precaution, that is drink warm water throughout the day, daily practice of yogasana, pranayam, medication, use spices like turmeric, cumin, coriander, and garlic in cooking. Next, then the simple Ayurvedic procedures that anyone can follow in home also, that is nasal application of sesame oil, coconut oil, or ghee in both the nostril, that is pratimarshanasya, in morning and evening. Oil pulling therapy, that it take 1 tablespoon sesame or coconut oil in mouth. Do not drink, that is swish in mouth for 2 to 3 minutes and spit it, followed by warm water rinse. This can be done once or twice a day. During dry cough or sore throat, steam inhalation with fresh pudina, that is mint leaves or ajwain, can be practiced once in a day. Lavang, that is clove powder mixed with natural sugar, honey, can be taken 2 to 3 times a day in case of cough and throat irritation. These measures generally treat normal dry cough and sore throat. However, it is best to consult your doctor if these symptoms are persist. Then that is in systematic management of COVID-19, we can take 500 mg extract or 1 to 3 gram guduchi ghana, that is Tinospora caducifolia vati, or the powder of Tinospora caducifolia twice daily with warm water for 15 to 30 days. And take 375 mg guduchi plus pippadi with warm water for 15 days. Take 50 mg Ayush 64 twice daily with warm water for 15 days. Now then my next slide is conclusion. Apart from the recommended standard hygiene practices, following social distancing, isolation, and the use of face masks have become the necessary to prevent the spread of COVID-19. These mandatory norms in new normal situation is triggering stress, which may play a significant role in down regulation of the immune responses, which may result in high risk of susceptibility to infection. Ayurveda can play significant role in immunity boosting, that is prophylactic adjuvant treatment in the scenario. They are cost effective with negligible side effects. Research studies may be recommended to evaluate the efficacy of Ayurvedic medicine in positively influencing the clinical course in those who developed COVID-19 in terms of reduction in severity of signs, symptoms, duration of hospital stay, requirement of life support, and onset of complication and mortality. Thank you, sir.
Thank you, Dr. Ruchita. Next, I would like to invite Dr. Bhaskar Subhas Jadhav for the paper presentation on the topic Importance of Rasayana in the Management of Pranava Shots. Dr. Bhaskar, are you there?
Good evening, sir.
Good evening,
Good
Doctor.
evening, sir.
Please
My
share the
voice
screen,
is
Doctor.
audible.
Audible, Doctor. You are audible, Doctor. Please share the screen, Doctor.
My slide is visible, sir.
Not visible, doctor. Hello, Dr. Bhaskar Jadhav.
My file is audible, sir. Visible.
Slide is not visible, doctor.
Hello. Still not visible.
Still not visible, doctor.
Just 1 minute.
Okay, doctor. Doctor, you have any problem with screen sharing, doctor?
Yes, sir. I have problem
Don't
with
worry,
the screen
doctor. I
sharing.
will share for you, doctor.
Okay.
Okay.
Okay, sir.
Doctor, please start the session, doctor.
1 minute, sir. Thank you, sir. My topic is the importance of Rasayan in the management of Pranavasotas. My name is Dr. Bhaskar Jadhav. My guide is Dr. P.K. Das, sir, which is HOD of the department and PhD. Introduction. Ayurveda is the basic science traditional medicine system in India, considered as the Balrog, Shishu, Bala, Komar, Vaskana, under a Komar Gutya, and mention different therapeutic treatment in childhood disorder. The herbo mineral formulation included such as the rasayan in Ayurveda, prepared using the metal and mineral, along with the herbs treatment of the various diseases and disorders. The defined concept of the size reduced, involving improving the potency of the herbo mineral formulation, and the ancient literature reported use to herbo mineral formulation for the treatment of the childhood disorder. The use of therapy of rasayan Komar with the needed to great attention toward the doing the frequency to prevent and chances of the adverse effect of Ayurveda. Next slide. Aim and objective. To study the detail regarding importance of rasayana in the management of pranavasotas, and second objective to study the use of herbomineral formulation for the treatment of various childhood disorder in Ayurveda. Method and material. The material will be collected from the classical Ayurveda literature, magazine and research journals. Rasayana. There are the two words in Rasayana. Rasayana compare as the first word Rasa and second is ayan, that is fluid or juice. Ayan means that the pathway. Hence the word Rasayana means the path of the juice. It is the means of the ones excellent in Rasa known as the Rasayana. Laterally, the technique term is the Rasayan referred to be obtain the optimal nourishment to the dhatus. According to Shushrut Samhita, the substance which decreases the aging process, increasing the longevity and increases the mental and physical strength, which destroy the disease processing called as the rasayana. According to Charak Samhita, the substance which is the invigorated the healthy person by producing the best quality of rasa, rakta dhatu, and the dhatus in rasayana. In Ayurveda, textbook Rasayana is defined as a drug, diet, or a regimen which destroy the old age and the disease, called as Rasayana. That is, the taking the Rasayana, we always remain the healthy and young. That means you are the young old age perform your normal duties. According to Ayurveda, the rejuvenation take place so the person can be become healthy and explore the spiritual aspect of life. There are four rasayan: kamya rasayan, prana kamya, medya kamya, shira kamya, and naimitic rasayan. Next slide. Kamma rasayan, it is the fulfill to desire. It also be used for promote general physical and mental health. Pramya rasayan, it is used to achieve the best quality of prana, that is life energy in body. And Medya Kamma, it is the enhancing the memories and intellect. Shri Kamya, it is used to promote the complexion. Nimitta Rasayan, it is due to the covert and balancing the specific cause of which can cause disease in body. Rasayan in Pranavasota. Rasayan, Ras and Iron. Tantra is the branch of come under the branch of Ashtanga Ayurveda, which overall used to enhance longevity, intelligence, and immunity. The Rasayan, Ras and Iron Shastra also involve use of the metallic formulation along with the herbs. In Ayurveda, Guduchi, Shankapushpi, Jatamansi, Madhuparni, etc. are the considered as the Rasayan. Rasayan boosts the function of Dhatu, Agni, Srotas, Ojas, and therefore the rejuvenant. Chyawanprash Rasayan is used as a Kash Shwasar according to the Charak Samhita, which is used in children. In Ayurveda, the various herbal metallic formulation which may be used in children for different therapeutic purpose, such as the Swarna Bhasma, Vacha, Madhu, Grita, Panchamrut Grita, Brahmi Grita, Abhaya Grita, Amvardhan Grita, Madhu Bhasma, Loha Bhasma, etc. Formulation of the Swarna and herb, Vacha, Brahmi, along with the honey and ghee, utilized in newborn babies in improving their immunities and mental health. In Suvarna Prashan, raw gold after rubbing stone with the little amount of water and with honey administered to the newborn babies. This type of formulation process many therapeutic activity like antioxidant property, immune modulator activity, and also improving the Agni. The Ayurveda suggested Swarna Prashan with the precaution measuring to enhance intelligence and the immunity in the children. Triphala Rasayan and Amalak Grita having the property of Tridosha Shama, reduce the Vat, Pitta and Kapha. In Kasa, Pranava Srotas is used as a Kapha Kasam. Bhallatak Rasayana in Charak, Kapaj Kasa Vibhanti. Pippale Rasayan, Kasha Shwasa and Hitta Gamana. Last conclusion, the paper English managed of comorbidity using the various ancient approach of the Ayurveda science such as the Rasayan with the herbal remedies. This purpose to mention the importance of the Rasayan in management of Pranava Srotas. Although use of Rasayana in comorbidity must be carried out and care. Rasayan therapy may be used early age, but precautionary measurement and as per requirement. The disciplined lifestyle also play an significant role in management of Pranava Srotas. Thank you. Thank you, sir.
Thank you, Dr. Bhaskar. Next, I would like to invite Dr. Neha Ashok for the paper presentation on the topic Rasayana Chikitsa Rejuvenation Therapy in Menopausal Syndrome. Dr. Neha, are you there?
Yes, sir.
Okay, doctor.
Sir, can you share my PPT?
1 minute, doctor. Doctor, please start the session, doctor.
Yes, sir. Thank you, sir. Myself Neha Ashok Bhangire. I am from SMBT Ayurved College Dhamangao. My guide name is Prashant Patil. My topic name is Rasayan Chikitsa Rejuvenation Therapy in Menopausal Syndrome Review. Abstract. Menopause is referring to end of reproductive period and starting of aging problem due to lack of ovarian hormone. There is no direct reference found in Ayurveda regarding menopause, but Jaravastha mentioned by Sushrut can be correlated as Rajanivritti Janya Lakshana. Jarapakva Avastha in female is widely known as Rajonivritti Kal, that is menopausal stage. Rasayan Chikitsa, rejuvenation therapy, is the unique therapy contributed by Ayurveda, particularly effective in reducing the aggravation clinical features and problem during old age. Rasayan drugs promote the regeneration of dhatus, intelligence, mental well-being, immunity, and longevity. So, Rasayan drugs are helpful to decrease aging related problems. Present review is an effort to understand the efficacy of Rasayan Chikitsa in menopausal syndrome. Aim of my study to study the effect of Rasayana therapy in the management of menopause. Objectives to study the efficacy of Rasayana therapy in the management of menopause, to study the etiopathogenesis of Rajanivritti Janya Lakshana as per Ayurveda, to study the literature of Rasayan therapy. Introduction. Menopausal syndrome is common problem in today's era due to stressful and changing life. Menopause means permanent cessation of menstruation and ending of young age due to deficiency of hormone, that is estrogen, which is denoted as female hormone. Menopause is the time when last and final menstruation occur. Though menopause is an physiological phenomenon, many psychological changes occur. Those are those are not considered as disease condition, affecting multi-system and manifested with various symptomatology known as menopausal syndrome. This period usually occurs between 45 to 55 years in most of the women. Management of menopausal symptom in modern medicine is done by hormone replacement therapy, which result in multiple complications as the breast cancer, coronary artery disease, etc. Menopausal symptoms will affect the health of women, so there is need for its management. Importance of present study. Menopause is an estrogen deficient phase of woman life which accelerates the aging process, resulting greater vulnerability to psychosomatic problems and make her life dependent. Characteristic features are hot flush, bouts of rapid heartbeat, sleep disturbance, mood swings, night sweating, disturbing memory lapse, developing senile vaginitis due to dry vagina, loss of libido, and osteoporosis. Variation in premenopausal phase leads to mood swings, depression, anxiety, obesity, hypertension, diabetes mellitus, and cancer are more prone in menopausal women that need medical help. Material and methods. Information regarding menopause was collected from modern and Ayurveda literature. All the literature was especially studied for therapeutic use of Rasayana therapy in Rajonivritti Janya Lakshana and taken into consideration. Original articles, research papers published in journal and in PubMed, Google Scholar on Rasayana therapy and menopause. Rajanivritti. Rajanivritti is not described separately as pathological condition or severe health problem in Ayurvedic classic. The ancient Acharya term it as a normal physiology. The term Rajanivritti is made up of two different that is Raja means Artha, Nivritti means end or ceasing. Age of Rajanivritti. According to Acharya Sushrut and various other references to 50 years is mentioned as the age of Rajanivritti. Acharya Arun Datta opinions that the age mentioned above is the probable age and not a fixed one. There may be some variation in this regard. Nidan of Rajanivritti. As Rajanivritti is not mentioned as a disease in Ayurveda, hence Nidan Panchaka of Rajanivritti is not available in Ayurvedic classic. It can be considered under Swabhava Bal Pravrutta Vyadhi. Acharya Sushrut has mentioned a group of natural occurring disease under the heading of Swabhava Bal Pravritti, includes Shudha, Pipasa, Nidra, Jara, and Mrityu, which occurs during Jara Avastha. Other factors related with this are Kal, Vayu, Karma, Dhatu, Kshay, and Abhighata. Kal is factor responsible for Kshay and Vriddhi, as well as it is It is a cause of Bala, Taruna, and Vruddhavastha. Jaravastha is a span of life which is dominant of Vata dosha. Vata dosha is responsible for Shaya of all dhatus. This generalized Dhatu Kshaya causes Kshaya of all dhatus, hence leading to Artha that is Rajonivritti. Why Rasayana therapy? लाभोपायो हि शस्त्राणाम रसादीनाम रसायनम रसायन तंत्र नामम वयस्थापनम आयुर्मेधा बलकरम रोगापहरणम समर्थम च श्रेष्ठानां रसरुधिरादीनां यो लाभोपायः स रसायनम उच्यते. Rasayana are the drugs, diet, or regime which optimum quality of the bodily tissue due to which it provides both mental and physical health, prevents aging and disease, retard aging and provide nourishing of all of vital enhance, thus enables to live or longer for longer period of youthfulness. Acharya Charak has specially mentioned that use of rasayan delays senses or old age. Na jaram, na cha daurbalyam, naturya nidhanam na cha. All these features are either reduced or lost with the advancement of age. Thus, rasayan keeps the main motto of fulfilling the drawbacks of senses. Rasayana therapy simultaneously affects the body and mind and bring out physical and psychic improvement, and by that prevent the aging. As Rajo Nivritti is also manifest as a part of aging, it should be treated with Rasayana therapy. Some commonly used and easily available herbal drug useful as a rasayana, that is guduchi, haritaki, amlaki, shatavari, sariva, vacha, ashwagandha, yashti madhu, shankh-pushpi, brahmi. Mode of action of rasayan drug. Rasayan drugs which act on rasa, direct nutrition to plasma, agni, digestion and metabolism, strotus, microcirculation and tissue perfusion, uh, Rasayan Prabhav, antioxidant. In this way, it works as a improved nourishment or labhopayo hi shastanam rasadinam rasayanam. In this way, improve quality of tissue, slow down degenerative changes and rejuvenation. Discussion. This action of rasayana extends from rasadhatu to shukradhatu and hence even up to ojas, which is a prime media between the physical and psycho-intellectual performance. In this way, the rasayana are essentially molecular nutrients for different organs and tissue, which helps in sustaining the vital nutrition and assist in repair and regeneration of the system. This type of repair and regeneration is needed in Rajanivritti Avastha, which is a result of aging as well as decrements of dhatu. Mode of action of rasayan. Conclusion. Rasayana therapy can be used at different stages of alive the Rajanivritti Janya Lakshana, like during active reproductive period of woman as a preventive aspect, so that the climateric symptoms do not after establishment of climateric symptoms as curative aspects to improve the quality of life. In later stage of Rajanivritti to prevent the
प्रेझेंटेशन आहे हे बघ ना आता इथं आहे माझं
long-term depletion of
आणि मॅडम जेवून गेली का?
Hello.
नाही नाही
Hello,
Hello.
doctor. Please continue, doctor.
As Rajanivritti deals with Jara Avastha, Rasayan therapy is the line of treatment and for prevention of longer term effect of depletion of dhatu. Thank you.
Thank you, Dr. Neha. Next, I would like to invite Dr. Sandeep for the paper presentation on the topic mode of action of Shirish Toka Churna in the management of childhood asthma in children. Dr. Sandeep, are you there? Hello, Dr. Sandeep, are you there? Okay, next I would like to invite Dr. Salman Patel for the paper presentation on Avabahuka treatment in by medicine and exercise with respect to frozen shoulder. Dr. Salman, are you there?
Hello. Hi, hello, sir. I'm audible.
Audible, doctor.
May I audible, sir?
Yes,
Hello,
audible,
may
doctor. Hello, doctor.
May I audible, sir?
Audible, doctor. Audible.
Hello.
Hi, audible, doctor. Please share the screen,
हाँ
doctor.
एक
You are audible, doctor.
ओके
Please
ओके
share
एक
the screen,
मिनट
doctor.
ओके ओके एक मिनट देखो सर आई हेलो
Okay, doctor. Please share the screen, doctor.
ओके 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 सर इधर वो मॉर्निंग को सर का फोन है बड़े वाले का तो मोबाइल का मोबाइल समझ ना ठीक है हेलो
Hello, doctor.
हाँ सर
Your screen is visible, doctor.
एस 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 सर आई एम ऑडिबल सर मैं ऑडिबल सर
Audible, doctor. Audible.
हाँ
Please start the session, doctor.
myself Dr. Salman Patel sir I am third year PG for Kai Chikitsa LKR Ayurved College Gadinglaj Kolhapur. My topic is about treatment by medicine and exercise with special reference to frozen shoulder. Introduction. In a frozen shoulder, the shoulder girdle with the shift because which free the joint becomes the impossible. Freeable joint is a medical term is called as Edward.
Hello, doctor. Hello, doctor. Can you hear me? Hello, Dr. Salman. Can you hear me? Hello, Dr. Salman. Can you hear me? Okay, Dr. Salman. Please unmute yourself and share the screen, doctor. Hello, Dr. Salman. Please unmute yourself, doctor. Hello, Dr. Salman. Please unmute yourself, sir. Hello, Dr. Salman. Doctor, please unmute, doctor.
Hello.
Hello, doctor. Please share
I'm
the
here
screen,
audible.
doctor. Audible, doctor. Please share the screen, doctor.
Okay sir. Okay sir. Sorry sir, the Ayurvedic explanation is frozen shoulder. The Avavaka is a disease that usually affects the Ansa Sandhi, shoulder joint is produced by the Vat dosha. Even through the term Avavaka not mentioned in the Nanatma Vatvyadi, it is disease that arises slowly Vat dosha. Acharya Sushruta and other have to consider Avavaka as a Vataj Vikara, Amsa Shosha washing of shoulder. It is the consider of preliminary stages of the disease, the stiffness and joint contribution of the Kapadosha, because the involvement of the Kapadosha in maybe patient with the cold exposure and nighttime stiffness worsens. Causes: frozen shoulder, the bone, ligament, and tendon shoulder joint is the converted capsule or the connective tissue. It can be imagined as a ball capsule containing the shoulder joint within a frozen shoulder, occurring the capsule thickening of the tightening around the shoulder joint, restricted in movement. Cause of shoulder as per the Ayurveda, frozen shoulder. Main two causes: external cause and internal cause. Injury of the vital part of the body, marma region, the surrounding the shoulder joint, excess the exposure to wind and sleeping the wrong posture. Second one is the internal cause. Vata aggravated diet as the activity, except of the purgent bitter and the arising tasting food. Sometime of Vata Prakopahar. Stages. As per the modern, the three stages is very important in frozen shoulder. A typical first was the typical development, slowly three stages. Each stage is the last for month. Freezing stage. Shoulder movement cause pain and ability move the shoulder reduce. Frozen stage, pain may be decreased but stiffness increase. Thorning test. The range of motion and you shoulder being is improved. Risk factor: 40-year-old and older, particularly in women. Second, people is a prolonged immobility, reduce the mobility due to the root cough, injury, fracture, arm stroke, and after surgery. Third one, people who have certain disease appear more likely to develop frozen shoulder. Disease that mightly include diabetes, hyperactivity, thyroid, and sometimes heart disorder and tuberculosis. Line of treatment in frozen shoulder, one of the important role is the Snehana, Swedan, Nasya, and Basti. The Snehana is a girdle for the back and neck is the tip and corresponding arm usually the beneficial. Swedana. After the occasional mild of the sedation should be certain in the area of stimulate the ending, improve blood circulation to thus the pain and stiffness are relieved. Nasya does have the significant effect, but condition is stimulated the nerve ending. Basti is one of the important role in Vata dosha, might require about Vata balance equality. Ayurvedic procedure, sometime of the Abhyanga Pichu is very important role play in Avabhuka. Abhyanga, oil massage, medications, oil listen below the usually are slightly heated and over the water bath before the massage. Usually then therapy is give the massage, especially relief of stiffness. Pichu, the clot or cotton swab is stock in medications like oil or herbal. It give the long term of exposure of oil and joint. Some Ayurvedic oils and herb important in frozen shoulder. विषागर्भ तेल, महानारायण तेल, धन्वंतरा तेल, कोट्टाकुडी तेल, and bala तेल. It is a very important role play in frozen shoulder. Ayurvedic medicines, oral medicine is very Yograj Kukud, Rasa Rasna Rasnadi Kashaya, Prasannadi Kashaya, Maharasnadi Kashaya, it relieve pain and inflammation. The Smula Arista to relieve the inflammatory Vat Vikasma Rasa is use the treatment of neuritis, colic pain, etc. Mahata Vitasma Rasa use the treatment of the Vata disorder, abdomen pain. Homestay diet and habits frozen shoulder. Some patte in frozen shoulder. Warm include uncut fruit, proper the reduce exercise, warm water, bath losses stiffness. Unwholesome diet like apatya in frozen shoulder, cold water bath, excessive AC room, excess of oily fried food, heavy exercise, importance of lying, sitting, sleeping position, and frozen shoulder not be treating illness, but is the condition will be miserable and routine. Last one is the yoga is very important role playing frozen shoulder, Surya Namaskara, Adho Mukha Swarnasa, Gomukasana, Padmasana, Trikoshasana, Uskasana. Thank you, sir.
Thank you, doctor.
Thank you, sir.
Next, I would like to invite Dr. Monica for the paper presentation on the topic an
Okay.
effective Manjishta Gadir Churna orally and Democare oil locally in the management of Vijarshiga with respect to eczema, a case study. Dr. Monica, are you there? Hello, Dr. Monica, are you there?
Hello.
Hello, doctor. Please share the screen, doctor.
Okay. Sir, I'm unable to share my presentation. Hello.
Hello, doctor. Once again, retry, doctor.
Hello.
Hello, Dr. Monica.
Sir, I'm unable to share my presentation. Can you please share my presentation?
1 minute, doctor. Doctor, please start the session, doctor.
Okay. Good evening. My name is Monica Chauhan. I'm PG Scholar, third year, Kaitikisa Department. My guide name is Subhash Jamdare, HOD, SK Jaiswal, from DMM Ayurved College, Yavatmal. So my topic is actually presentation. Name of my topic is type of Manjishta Khadira Churna orally and Dermocare oil locally in the management of Vichajika, vice versa to eczema. Introduction. Ayurveda is a life science. Ayurveda is not only curative but also the preventive science of the life. In Ayurveda, all the skin disorders described under the heading of the Kushta. Skin is one of the sense organ in the body, largest and important organ, outmost covering of the body, which act as a protective barrier. But very often it is exposed to the many intensities which can damage it and cause the many of the skin disorders. About 10 to 20% of the general practice includes the patient suffering from the skin disorder and eczema, accountants for a very large proportion of the all the skin disease. In Ayurveda, the word Kushta is a broad term which covers almost all the skin disorder. In Madhav Nidan, kushtanti iti kushtam. That means the kushta divided into the two types, that is the Mahakushta and Shudra Kushta. Vicharchika is being one among the Shudra Kushta and also the Rasa Rakta Maunsa Dhatu Pradoshaj Vikar. Vicharchika Nirukti. The word Vicharchika is derived from the root word char with a V upasarga, meaning a form, a cutaneous eruption with a itch and scab. Paribhasha. The term Vicharchika is derived as one of the variety of Ashtadasha Shudra Koshta in which the skin develops Shrava Varnata, Pidaka associated with the Shrav and Kandu. According to the Acharya, Vicharchika is the Kaphavardhan Vyadhi and symptoms of Vicharchika are Kandu, that is itching, Shrav, Varna, blackish discoloration, Pidika, that is carbuncles, Bahusrav, that is discharge, Ruja means pain, Rajo, mark leaning due to the thickness of the lesion, and Rukshata means dryness. Vicharchika is described in the many of the Ayurvedic texts. That is in Charak Chikitsa, Sakandu, Pidika, Shava, Bahusrava Vicharchika, Kapha Praya Vicharchika. In Shushrut Nidan, Rajo, Ati Kandu, Varti Rujah, Saruja Bhavanti Gyatreshu Vicharchikayam. In Ashtang Hruday, Sakandu Pidika Shava Lasika Kadya Vicharchika. In Kashyap Samhita, Shama Lohita Varna Vedana Shrava Paka Vati Vicharchika. In Sharangdar Samhita, Pittena Udumbar Proktam Kapha Mandala Vicharchike. All the clinical features of the Vicharchika can be very well correlated to the clinical features of the eczema, which is the distinctive pattern of the inflammatory response of the skin. Eczema is a broad term used for the many types of the skin inflammation. It is a skin disorder, also called the dermatitis. It is a pattern of the inflammatory response of the skin, which is the resultant of the delayed type of the hypersensitivity mediated T lymphocytes in the skin. It is clinically manifest by the pruritus, erythema, oedema, papules, and vesicle, and oozing in the acute stage, whereas itching, scaling, dryness, and lichenification occur in the chronic stage. Appearance carries a lot of the weight in the modern world. Patients are very much concerned about the grooming and the way they present themselves before others. Both the men and women want a looking attractive and fabulous skin right till the old age. Any blemish on the skin causes psychological stress and physical uneasiness. In spite of the presence of the antibiotic, antihistamine, steroids, the skin disorder remain unrefractory treatment. But Ayurveda is a repository of the skin remedies which are therapeutically safe and effective. The prevalence of the skin disease in the general population has varied from 7.86% to the 11.16% in the various studies. Now I am presenting my case. A 45-year male patient came to the OPD of Kai Chikitsa department of LK Ayurvedic Hospital with the chief complaints Padabhagi Tvaka Vyavarnata, that is the changes in the coloration skin coloration since 3 years, Kandu, that is the itching since 3 years, Pidika eruption since 3 years, Shava Varnata means blackish discoloration since 3 years, Strava, that is the discharge on and off, Ruja means pain since 3 years, Rajo mark leaning due to the thickness of the lesions since 3 years. Rukshata means dryness since 3 years. Past history of the patient has no major any illness, that is means no history of hypertension and diabetes mellitus. History of the present illness. Patient is normal before the 3 year ago. Then patient has suffered from above symptoms and patient was treated by local doctor many times, but after he stopped the medication, patient symptoms was aggravated. Then patient came to the LK hospital of Yavatmal for the Ayurvedic treatment and management. Rugna Pariksha Nadi 68 per minute, Mala Asamyak, Mutra Samyak, Jiva, Alpasam, Shabda Prakrut, Sparsha Prakrut, Druk Prakrut, Akruti Madhyam, Nidra Prakrut, BP is 140/80, temperature of febrile. Then materials and methods, a case study. Second center is the PG Department of Kai Chikitsa and LK Ayurved Hospital, Yavatmal. Then my first table is showing the dravya which given to the patient. First is a Manjishta Khadir Churna, dose 3 gram, duration twice a day, Anupan with a lukewarm water. Then second is the Dermocare oil for the local application twice a day. Then my second table is showing the dravya and its karmukta. First is the Manjishta, kapha that is the kapha pitta shamak, and khadir is a kapha pitta shamak. Then my third table is showing the Dermocare oil, which contain the 21 drugs. First is a Kalmari, which is act as a lekan. Then Arka, Kapha Vata Shamak, Devdaru, Kushtagna. Then Haridra, Kapha Vata Shamak, Daru Haridra, Kapha Pitta Shamak. Kath, Kapha Pitta Shamak, Rakta Chandan, Kapha Pitta Shamak, Indravarun, Kapha Pittagna, then Kaner, Kapha Vata Shamak, Chitrakmur, Vata Kapha Shamak, Pidanga, Vata Kapha Shamak, Chakramarda, Vata Kapagna. Next, Shirshachal, then Tridosha Shamak, Kutach, Vata Pitta Shamak, Neem, Vata Pitta Shamak, Galo, Vata Pitta Shamak, Amlatas, Kapha Vata Shamak, Karanja Bij, Vata Kapha Vata Shamak, Nagarmota Pittagna, Kherachal, Vata Kapha Vatagna, and Vaj, Kapha Vatagna. Next. So this I have taken the photograph before the treatment. Next, this is a photograph is during the treatment. This photograph after the treatment. Those are first and second are during the treatments. So patient discussion हेतु आहार दधी सेवन मांस सेवन लवण अम्ल कटु पदार्थ सेवन मद्यपान विरुद्ध आहार विदाही अन्नपान विहार अतिश्रम आतप सेवन अति क्रोध पंचकर्म अभाव दिवास्वाप संप्राप्ति घटक ऑफ द विचर्चिका दोष वात एंड कफ दुष्य रस रक्त मांस श्रोतस रस रक्त एंड मांस वह श्रोतस अधिष्ठान रक्त रस मांस उद्भव स्थान त्वक and व्याधि स्थान त्वक. Then conclusion of this study. In this study, the drug used orally formulation of Manjishta Churna most helpful in all the skin disorders and imbalance pitta dosh, vitiates the blood and impairs its normal functioning. This causes the skin problems like redness. Manjishta helps to purify the blood and treats all the type of the skin disorder. This is due to the pitta balancing rakta shodak blood, that is the blood purify properties. Khadiradi Churna, which is mostly act as a Kushtagna, Varnagna, Tvachakar, Shodagna, Rakta Shuddhikar, and balancing the Tridosha and Rasayani. Locally used Dermocare oil, which is also the Kushtagna, Varnagna, Tvachakar, Shodagna, Rakta Shuddhikar. Application of the Dermocare oil would take care of the Rukshata, that is the dryness, as it contains the Telam, which is the Sneha Pakadravya. Haridra, Daru Haridra reduces and act as a Shodagna, that is the reduces the swelling. Chakramarda act as the Vishagna, decreases the Kandu, means itching. And Rakta Chandan act as a Prashamak, that is the reduce the burning sensation. And Chitrakmur act as a Lekhan, it removes the Pitika, eruption. Nagarmota and Nimba act as a Kledagna and decrease the Kandu, that is the itching. Next. Sir, please change the slide. So I have given all the references. Okay, thank you.
Thank you, doctor. Next, I would like to invite Dr. Vijay Panwar for the paper presentation on the topic Panchakarma benefits. Dr. Vijay Panwar, are you there? Dr. Vijay Panwar, are you there?
Hello, Dr. Vijay.
Okay, next I would like to invite Dr. Nikhil for the paper presentation on the topic efficiency of Dhanya Gokshira Gridapana and Varunadya Taila Uttarvasti in the management of benign prostate hyperplasia with respect to Vata Shidila. Dr. Nikhil, are you there?
Yeah.
Okay,
I
doctor.
can hear.
Please share the screen,
Uh,
doctor. Your screen is visible, doctor. Please start the session.
okay. Good evening, everyone. My name is Dr. Nikhil Shegaonkar. I am a PG scholar from Shalyatantra Department, and I belong from RT Ayurved College, Akola. So my topic is efficacy of Dhanya Gokshal Gritapan and Varunadya Tail Uttarvasti in the management of benign prostatic hyperplasia with special reference to Vatashila, a randomized controlled trial. Introduction. In Ayurveda, urological diseases described under the title of Mutraghata and Mutrakrucha. Mutraghata having 12 different types. Vata Stila is one of them. Acharya Shushru described the Lakshanas of Vata Stila as Ashtilavata Ghanagranthi, Vita Sangha, Mutra Sangha, Anila Sangha, Adma, and Vedna. It somewhat resembles with benign prostatic hyperplasia. The many research scholars in Ayurveda consider Vata Stila as a BPH. Hence, we can consider Vata Stila as benign prostatic hyperplasia. Benign prostatic hyperplasia, that is also called as prostate enlargement. It is a senile age enlargement of prostate which occurs usually between 60 and 70 years of age, commonly after 50 years. BPH affects both glandular epithelium and connective tissue stroma. BPH is characterized by the obstructive as well as irritative symptoms. Obstructive symptoms includes hesitancy, weak urine stream, and dribbling of micturition. While irritative symptoms include urgency, frequency, and nocturia. The conservative treatment in modern medicine is associated with many complications like headache, restlessness, insomnia, decreased libido, vertigo, abnormal ejaculation, postural hypotension, etc. While the surgical treatment is also associated with complications like post-operative bleeding, impotency, urinary incontinence. Moreover, that is TURP, transurethral resection of prostate, is associated with recurrence. Also, that is 19% failure rated of TURP is on record. Surgical treatment gives considerable economical burden on patient, so there is need of alternative and cost-effective therapy. So we finalize the topic efficacy of Dhanya Gokshal Ghitapan and Varunadya Tail Uttarvasti in the management of Vata Stila with special reference to benign prostatic hyperplasia. To see the effect of combination, that is Dhanya Gokshal Grit orally and Varunadya Tail Uttarvasti. as Uttar Basti in the management of Vata stela with special reference to BPH. Objective of this study is to study the effect of Dhanya Gokshagrit Pan and Varunadatel as Uttar Basti in the management of Vata stela, and to provide an effective and alternative as well as cost effective treatment so my study design is in this we screen for a patient for inclusion, initial assessment of patient and selection of patient, then we can take written informed consent from patient, and there are two groups, and we can randomly allocated patients into two groups. That is, group 1 will receive Dhanya Gokshar Gritapan and Varunadya Tel Uttar Basti, and second group, that is group B, will receive Tamsulosin 0.4 mg HS. This is the standard preparation manufactured by Cipla. The assessment on 1st, 7th, 13th, 21st, and 20th day. In this, we can go for the observation, classification, and presentation of data. Then there is a statistical analysis and conclusion. In group will be administered with Guksha and Uttar Basti. And Uttar Basti, there will be 12 sets of Uttar Basti continually followed by we give 12 Uttar Bastis to the patient, and group B will receive Tamsul HS for the 30 days. Inclusion criteria for my study is patient diagnosed as a case of BPH, male patient, of course, weight between 30 to 80 grams, 20 to 200 ml. Criteria for this study is patient of prostatic malignancy and prostatitis, patients having increased level of serum creatinine and blood urea, large prostate, that is prostate weight above 80 grams, causing retention urine and function. The patient will be assessed on the basis of subjective as objective criteria. In subjective criteria, there is more international score. In this score, we can ask for the patient regarding its lung symptom. In this incomplete urine, how much is the frequency, intermittency, urgency, weak stream, and straining. Last criteria is nocturia. In this, the score, if the score is 18 to 19, it is moderate. If the score is 20 to 35, it is severe. Okay. Objective criteria, we can observe abdomen and pelvis, and this we can observe for weight of prostate, post-vital volume of urine. This is the objective criteria of my study. Symptom score and objective criteria is wasted post-vital urine. There is excellent relief patient who received combination therapy of Dhanya Gokshal Ghitapan and Varunadya Tail. So we concluded by this combination therapy, that is Dhanya Gokshal Ghitapan and Varunadya Tail Uttar Basti, there is marked relief from the symptoms of effective, cost effective of effective treatment in the management of benign prostatic hyperplasia. There are the references for my study. Thank you.
Thank you, doctor. Next, I invite Dr. Ravi Kaushik. I invite Dr. Ravi Kaushik for the next presentation. Hello, Dr. Ravi, are you there? Dr. Ravi, please unmute yourself.
Hello. Hello.
Yes,
Am I
doctor.
audible?
Yes, yes, doctor.
Good evening. Good evening, ma'am.
Good evening.
My screen is visible, ma'am.
Yes, doctor, it's visible. But your voice is little breaking.
Now it is clear, ma'am.
Yes, doctor, please start.
Good evening, all of you. I am G Scholar, Department of Dravidic Vigyan, University College of Ayurveda, Jodhpur, and these are members, Dr. Chandan Singh, HOD, and my guide, Professor Dr. Rajendra Purvia, and Dr. Manoj Adalkha, Associate Professor, and my co-guide. I am going to present review on Pratinidhi Dravya concept and importance. Introduction. In the absence of desired dravya, classical text of Ayurveda recommends using the substitute of unavailable dravya that is called dravya. There is some of them are not available. It is advised that some other drugs can be used at the place of unavailable drugs for the medicinal purpose. In the words of classical text, अत्र प्रोक्तानि वस्तुनि यानि तेषु च योजित एकतर अभावे परम वेदेन जानता अकॉर्डिंग टू भाव प्रकाश कदाचित द्रव्यम एकम वा योगे यत्न
Hello, Dr. Ravi. Hello, Dr. Ravi. Are you there? So there is some network issues. We can. Hello, Dr. Ravi. So we can continue with the next presenter. I invite Dr. Kanchan Borkar.
Yes, ma'am.
Good evening, doctor. Please start.
Okay, good evening, everyone. So, myself, Dr. Kanchan Shikokar, Associate Professor, Shalyatantra Department, Ayurved Mahavidyalaya Rahuri. I am a PhD scholar, GSC Nanded, and my guide name is Dr. Vijay Ukholkar, sir, Professor and HOD, Shalyatantra Department, GSC Nanded. So, let's start with the title, Impact of Varicose Vein on Female, an overview. As we all know that varicosity is expressed in terms of non-inflammatory circulation in relation with vein and its surrounding structure. But before appearance of the circulation, there must be pre-stage of dilatation, elongation, and tortuosity. Finally, this correspondence appearance is termed as Grathanat Granthi, especially in relation with Sira, Vyana Vayu, and Ranjak Pitta. The incidence of varicose vein is more in female as compared to male. Because every woman desired for maternity, that's why she has to pass through the process of parity. This process of parity makes some reversible and some irreversible changes which affects her health. Reversible changes remains for short duration without harm, but irreversible changes of longer duration may produce harmful effects on her health, which disturb quality of life. So in modern era, for existence of woman leading, it is necessary to maintain and recover irreversible changes of parity period. Venous disease is one of the irreversible changes in female. The common pathogenesis in female is varicose vein occurs due to increased progesterone hormone, leading to decreased contraction and relaxation of vein wall and surrounding connective tissue, as well as increased abdominal pressure in pregnancy. Its pathogenesis progresses as time passes with persistent many etiological factors, such as obesity, multiple pregnancies, oral contraceptive pills, hormone replacement therapies, alteration in living habits, hormonal imbalance, menopause, fatigue, damage to walls, faulty habits of sitting, and modern lifestyle. That is, wearing of tight clothing and lack movement or flexibility. Using high heels for longer duration also affect movement of blood flow, which resulting in condition of varicose vein. As per Ayurveda, the incidence of varicose vein is observed more in Ati Dirgha, Ati Krusha, and Ati Sthula personalities. Varicose vein is one such health complaint which mainly observes in females, those involved in specific occupation of continuous sedentary lifestyle, that is Ati Asana, sitting job, Ati Chakramana, Ati Vyayama, Rathak Shobhajanita, that is those who are more in traveling, Sadatura, that means those who are always sick. It includes Shrotriya, Panyajivi, or shopkeeper, or we can say sales girls, Drupasevi, or those working in jobs like security guard, Vibandha, Bahuprasava, prolongs riding and standing postures for long periods, such as housewife, etc. Diet is also important factor to think about risk, because constipating diet or less fiber diet may lead to straining, raised intra-abdominal pressure, and this leads to varicose vein. Similarly, deficiencies is diet or malnutrition and anemia also responsible directly or indirectly in progression of varicose vein. Varicose veins can have an impact on the lives of females who working on their feet, especially teachers, nursing staff, flight attendants, dental staff, traffic police, postal workers, bank staff, beautician, surgeons. Needs prolonged standing as a part of their profession, placing them at the highest risk of developing varicose veins. Sedentary lifestyle is also responsible for developing varicose veins. In symptomatic condition, patient feels heaviness in leg, dragging pain, night cramps, spider veins, itching, eczema, lipodermatosclerosis, pigmentation. As the disease progresses, edema, ulceration, deep venous thrombosis is also observed as a complication of venous disease. Uh, as per Ayurveda literature, varicose vein is a condition occurs due to vitiation of Vata dosha. Aggravated Vata dosha, when localized in Sira, it produces Shula, that means pena, Akunchana, which can be correlated with varicosity of veins, and Purana, which means fullness of blood vessel, that is dilatation, elongation, and circulation. Sankochan and Sampidya can be correlated with night cramps. Vakrikruta can be correlated with tortuosity. Varicose vein is caused due to the vitiation of Vata dosha. The imbalanced Vata dosha creates increased pressure affecting the walls and elasticity of Sira and its related structure. So Ayurveda recommends treatment directed towards specifying Vata dosha. The stress and pressure wearing condition weaken the walls of vein, leading to the loss of elasticity. This occurs due to Ruksha Guna of Vayu. The vitiation of doshas, mainly Ranjak Pitta and Vayana Vayu, along with the kapha takes place at specific sites, that is calf and ankle, due to the weight bearing stress. These imbalanced dosha disturb flow of blood due to the obstruction in blood vessels. Ultimately, veins become dilated and stasis of blood, that is grathana, occurs especially at their weak points, that is lower limbs. And Siragrandhi occurs, which is commonly known as Sira Kutilata. There are some diagnostic approaches according to the Ayurveda. After reviewing ancient literature, diagnosis of varicose vein can be carried out with Purva Rupa, Rupa, Nidana, Samprapti, that is involvement of Dosha, Dusha, and Upashaya, Anupashaya, Upadrava as per particular stage of disease. Patient can be examined with Trivida Pariksha, Shadvida Pariksha, Ashtavida Pariksha, and Dashavida Pariksha. After the clinical examination of female patient, the examination should be done with female nursing staff or health profession, so that it will make her comfort zone and patient will cooperate to examine thoroughly the unexposed body parts. Because the clinical test, that is Trendelenburg test or tourniquet test, it required some privacy to examine, so that patient can cooperate for the examination. Spider veins and varicose vein can be easily easily seen on fair skin and unexposed body parts due to less melanin pigmentation of skin. As females are used, the waxing of lower limbs, spider veins or reticular veins on lower limbs can be observed easily and earlier as compared to males because observation of skin can be done more precisely. As we all know, the stages of venous disorders. Class 0, no signs of venous disease. Class 1, telangiectasis, varicose vein, edema. Class 4, pigmentation, eczema, and lipodermatosclerosis. Class 5, healed venous ulcer and active venous ulcer. These are some photographs showing photos of spider veins or circulation. Here we can see the varicosity of vein C2, stage C2. In C3, we can see the edema, and C4, lipodermatosclerosis, C5 and C6, ulcers, venous ulcers. If the disease is not diagnosed in early stages, that means C1 or C2 stage, then patient can lead to the complications like eczema, hemorrhage, lipodermatosclerosis, edema, venous ulcer, etc. So there is need of lifestyle modification to prevent all these complications. And so some self-care measures can help in the prevention of varicose vein, and that are avoiding crossing the legs with sitting, avoiding tight clothing that constricts the legs, groin or waist, regular exercise, avoiding constipation, low salt diet, high fiber diet, avoiding long periods of sitting or standing, leg elevation at resting period, which can ease the pain and prevent varicose vein from getting worse. In modern lifestyle, maximum females are regularly practicing application of moisturizers for skincare measures, which helps to prevent dry skin and further itching, abrasions, and ulceration. So early recovery of varicose vein in female is possible as compared to male. Modern surgical literature classified therapeutic regimen under 4 headings: non-medicinal, which includes elevation of leg, application of soothing agent, compression bandaging, or compression stockings, avoidance of affecting etiological factors. In medicinal regimen, it includes calcium dorbicillate and drugs like diosmin and hesperidine, which can use for prevention or palliation of disease. Then minimal surgical modalities include sclerotherapy, and surgical modalities include phlebectomy and Trendelenburg-like operations. So as per Ayurveda suggests Veshtana, bloodletting, that is Rakta Moksha or Siraveda, therapeutic enema, that is Basti, oil massage or Abhyanga, Ayurvedic medicines, and yoga are some approaches suggested in Ayurveda for the management of varicose veins. Conclusion: after revalidation of Ayurveda and modern treatment modalities, there is need of integration of Ayurveda and modern approach for early diagnosis, the evaluation of better treatment regimen, prevention of complication and recurrence of disease for better health quality of patient. It is very important that we should focus to modify lifestyle with Ayurveda regimen to achieve disease-free life. Above mentioned integrated vision and mission is useful for worldwide population. Such diagnostic therapeutic evaluation of varicose vein can help to improve the condition of varicose vein in female from non-curable to curable condition, that is from asadhyavastha to sadhyavastha. Thank you.
Thank you, Dr. Kanchan. Next, I invite Dr. Shraddha Kiran Kohli.
Yes, ma'am. I'm audible?
Yes, doctor.
Yes, my screen is visible.
No.
Can you please share my paper presentation? There is a error some.
Doctor, please share. Try to share one more.
Okay, I'll try. One minute. Unsupported document.
Okay, doctor.
Will you please share?
Please be
Because there is
there.
some problem.
Please be there
Okay,
because
doctor.
we do have.
Dr. Shraddha, 1 minute, doctor. I will share for you, doctor.
Okay, please.
Dr. Shraddha, please start the session, doctor.
Okay. Okay. Thank you so much. Okay, myself is Dr. Shraddha Kiran Koi, last year PG scholar, Department of Physiotherapy, Yashwant Ayurved College, Postgraduate and Training and Research Center, Kodoli, Kolhapur. My guide is UK Bande. My topic is Thaula Ayurveda. Next. Next slide, please. Hello.
Hello, Dr. Shraddha.
Yes, will you please next
Doctor,
slide?
your voice is very low, doctor.
Will you please share next slide?
Slide is visible, doctor?
No.
Hello, doctor. Is it visible, doctor?
No. Yeah, visible. Charak Samhita. It is also mentioned as direct as disorder of Shleshma, Santapta Nimitija, Ati Brihota Nimitija, and Samasandana Yoga. Detailed anthropometry is described the woman's sthana under the caption Pramana Pariksha. Gram mein ahara and gram mein vihar is mentioned as root cause of all illness due to flabbinescence of body and excessive accumulation of meda. Charak Sutrasthan 1. Sishrut Samhita. In Sishrut Samhita, Sutrasthana 15, he has narrated that it caused due to Dhatva Agni Manda, a new synonym that has been used in Charak Sutrasthan 12. So many remedies described for the management of Thaula at different places, which indicates terminating conditions of the disease in that time of society. Next slide. In Ashtang Sangraha and in Ashtang Hrudaya, Thaula is described as a Vagbhat has elaborated its pathogenesis of Thaula on the basis of formation of ama and disturbance of the process of dhatu parinama, that is intercellular metabolism and mechanism of respective of Agni, which later on understood as process of metabolism in modern era. In Ashtang Sangraha, Sutrasthan 24, various therapeutic and prophylactic measures are mentioned to cure and prevent this disease. Next slide. In Ashtangrude, Sutrasthan 14, various therapeutic and prophylactic measures are mentioned due to cure and prevent this disease. They have considered the Rasanjan as a drug of choice of Thaulia. But after observing relapse and challenging nature of the disease, they conclude that there is no treatment of excessive obesity. Thaulia is counted as a disorder of Shleshma dosa cited in Medodhatu as a Sutrasthan 19. Jathar Unnati, that is abdominal adiposity, is stated as the result of placement of Shleshma in a coaster at Sutrasthan 19. Flabbiness of Dhatu caused by armor is a main pathogen pathogenesis of Thawle as highlighted in Sutrasthana 24 and 23. Comparatively less side effects in Medica Purush is noted in Nidan Sthana 6, 11 and 12. Citation of Meda in a pathogenesis of Ursha is observed by Vagbhat Nidan Sthan 7. Line of treatment of Prameya Hameda Roga and Vatavikar is implied to use on patients of Antatva in Chikitsasan 2022 in pathogenesis of Madhudushika of Meda is first time observed by Vagbhat over inclusions in a Brahman as is a Brahma is a cause of Atistholya. Thank you.
Thank you, doctor.
Thank you, doctor. Next, I invite Dr. Aniket P. Sutar.
Hello. Hello, ma'am.
Good evening, doctor.
Hello, good evening,
You're
madam.
audible.
Thank you. Just give me 1 minute.
Your screen is visible, doctor. Please start the session.
Thank you. Myself, Dr. Aniket Sutar. I am a PG scholar student from Kodoli. My today's topic presentation is Patyapatta in Netra Rog, Netra. So, Patyapatta, Patyam Pato Anipetam, Yadashaktam Manasa Priyam, Yecha Priyam Patyam Chaniyatam Tena Lakshyat. पथ्य जो आहार विहार पथ किंवा शरीरात अनपेत्य म्हणजे अपाय न करणारा असतो व जो मनाला आवडणारा असतो तो पथ्य असे म्हणतात. अपथ्य जो आहार विहार शरीराकरता अपेतम म्हणजेच अपाय अपाय करणारा असतो व मनाला आवडणारा नसतो त्याला अपथ्य असे म्हणतात. याचे 2 उदाहरण दिलेले आहेत. ज्वरामध्ये पित्तरस दिला असता तो मनाला आवडणारा नाही, परंतु कुठलाही मानसवैद्य उत्पन्न होत नाही त्यामुळे, परंतु ज्वराचे शमन होते. त्यामुळे मनोनुकूल नसतानाही शरीराला उपायकारक असल्यामुळे पथ्यकर आहे. दुसरे उदाहरण क्षीरजीवनीयानाम दूध. क्षीरजीवनीयानाम दूध हे जीवनीय द्रव्यांमध्ये श्रेष्ठ आहे, परंतु अतिमात्रेत दूध सेवन करणे हे रेचन कार्य करते. दूध आटवून सेवन केले तर विषलिंबी कार्य करते. पथ्याची आवश्यकता व महत्व. साधारणतः असे दिसून येते की अपथ्य सेवन करणाऱ्या व्यक्तीला वातदोष विकार उत्पन्न होत नाहीत, कारण दोष आणि दूषित तुल्यगुण असल्यामुळे अपथ्यामुळे लगेच व्याधी होत नाहीत. त्यामुळे ते अपथ्य तो तसं सुरू ठेवतो. परंतु दोष दोषाची ही तुल्यगुण अवस्था जाऊन भिन्नत्वाची अवस्था येते, तेव्हा हे अपथ्य त्याच्याकरिता रोगत्वीस कारणीभूत ठरते. योगरत्नकाराच्या मतानुसार आहार, औषधी आणि पथ्य या तिन्ही घटना चिकित्सामध्ये सारखेच महत्व आहे. त्यांच्यानुसार जर औषधी नियमित घेतले परंतु पथ्य केले नाही तर व्याधी बरा होण्याची बळावतो, परंतु औषध न घेता केवळ पथ्याचे पालन केल्यास व्याधी बरा होतो. एवढे महत्व योगरत्नकारांनी पथ्याला दिलेले आहे. नेत्रामध्ये पथ्यापथ्य. सर्वदाच निषेवेत स्वस्तोपी नयनप्रियः पुराण एव गोधूम शाली षष्टी कोद्रवान. हा वाग्वड उत्तरतंत्रातील 16 श्लोक असून यामध्ये अपथ्य व अपथ्याबद्दल वर्णन केलेलं आहे. सो नेत्रपथ्य. आहार. The person who are fond of their eyes healthy should always adhere to following diet products like grains such as yava, godhum, luhit sali, shastika, mudga, etc., which are old and which mitigate cough and pitta mixed with more of broth. Vegetables, meat of animals of jungle desh, that is meat of animals dwelling in forest. Dadim, seeth, sandeva, trifala, terminalia bellerica, Imbili offensialis, Draksha and rainwater. Rasentherapy. For the use of Triphala, Achar Wagwood has advised that Triphala along with honey and growth, that is butter fat, should be considered at night daily for strengthening of the eyesight. Any other things which are good for promoting health and cure of eye disease can also be consumed habitually. Use of Anjana. Anjana is applied by using of Shalaka. It should be applied from inner canthus to outer canthus. It cleans the human eye, which makes them shine like the bright moon in the clear sky. Daily practice of Severanjan, that is explained in Dincharya, is advised as best simple ophthalmic medication to prevent eye disease and maintain the visual power properly. Use of Nasya, that is nasal drops. Especially Anutil Nasya in the form of Pratimarsh Nasya is advised because it's clean the srotas by its action and turn prevents the accumulation of vitiated cuff in the srotas of eye. It plays a very important role in delaying aging process, so also in age-related disorders. Proper sleep. Sleep is a key part of healthy lifestyle. Daily sleep for 6 to 8 hours is necessary for normal adult. During sleep, eyes retain functional capacity due to complete rest of eyes. Care of feet. Regular massage of the feet is advised because it is assumed that in the center of the feet, that is soles, two serrates are situated, which are greatly connected to the eyes. These are vitiated by the accumulation of mud, assault, trauma from stone, or foreign particles, and bring about the abnormalities of the eye. Medicines applied over the feet, feet massage, external application of the oil, etc., transmit the benefit of the eyes. Hence, feet should be clean, healthy, and away from the heat by using footwear, washing them well, and massaging with oil. Eye wash. Regular eye wash with Trifala and Estimudupat with the use of eye wash cuff is also beneficial for the eye health. Eye exercises. Movements of the both eye in up, down, sideways, rotational direction, followed by the palming is very effective in the prevent of refractive errors. Shatkarmas. Neti and Tradek are the best for eye among the Shatkarma. Neti is performed with the thin thread of the 32 anguls, inserting it through one nostril and taking out through mouth. It distorts kabdosh and gives clear vision. Jal Neti, that is with pinch of the salt mixed in the lukewarm water. It also in practice nowadays. Tratak is a continuous looking at the small object till eyes tear. It destroys all the disorders supposed to confer divine sight, that is Divya Drishti. Nidrapatya, Ahar. Diet is the basis of all function of the body. The dietary factors which adversely affect the eyes are called as Achakshush Ahar, that is apathas for eyes. And these are as following. Sour items like curd, pickles, Vidahi and Ushnavirya Ahar, which vitiated Pitta, Viruddha Ahar, like milk with fish, cool and hot water items together. Adhyasanam, that is eating before digestion of previous meal, which deranged normal digestion of mechanism. Dushit Agni, which derange the properties of Rakta Dhatu, and in turn, functional capacity becomes defective. This develops of the stage of Avishanda, which is initial pathological changes in the development of any eye disease. Vihar contains habits and occupational factors directly influence the eyes. This in turn may lead to eye disease as hot water, head bath, and excessive smoking by vitiated pitta, daytime sleep and night awakening by disturbing the normal function of the rods and cones, causing eye strain. Looking at too small or too distant object, continuous watching of the moving object, that is TV in computers, reading in moving vehicles, or incorrect posture, that is too near or at too distance, putting them much eye strain. Suppression of urges, especially of nidra, ashru, affect the normal function of the lacrimal gland and thereby moisturizing of the eye. Cold water bath when body is hot and using too high pillows causes circulatory disturbance, which in turn affect the mechanism of nutrition, and it leads the eye diseases. Air pollution and too much light are also main causative factors of the eye diseases. Traveling in high-speed vehicles exposes eye to currents of air and dust particles. Also, eyes get tired due to constantly adjust to the change in direction, a cause of traumatic and Vatas disease in the eye. Thank you.
Thank you, doctor. Next, I invite Dr. Deepthi Barse for the
Yes,
presentation.
ma'am.
Doctor, you are audible. Please share the screen and start.
Yes, ma'am. Ma'am, can you see my screen?
Yes, doctor.
Ma'am, you can see now. Hello, ma'am.
Yes, doctor.
Can you see my screen? Can you see my paper presentation?
Your
No,
screen is
no,
visible,
doctor.
doctor, but your presentation is not visible.
Okay, just a minute.
Now your
Now can
presentation
you
is
see
visible,
it?
doctor.
Yeah, okay.
Please start the session, doctor.
Sir, good evening. Topic is effect of Ati Vyayama on Asti Dhatu. I am Dr. Dipti Burse, Kriya Shariri Department, PG final year, Yashwant Ayurved College and PG Training Center, Kodoli, Kolhapur. Introduction. The system of Ayurveda has its own principles and vision of life. Asti Dhatu is one of the 7 dhatus in the body. These dhatus are defined as per their karma. These us how the dhatu is working in our body and keep our body and mind healthy. In Samyavastha, dhatus do Sharira Dharana. Dharana Dhatavaha. Need of study. Exercising in excess may lead to asthikshaya, can be related to osteopenia or osteoarthritis. Asthidhatu Karya. Asthini Dehadharanam Majja Pushtim cha Sushruत Sutrasthan. Dehadharana and Majja Pushti, these are the normal functions of Asthidhatu. Astiva Sroto Mula, sorry. Asथिvahanam Srotasam Medomoolam Jaganam cha Charak Vimanasthan. Medadhatu and Jagana, that is sacral bone, are the Sroto Mula of Asthidhatu. Astiva Srotas. This indicates Asthidhatu is nourished by its previous dhatu, that is Medadhatu. Astiva Sroto Dushti Hetu. Vyayamat Ati Sanshobhat Asnam Ati Vigattanat Asthivahini Dushyanti Vatalanam cha Sevanat Charak Vimanasthan. Astiva Srotas gets vitiated by following reasons, that is Ati Vyayama, Aghata, Asthibhagna oftenly, and Vatakara Ahara Vihara Sevan. Vyayama Pramana, as described in Ayurveda, Ardha Shaktya Nishevyastu Balibhi Snigdha Bhojibihi Shita Kale Vasantecha Mandameva Tatonyada. Ashtanga Hruday Sutrasthan. The individuals having proper bala and those who are taking snigdha ahara should do vyayama, only half of their whole strength, that is balardha. Vyayama should be done until perspiration occurs and until respiratory rate increases. It should be done in Vasanta Rutu and in cold atmosphere till half of whole strength, that is balardha. In another Rutus, it should be performed in very alpa pramana in healthy individuals. Then effects of Vyayama. Laghavam karma samarthyam diptognir medasakshayaha vibhakta ganagatratvam vyayamad upajayate. Ashtanga Hruday Sutrasthana. Lightness of body and ability to do work increases. Jataragni is activated after performing Vyayama and thus Medadhatu Kshaya occurs. So if it is done in excess, more Medadhatu Kshaya occurs. Medadhatu nourishes Asthidhatu, but if there is Kshaya of Medadhatu, then it will definitely cause Asthidhatu Kshaya. Yes. Thank you. Thank you, everyone.
Thank you, doctor.
Yes, thank you, ma'am.
Next, I would like to invite Dr. Ankita Sadish Chavan for the presentation. I invite Dr. Ankita.
Yes, ma'am. Good evening, ma'am.
Good evening, doctor.
Is my screen visible?
Yes, it's sharing now. Yeah, it's visible now.
Myself, Dr. Ankita Satish Chavan from CARC College, Pune. My topic name is Study of Concept of Ahar Kalpana from Charak Sanhita with special reference to Pranava Strotas Vadis. In Ayurveda, Strotas is one of the vital entities of human body responsible for both physiological and pathological functions. Strotas is defined as the passage through which the various dhatus that are undergoing the process of metabolic transformation are transported. Acharya Charak had explained Strotas as medicinal view, while Acharya Sushrut had explained Strotas according to surgical aspect. Pranava Strotas is first and important Strotas which carry pran all over the body. Pranava Strotas plays a vital role in maintaining the homeostasis of the body. Ayurveda focuses and gives ample importance to diet and nutrition since its origin. But nowadays, even a common people getting attracted to this and very curious about it. Diet means an eating plan in which someone eats less food or only particular types of food because they want to become thinner or to medicinal reason. Nutrition means the substances that you take into your body as food and the way that they influence your health. There are a lot of descriptions available in Samhita regarding a variety of Ahar Kalpana. In Sutrasthan via Hitakar and Ahitakar Dravyas, in Nidan Sthan via Hetus of diseases, in Chikitsasthan via Nidan Parivarjan and Pathya of diseases, in Siddhisthan via Samsarjan Kram. In Ayurveda, Ahar Kalpana included in Krutanna Kalpana and Pathya Kalpana. Krutanna Kalpana mainly are of two types, Kruta and Akruta. Acharya Kashyap told third type Kruta Akrut also. The Ahar Vihar, which is beneficial and nutritional to the body and also give the happiness to the mind, is known as Pathya, and opposite to that is known as Apathya. Charak has not mentioned Pranava Stotodushti Rogas as such, but has told the involvement of Pranava Stotas in Vadis like Kas, Shwas, Hika, Rudrog, Kshatakshina, Rajekshma, etc. Pranava Strotodushti can occur due to various reasons. Among those, Strotansi Annescha Daruni is important. Samanya Lakshan Upadrav of some diseases are taken into consideration. Shwas is the main symptom of Pranava Strotodushti. Pandu, Kafodar, Plihodar, Dakodar has Shwas as Samanya Lakshan. Raktapitta, Shoth, Udar, Chardi, Prameha, Atisar, and Jwar have Shwas as Upadrav. Methodology, material, Charak Samhita with commentary is reviewed, data analyzed, and conclusion made according observations. Method is systemic search of available literature has been done for the search of Ahar Kalpana with special reference to Pranava Strotas, Shwas, Kas, Hika, Rajekshma, Kshatakshina, Pratishay, Rudrog, Atisar, Grahani, Udar, Pandu, Trishna, Shroth, Chardi, Jwar, विसर्प रक्तपित्त वातरक्त स्थौल्य प्रमेह and मदाचे are taken into account. Diet advice for these vadi have been searched. Frequency of the specific ahar kalpana has been mapped. Observation is here. There are 30 ahar kalpanas observed in 20 vadis out of 21 vadis of pranava strotas. These are Manda, Peya, Peya, Vilepi, Mantha, Yush, Khadayush, Pramatha, Yavagu, Maunsaprayog, Maunsaras, Leha, Payas, Utkarika, Dugdha Prayog, Dadhi Seven, Siddhajal, Yav, Shak, Falaras, Neha Prayog, Takra Prayog, Arnal, Prasanna, Manda Prayog, Shadav, Rag, Panak, Kambalik, Pupalika, and Modak. Result is shown in graph. Frequency of ahar kalpana in vadis of pranava strotas is shown in this graph. Yush is most used ahar kalpana. In 20 diseases, Yush is used. After that, Mausaras mostly used, then Snehapan and so on. 11 out of 28 Yavagu described in Apamarga Tandulya Adhyay are beneficial to Pranava Strotas Valley. Some Kalpana specially mentioned in particular diseases also, like Manodnya Anyapan mentioned in Rajekshma, Jugupsa Mamsa Prayog in Rajekshma, Gud Adrag Yog in Shwayathu, Sarpi Gud Yog in Kshatakshин, Chardi, Rudro, Tandulambu in Grahani, Madhyambu, Gudambu, Dhanyambu in Trushna, अपूप आहार in Prameha, Ashtangalavan in Madatya. Conclusion. Role of Ahar Kalpana is to improve digestive system, improve digestive fire, nourishment of body and mind. Ahar Kalpana are mostly warm, liquid, tasty and easy to digest. Mouse and Mouserus also has described in number. Siddha Jal can be used along with Ahar for drinking in routine. It becomes more useful to fight against Vadi. Utkarika is heavy in nature and gives birth to patients, so it is used its Gruhaniya property used in Kas and Shwas. In Jwar and Rakta Pitta, Tikta Shak used in Shakasatya. Rudya Pujan is another requirement in Chardi. To get fast and accurate result, it is important to follow ideal treatment pattern told in Charak Samhita and use of this Ahar Kalpana appropriately. This is the references. Thank you.
Thank you, doctor. Next, I invite Dr. Munawar Hashim Patel.
Hello everyone. Hello.
Hello, doctor. Please start the
Uh,
session.
is my screen
No, doctor,
visible?
not visible.
Is it visible now, ma'am?
No, doctor. Hello, doctor. It's still not visible.
Uh, I am doing it, ma'am. Is it visible now, ma'am? Hello.
Yes, it's sharing now.
Yes. Hello everyone. I am Vaidya
Yes,
Munawar
yes, it's
Patel.
visible now.
I am Vaidya Munawar Patel from PTSR department, LKR Ayurved Mahavidyalaya, English. My topic for today is different stages of labor as per Ayurveda. In Ayurveda, different acharyas have stated stages of labor differently. Acharya Sushruta has mentioned three stages which appear to be most apparent according to modern science are Prajayini, Upasthita Prasava, and Prajaneshamana. Ashtanga Sangrahaka describes Asana Prasava and Upasthita Prasava. Ashtanga Hridayaka describes Adya Prasava and Upasthita Garbha. Bhavprakash mentions Asana Prasava and Prasavotsuka are the stages of labor. Charka has not specified a word but has given all the symptoms collectively, and we can differentiate or classify it into two or three stages. Charka has described first symptom as clamogatanam, that is tiredness of the body, glanihi ananasya akshnoho shaithilyam vimukta bandhatvam iva vakshasaha kukshehe avasramsanam. These are appropriate symptoms for the latent phase or the first stage of the labor. Uh, Following adhogurtvam, vankshana basti, katikukshi pashvapushta nistoda, yonehe prasavanam. These to be the following symptoms in the second, first to second stage. Anannabhilashasyeti, anantaram आविनां प्रादुर्भावः प्रसेकश्च गर्भोदकस्य, that is the rupture of membranes and following liquor, that is the symptoms of third stage. Acharya Sushruta has mentioned three stages, that is Prajayini, Upasthita Prasava and Prajanayashamana. Prajayini Avastha starts from the Kukshi Shaithilya till Avi Pradurбhava. Upasthita Prasava starts from the Avi Pradurбhava till a Garbhashaya enters the Garbhashaya Mukha. Prajanayashamana Avastha starts after the Garbhashaya enters the Garbhashaya Mukha till the Aparapatana. Now the Prajayini Avastha is a stage when a woman is eager to deliver. It starts from Kukshi Shaithilya till Avi Pradurбhava. This also means a woman is waiting to deliver. This stage coincides with the latent phase of labor. This stage shows a period of 1 to 2 days of period just before the first stage of labor. The stage is recognized when a woman shows following symptoms, that is jate hi shitile kukshau mukte hriday bandhane sashula jaghane nari sadneya tu prajayini. That is shithile kukshau, that is laxity of abdomen, mukte hriday bandhane, that is release of bond of hridaya. Uh, and third symptom is sashula jaghane, that is pain in thighs and legs. Prajayini is more of a mental preparedness of a woman which is about to deliver. Second stage is Upasthita Prasava. This stage of labor is in continuation with the previous stage. Asana Prasava is a physical preparedness of signals that body gives shortly before baby is delivered. It starts from the Avi Pradurбhava till Garbhashaya enters the Garbhashaya Mukha. It is identified by following symptoms as कटिपुष्टं प्रति समन्ताद् वेदना भवति, अभीक्ष्णं पुरुषप्रवृत्तिः मूत्रं प्रसिच्यते योनिमुखात् श्लेष्मा च. That is a recurrent and severe pain in back, sacral region, pelvis and all region around. Excessive and increased frequency of defecation and urination. Mucoid discharge from the vagina. Third and last stage is Prajanayashamana Avastha. It starts after the Garbhashaya enters the Garbhashaya Mukha till Aparapatana. Avi Pradurбhava is at its peak and Garbhodaka Srav is present. Patient is placed in Prasavasana with legs flexed. Patient presents with glani in between Avi. The last event after the end of Prajani Shamana Avastha is Aparapatana. Expulsion of the placenta has been explained by all authors as inevitable and the last event occurring at the end of the labor. Kashyapa explains that woman in whom placenta has not been expelled following labor is not considered as sutika. So these are the three stages and symptoms according to Ayurveda. Thank you.
Thank you, doctor. Next, I invite Dr. Sandeep Borse.
Hello. Hello. Am I audible?
Hello, doctor. Yes, doctor.
Okay. Myself, hello.
No, it's now
Hello.
sharing. Yes, doctor, your screen is sharing now.
Can
Hello, doctor. Your voice is breaking and still it is not visible. Hello, Dr. Sandeep. Are you there? So next I invite Dr. Rushikesh Sridhar. I invite Dr. Rishikesh Sridhar More. Hello, Dr. Rishikesh. So next I invite Dr. Shivani Bhavarekar. I invite Dr. Shivani Bhavarekar.
Hello, am I visible or audible? Hello.
You are audible,
Audible,
doctor,
doctor.
but not visible.
Let me share. Let me share. Can you share my PPT? I've sent it to you. I have problem sharing it.
Okay, doctor, 1 minute. Doctor, please start the session, doctor.
Okay. So good evening, everybody listening. Myself, Dr. Shivani Bhavrekar, PG final year student of Rognidan एवं विकृति विज्ञान Department of Sumatibai Shah Ayurved Mahavidyalaya. So first slide, please. Topic of my presentation is, hello sir. The topic of my presentation today is a review on Nitya Sevani Ahar as a balanced diet in Ayurveda under the guidance of Dr. Anand Kadaskar, who is my guide. So introduction. Ahar is first of the three Traya Upastambha explained in Ayurveda. Traya Upastambha are the three pillars important for leading a healthy life. The term Ahar is very vast term containing all about the qualities of food, different types of food, proper quantity of food, and food as the use of the medicine. But nowadays, the progression of sedentary lifestyle is leading to many non-communicable diseases, namely hypertension, diabetes mellitus, cancer, heart diseases, and stroke. These diseases by far have the highest mortality, representing about 71% of all deaths worldwide. Next slide, please. Some major causes of lifestyle disorders are faulty dietary habits, wrong behavioral patterns, disturbance in circadian rhythm, and stress. Hence, the faulty dietary habits and unhealthy food plays an important role in the genesis of the lifestyle disorders. The faulty dietary habits include complex food regimens, overly processed food, wrong food combination, overeating, which all causes the start to the pathogenesis of the non-communicable diseases. Ayurveda has also given the concept of Santarpanjanya Vyadhis, which can be related to the lifestyle disorders. The causes are consumption of guru, snigdha, madhur, pichil ahar, excessive consumption of milk and its products, less physical activities, and day sleeping patterns. Prevention from these non-communicable diseases can be done by correcting the errors in dietary habits, practicing good behavioral practices, and correction of the circadian rhythm. So the healthy dietary habits can be encouraged by creating more awareness about healthy, complete, and simple food. So Nitya Sevani Ahar is a concept given by Ayurveda that is complete, balanced food materials described, which can be consumed regularly by everyone as it also completes the nutritional demands of the body. As the food mentioned in Nitya Sevani Ahar are the foods easily available. So they are good in nutritional content and can be consumed regularly. So the aim of the paper presentation today is to understand the role of Nitya Sevani Ahar mentioned as a complete and balanced diet. Objective is also to understand the role of Nitya Sevani Ahar as complete and balanced diet to sustain a healthy life and to prevent these lifestyle disorders. The methods used are the literally search done on various classical Ayurveda texts from various sahitas and online databases were searched. Next, sir. So the review on Nitya Sevani Ahar. Ahar enlisted by Charak Ashtang Hrudakar under the title of Nitya Sevani Ahar and Sevani Ahar respectively. Next, sir. So Charak has specially mentioned 11 types of food as a Nitya Sevani Ahar, which are Chastik Shali, that is Oryza sativa, Godhum, wheat, Yava, barley, Mugda, green gram, jungle mass, meat of animal found in arid region, Godugd, cow's milk, Ghrita, ghee, Antariksh Jal, rainwater, Sandav, rock salt from Sindh, Madhu, honey, Amla, that is Indian gooseberry. Uh, Acharya Ashtang Hrudayakar has also enlisted the same, but they have also explained some extra ahar as sevni ahar that are shalidhanya, shunjikshanak, jivanti, vastukam, haritki, amlaki, mrudvika, patol, sharkara, dadim, and godugdha, as he has also mentioned, as that is mentioned by Charak. The next slide, please. So, as Ayurveda has given the concept of Nitya Sevni Ahar, the modern nutrition science also tells that nutrition and diet are very immensely important for maintaining a good health. Today, for maintaining health, many fancy diet regimens are followed, but the different diet fads cannot lessen the value of whole, natural, and less processed food, as they are in good nutritional value and complete the essential nutrition requirement of body. Next, the main aspect of dietary guidelines which are given by nutrition science are a diet consisting of food from several food groups provide all the required nutrition in proper amounts like cereal, millets, pulses are major source of the most macronutrients, whereas milk, which can provide good quantity of proteins and calcium, which are also a requirement for the diet in the diet for infants, children, and women. Next, sir. Oils and nuts are also very important as they are calorie-rich foods and are useful for increasing the energy density and quality of food. Inclusions of egg, flesh foods, and fish enhance the quality of diet, whereas vegetable and fruits provide protective substances such as vitamins, minerals, and phytonutrients. Next, to the discussion, Ayurveda majorly stands on the two basic principles that are first the prevention and second maintain intervention for diseases in different forms like shodhan, nidan, parivarjan, shaman, rasayan, patya, tatvaja. As for maintaining the health, the basic principle is to maintain proper nutrition and complete ahar. It is the first upastamba mentioned. Taking the nutritious ahar ensures good health. The dietary guidelines of nutrition also suggest to take a complete balanced diet regularly to ensure a good health. Nitya Sevni Ahar comprises of all the factors suggested by the dietary guidelines, which are in the form of essential and non-essential nutrients. Next, sir. So the complete and balanced diet comprises of macro and micronutrients. The macronutrients are called carbohydrate, protein, and fat, whereas vitamins and minerals are called as micronutrients. So the Nitya Sevni Ahar described by Charaka and Ashtang Hrudayakar comprises of all the components required to maintain a balanced and complete diet. As the Shastik, Shali, Yava, Godum, and Shali Danya, the compositions of these can fulfill the part of the carbohydrates required in the body. The green gum and the jungle mass can fulfill the requirement of protein in the body. Ghrita and Godugdha provide the requirement of fats in our body. Same as Amlaki, Draksha, and Dadimba can provide many nutrients, many vitamins required for the body. Sandhav and Madhu can complete the requirement of minerals required in body. And water, as it is a basic requirement, it is very important to complete a diet and to be balanced. As we know that all the Madhur Rasatmak Ahar are considered to be Kapha Vardhak, but except the Shastikshali and Godum, they are not Kapha Vardhak, hence it can be taken regularly by everyone. Same with Amlaki and Draksha and Amlaki, which are Amla, Amla Rasatmak Dravya, which can cause pitta aggravation, but these two dravyas cannot doesn't harm the pitta and maintain it properly. So these are the very important nutrients and macro and micronutrients that can be provided to body in these forms. Next, sir. So as concluded, that the food that possesses apt quality and quantity are the source of life and vitality for all the living beings. Complete and balanced diet is the fuel that maintains the Agni, invigorates the mind, promotes proper distribution of body elements, vitality, complexion, and the acuity of sense organs. Inversely, unhealthy diet lifestyle causes vitiation of dosas, dhatu, and rasa, and thus causes diseases. So hence we can say the Nitya Sevani Ahar is in itself a complete and balanced diet that should be consumed by everyone as it completes all the requirements of the dietary guidelines given. And hence no fancy other supplements or fancy diets need to be followed to sustain a healthy life. So thank you everybody. Thank you for your patience listening.
Thank you, doctor. Thank you, doctor. Next, I invite Dr. Priyanka Chau. I invite Dr. Priyanka Chau.
Dr. Priyanka.
Hello,
Hello, doctor. Please share the screen, doctor.
sir. Please share my slide.
Okay, doctor. 1 minute, doctor. Doctor, please start this. Please start the session, doctor.
Hello.
Doctor, please start the session, doctor.
Okay, sir. Good evening, all. My name is Dr. Priyanka Chauhan, PG scholar. I am from SMBT Ayurved College, and my guide name is Dr. Ankush Gunjar, Associate Professor, Department of Kai Chikitsa, SMBT College, Nasik. Please change the slide, sir. Today's my topic is Ayurvedic management of Vicharchika with special reference to eczema. Abstract. In Ayurveda, all skin diseases are included in Kushta. According to Ayurveda, there are two types of Kushta, which is Mahakushta and Kshudra Kushta, which are again classified into 7 types and 11 types respectively. It is classified as one of the Ashtamahagad. According to modern science, Vicharchika has similar clinical presentation as eczema. Eczema is a form of dermatitis where inflammation of dermis occurs. It is also known as atopic dermatitis, which is characterized by dry, itchy skin with areas of poorly demarcated erythema and scale. Modern science has no specific medication or treatment for sure of eczema, but symptomatic treatments like steroids are used as it has serious side effects that leads to recurrences is common. Ayurveda treats from the root of eczema by cleansing doshas and balancing doshas and dhatus. Introduction. Skin disease occurs all over the world. Skin disease is more prevalent among children and in low socioeconomic group of peoples due to poor hygiene. Various studies shows that skin infections are more prone in extreme climate conditions. According to Ayurveda, Vicharchika has similar clinical presentation as eczema. According to Bruhatrai, Vicharchika comes under the Kshudra Kushta, as Kushta is caused due to Viruddhahar, which leads to Agnimandya. As per modern science, eczema is also known as atopic dermatitis. Eczema or atopic dermatitis is a pattern of inflammatory response of the skin
which is resultant of delayed type hypersensitivity mediated by memory T lymphocytes in the skin. The clinical lesions may be acute, wet and edematous, or chronic, dry, thick, and scaly, depending on the persistence of the insult. The term eczema is broadly applied to a range of persistent or recurring skin rashes characterized by redness, skin edema, itching, and dryness, with possible crusting, flaking, blistering, cracking, oozing, and bleeding. Areas of temporary skin discoloration sometimes characterize healed lesions, though scarring is rare. In early stage of eczema, the stratum corneus remains intact, so eczema appears as red, smooth, and edematous plaque. Later, edema becomes more severe. Tense blisters appears on the plaques. Chronic eczema is dry and is characterized by thickened, scaly skin with hyperpigmentation and visible crests. Let's see the pathophysiology of Kushta. Agni-mandya leads to incomplete digestion and fermentation and further causes arm utpatti. Arm utpatti further causes Tridosh Dushti and leads to clay formation. Due to Ashray Ashray Sambhav leads to Mans Dushti, Tvaka Dushti, Lasika Dushti and Rakta Dushti and causes Vicharchika. Kushta is caused due to Viruddhahar which again leads to Agni-mandya. Symptoms. According to Charak Samhita, Vicharchika is Kapha Pradhan. The symptoms present according to Charak, Kandu, Pidaka, Shavata, and Bahusra. According to Sushrut, Vicharchika is Pitta Pradhan. The symptoms are Raji or Mandal, Atikandu, Ruja or Rukshata. According to Ashtang Rudak, Vicharchika is Kapha Pradhan. The symptoms are Kandu, Pidaka, Shavata, and Bahusra. And according to modern science, redness, swelling, itching, and skin lesions with sometimes occurring oozing and scarring. Line of treatment in Vicharchika. Ayurveda has described several lines of conservative treatment for Kushta Vyadhi. For Vata predominant Kushta, ghee is given internally. For Pitta predominant Kushta, Virechan, purgation and Raktamokshan, bloodletting, and for Kapha predominant, Vaman is utilized. In Shodhan, Vaman and Virechan. Role of Haridradi Tel in Vicharchika. In Haridradi Tel, all dravyas are tikta, katurasatmak, and lagu ruksha in guna. So act on kapha, vat, and rakta dosh. Snigdha guna of tel reduces rukshata in Vicharchika. Also, all dravyas are act on tvaka vaivarni. Haridradi tel having more ingredients are having lagu, ruksha guna, ushna virya, and katu tikta rasa also have katu vipak. The drug having properties Kandugna, Vedna Sthapan, Tvaka Doshahar, Rakta Dosha, and helps in reduction of Rukshata. The main ingredient of Haridradi tel is Haridra, which is Tikta and Katurasatmak, Ushna Viryatmak, Ruksha in Guna, and Kapha Vatahar. According to Acharya Charak, Haridra is Lekhaniya and Kushtagna in Guna. Haridra has active ingredient curcumin. Curcumin have anti-inflammatory, antimicrobial, and antioxidant properties, making it an appealing treatment option for a variety of skin conditions, including eczema. Manjishta acts on Rakta Dhatu and maintains Rakta Dhatvagun. It is an indigenous drug claimed to have astringent, anti-inflammatory, antioxidant, and antiseptic properties. It reduces the inflammation of all skin diseases. It improves the complexion by improving the quality of blood. It also exhibited the inhibition of lipoxygenase enzyme pathway responsible for anti-inflammatory action. These are the references. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Yogika.
Hello, I'm audible.
Yes, doctor.
Can you please share my PPT? Sir, hello.
Please wait, doctor.
Okay.
1 minute, doctor. Doctor, please start the session, doctor.
Hello everyone, myself Dr. Yogita from BMM College, Nagpur. Uh, okay, today's my topic is role of Rasa Aushadhi and their effect in skin diseases. First, PPT please. This one. Introduction. The skin covers the external surface of the body and is the largest organ of the body. In Ayurveda, Tvaka word is used for the skin. Tvaka is derived from Tvaka, Tvak dhatu, which means the cover. According to modern medicine, skin contains sweat glands, blood vessels, hair follicles, erector pili means smooth muscles, which are responsible for proper functioning of skin. Any abnormality in them leads to skin diseases. As per Ayurvedic literature, imbalance of three dosha and dhatus is responsible for skin diseases. Doshas are three fundamental energies in our body. Large populations have various skin problems. Okay, need of this study. In today's era, the skin disease become very common and serious issue. The prevalence rate of skin disease in India is 10 to 12%. Ayurveda has described many skin diseases under the pushta, which is Tridoshaj Vyadhi. The Samprapti of Pushta is started from Rasa Dhatu and travel onward to another Dhatu, which increases the chronicity of disease. There are many formulations described in Ayurveda to treat skin diseases. As the skin diseases are difficult to treat and require long-term treatment, the medications which gives fast effect in small doses from should be given. Rasa Aushadhis fulfill both the criteria, so it is good to use in the skin diseases. Aim of this role of Rasa Aushadhis and their effect in the skin. This is the aim. Then objective to identify the various Rasa Aushadhis which is given in Kushta. And second objective is to review the role of different Rasa Aushadhis in various skin disorder. Then Kushta. Word Kushta means a pathological condition which displeases the skin. Skin is an important organ of communication with the external world. Skin is the largest area of the body. It reveals both the normal and pathological state of an individual. There are total 18 types of Kushta under the term Mahakushta and Shudra Kushta. These are types of psoriasis. Next one. This is the Samprapti of Kushta. Nidan Sevan leads to Tridosh Prakop, leads to Tvaka Rakta Mans and Ambus Shaithilya, leads to further vitiation of doshas occurs, leads to doshas gets accumulated at the place of Dhatu Shaithilya, leads to dosha and Dushya Samurchana, then Kushta. Then Rasa Aushadhis. In various Ayurvedic communities, Rasa Aushadhis are used for the Kushta Chikitsa. Here is the review of Rasa Aushadhis which is given in Kushta Chikitsa from the Rasaratna Samuchaya. These are the formulations which is used in Kushta. First is Vijayavati, dose is 375 mg. Anupan is honey and sugar. Indication Kushta. And reference is Rasaratna Samuchaya. Then second is Tripurantak Ras, dose is 375 mg. Anupan is Nimba and Guduchi Kwat. And indication is Sarva Doshas and Kushtanasha. The third is Yoshadi Gutika, dose is 1 gram. Anupan is honey, then indication Kushta. Fourth is Kushtashan Rasa, 375 mg, honey, and indication is Kushta. Swarnakshira Rasa, dose is 3 mg, Anupan is honey, and indication is Kushta. Then sixth formulation is Chandraprabhavati, dose is 125 to 250 milligram. Anupan is honey, and indication is Shvitra. Then seventh is Shvetari Yog, dose is 3 to 6 gram. Anupan is honey, and indication is Shweta Kushta. Then Gandhadikara Ganam, dose is 12 gram, Anupan honey, and indication is Shvitra. Pushta dose is 12 gram, Anupan is warm water, and indication is Pushta. Then Brahmana Ras, dose 6 gram, Anupan is Shikil Mulkwat, and indication is Pushta. Then Chandana Rasa, dose is 125 gram, Anupan honey, and indication is Pushta. Chandrakanti Ras, 3 gram dose, Bakuchi Kalka is Anupan, and Pushta is indication. Then Arkeshwar Rasa, 250 gram dose, honey is the Anupan, and Raktamanda Pushta indication. Then Supta Pushta, 25 milligram dose, Anupan is honey, and indication is Pushta. Then Pushtakuthar Ras, dose is 250 milligram, Anupan is Nimbadikvat, and indication is Pushta. Kangeshwar Rasa, 375 milligram, and dose Kutashkvat is Anupan, and Shweta Pushta is indication. Then Narayan Rasa, 1 gram is dose, castor oil is Anupan, and Dushak Pushta is indication. Then Dhanvantari Rasa, 250 milligram dose, Haritki is Anupan, and Pushta is indication. Kasis Badhar Ras, the 375 milligram dose, honey is Anupan, and Kilas Dadru is indication. Then Triloko Vijay Rasa, 3 gram dose, Anupan is honey, and indication is Pushta. Then Shvitrari Ras, 125 to 375 milligram dose, Anupan is honey, and indication is Shvitra. Next slide, please. Hello. Kiran, dose 175 milligram, Anupan is Hana, and indication is Kilas. Then Udayaditya Rasa, dose is 250 milligram, Anupan is Bakuchi Churnan, indication is Shweta Pushta. Shitantra Rasa, dose 250 milligram, Kambul Patra, and indication is Shvitra. Parhit Rasa, 1.5 mg, Anupan is honey, and indication is Pushta. Jan, Hello. Hello.
Yes, doctor.
Am I audible?
Yes, please
Hmm. Then Mahatlik, then Arogyavardhini Vati 375 mg dose, Anupan is honey, and indication is Pushta. Then Vajradhar Rasa 65 milligram dose, Anupan is honey, and indication is Pushta. Then Sarveshwar Rasa 250 milligram dose, honey is Anupan, and Pushta is the indication. Then Manikya Tilak Rasa 250 milligram dose, honey is the Anupan, and indication is the Pushta. Then Mahatleshwar Rasa 1.5 gram dose, Bakuchi Churn is the Anupan, and Pushta is the indication. Then the Dadru Pushta Vidavaran Ras, 375 mg dose, honey is the Anupan, and indication is the Pushta. Next, discussion and conclusion. There are so many formulations described in Rasaratna Samuchay which are used in management of skin disease. Kajal is the most commonly used form of mercury in formulation, maybe due to it contains more free sulfur than other kalpas. Gandhak and its component are used more in management of skin diseases. Hartal is used in later stage of skin diseases. Hence, Rasa Aushadhis gives relief from symptoms of skin diseases and may have great role in management of skin diseases. Then limitations. Many of the formulation are unavailable in market, so it is need to manufacture such formulations and check them for therapeutic efficacy. So it will be boon for Ayurveda. There was many study conduct on the toxicity of Rasha Aushadhis. Later it's true that toxicity can happen due to various factors. But when medicine is prepared authentically, so no toxicity in the seen in the Rasa Aushadhi. Then references. These are all references. Thank you.
Thank you, doctor. Next, I invite Dr. Vishal Sudhakar.
Yes, ma'am. Ma'am, I'm audible?
Yes, doctor. Please.
Ma'am, kindly share the screen. Actually, there is technical problem in my device.
Okay, doctor, please wait.
Doctor, please start the session, doctor.
Yes, yes. Okay. Thank you so much. Good evening to all. Myself, Dr. Vishal Sudhakar Pandey, PG scholar, Department of Kaya Chikitsa from LKR Ayurved Medical College and Hospital. My guide is Dr. Viraj Shukla sir, HOD and PG director. So our presentation topic is cerebrovascular accident. It is also known as stroke. It is a specific and heavily observed in present era. Stroke is a condition when the blood supply to the specific part of the brain is disrupted, causing death of brain cells. Next slide. Specific etiology in the modern aspect, non-modifiable modifiable risk factors are more than 65 years, but it can happen after 50 years also. Gender is specifically male gender is there. Family history is hereditary, but it counts very less. Modifiable factors, risk factors are hypertension is the most specific cause for stroke. Heart disease, when there is a low ejection fraction of the patient. Smoking is the specific cause. Next slide. Excessive alcohol consumption, obesity, sleep apnea, metabolic syndrome, poor diet, drug abuse, oral contraceptive like NSAIDs and various obstructive drugs. Next slide. So specific causes are vessel wall embolus, carotid artery, most often the source. That is ICA and specific MCA arteries are there. Related to thrombus formation distal to stenosis. Cardiac sources like mitral valve stenosis, mitral valve prolapse, calcified mitral annulus, ventricular aneurysm, atrial and ventricular clot, valvular vegetation, atrial septal defect. So, and vascular sources like intracranial artery thrombus, aortic arch, atherosclerotic plaque. Plaque is the most important thing for causing the stroke. Transient hypotension like carotid stenosis. So the types of strokes are classified in ischemic or hemorrhagic based on the underlying pathophysiological findings. Ischemic stroke is like an ischemic stroke specific result from inadequate blood flow to the brain from partial or complete occlusion of any artery like ICA, MCA or PCA. These account for approximately 80% of all the strokes. So ischemic stroke are further divided into thrombotic and embolic. Thrombotic stroke is like a stroke occurs from injury to a blood vessels wall and formation of a blood clot. The lumen of the blood vessels becomes narrowed, and if it becomes occluded, infarction occurs. So thrombosis develops readily where atherosclerotic plaques have already narrowed blood vessels. Thrombotic stroke, which is the result of thrombosis or narrowed blood vessels, it is the most common cause of stroke. Two-thirds of thrombotic stroke are associated with hypertension or diabetes mellitus. Embolic stroke is like a specific emboli which goes through the artery and obstruct at anywhere in the part of the brain. Like another type of stroke may occur when the blood clot or a piece of atherosclerotic plaque, cholesterol or calcium deposit or any other component, a blood component, breaks the loose, travels through the bloodstream and lodges in the artery in the brain. When blood flow stops, brain cells do not receive the oxygen and glucose they require to function and the stroke occurs. This type of stroke is referred to as a specific embolic stroke. Clinical manifestation is like a homonymous hemoptysia, that is like a specific condition in which person sees only one side, right side or left side or whatever, means if there is a left GC bleed, gangliocapsular bleed, it is opposite side that can be vision. Loss of peripheral vision, and diplopia. Motor deficits are hemiparesis. Hemiparesis means weakness of one side, like one hand, one forearm, and one lower limb. Hemiplegia. Hemiplegia is a complete paralysis of the face, arm, and leg on the same side due to the lesion in the opposite hemisphere. Ataxia, that is the defective muscular coordination, unsteady gait, unable to keep feet together, need to a broad base stand. Dysarthria, difficulty in forming words, and dysphagia, difficulty in swallowing. So the sensory deficit is paresthesia, occurs on the right mostly, depending on the stroke, depending on the artery occlusion, occurs on the side opposite to the lesion, numbness and tingling on extremity. Verbal deficits are expressive aphasia, patient बात ही नहीं कर सकता है. Receptive aphasia, unable to comprehend the spoken word, can't speak but may not make a sense, means irrelevant talk, and global aphasia, that is a mix, expressive and receptive aphasia. It is the combination aphasia. Next slide, please. So cognitive deficits are short and long-term memory loss, decreased attention span, impaired ability to concentrate, poor abstract reasoning, altered judgment. Emotional deficit is loss of self-control, emotional liability, patient can't express their emotions, decreased tolerance to stressful situations, depression, withdrawal, fear, hostility, and anger, unnatural feeling of isolation. Next slide. Yes, diagnostic evaluation is mostly primarily diagnostic is a CT scan. It reflects almost 80% of evaluation. But for specific venous and angiogram, we require the MRI. MRI is a highly appreciable and highly routine diagnostic criteria for the stroke. Cerebral angiography, carotid angiography. EEG is the most least and end stage diagnostic evaluation for that. Next slide. Yes, management. In the way of Ayurveda, we can take it as a kapha vritta vata, and we can manage according to that. In the medical management, according to modern medicine, we can use the platelet inhibiting medications like aspirin, clopidogrel, triacylprid. Also, we can use the specific thrombolytic therapy like alteplase recombinant TPA is a genetically engineered form of TPA, a thrombolytic substance made naturally by the body. The minimum dose is 0.9 mg per kg. The maximum dose is 90 mg. Next, surgical management is a carotid endarterectomy, that is removal of an atherosclerotic plaque or thrombus from the carotid artery to prevent a stroke in patients with occlusive disease due to the extracranial cerebral arteries. This surgery is indicated for patients with symptoms of TIA, that is a transient ischemic stroke or mild stroke found due to the severe 70% to 90% occlusion of the carotid artery. So it is like an interventional neurological procedure. Next slide, please. Hemorrhagic stroke. Hemorrhagic stroke accounts for 15% of cerebrovascular disorders and are primarily caused by an intracranial or subarachnoid hemorrhage. Hemorrhagic stroke are caused by the bleeding into the brain tissue, the ventricles or the subarachnoid space. Primary intracerebral hemorrhage from the spontaneous rupture of the small vessels accounts for approximately 80% of the hemorrhagic stroke and is primarily caused by uncontrolled hypertension. Also diabetes. Pathophysiology is like pressure on the nearby cranial arteries or cranial tissues causing subarachnoid hemorrhage, increasing intracranial pressure from the sudden entry of the biomedical subarachnoid space, injuries to brain tissue or by the secondary ischemia, often resulting from the reduced receptor pressure. Yes. Next, types of hemorrhage, that is the intracerebral hemorrhage, intracranial aneurysm. Aneurysm is the most finding cause for present era, and also SH like subarachnoid hemorrhage. Next, clinical manifestation for the hemorrhagic stroke is severe headache, mostly same, loss of unconscious, rigidity of the back and neck, that is the pain in spine due to the meningeal irritation, visual disturbance, visual loss, diplopia, ptosis, dizziness, and hemiparesis. This is the most primary. Same diagnostic criteria like a CT scan to determine the size and location of the hematoma as well as presence and the absence of ventricular blood. So cerebral angiography is the typical specific criteria for hemorrhagic stroke. We can calculate aneurysms in them also. And also we can diagnose the specific bleed areas and damaged areas of the brain. So AVM, arteriovenous malformation, also we can diagnose by that. MRI is end stage diagnostic criteria for hemorrhagic stroke. Management is like antihypertensive agent to reduce the blood pressure and other risk factor of heart disease. Osmotic diuretics to increase the ICP in the to decrease the ICP in the subarachnoid space, like mannitol. Anticonvulsant like levetiracetam and related lacosam. It's like to prevent the seizure recurrence. Next, surgical management is like in hemorrhagic stroke, craniotomy. Many patients with a primary intracerebral hemorrhage are not treated surgically, so we can manage it conservatively. However, the surgical intervention is evacuation is strongly recommended for the patient with cerebral hemorrhage. If the diameter exceeds 3 centimeter, means if there is a midline shift is more than 15 to 16 mm, then there must be a surgical management, and surgical evacuation is the most frequently accomplished via craniotomy. Extracranial and intracranial arterial bypass, and extracranial intracranial arterial bypass is maybe a performed to establish collateral blood supply to allow the surgery on the aneurysm, but it is specifically done in aneurysm cases, not in every hemorrhagic or non-hemorrhagic stroke cases. Alternatively, an extracranial method may be used whereby the carotid artery is gradually occluded in the neck to reduce the pressure. So mostly it is according to Ayurveda, it is the kapha vrutta vat, but in Ayurveda we can treat the patient from presenting complaints like hypertension and diabetes mellitus. If we control the hypertension and diabetes mellitus, definitely it will prevent the stroke more than 95%. Thank you so much.
Thank you, doctor.
Thank you so much.
Next, I invite Dr. Prachi Bharat. I invite Dr. Prachi Bharat.
Yes, ma'am. Ma'am, can you share my slide? I'm not able to share.
1 minute, doctor.
Sir, I'm not able to share the slide.
I will share for you, doctor. 1 minute.
Yeah, thank you.
Doctor, can you send the PPT to my WhatsApp?
Yes, sir.
I will share for I will share for you, doctor. 1 minute.
Yes, sir.
Doctor, please start the session, doctor.
Yes, myself Prachi Kadu, Department of Panchakarma from SMBT Ayurved College under guidance of Dr. Anil Wag, HOD Department of Panchakarma. My today's topic is effect of Janubasti and Nadi Sweden in the Janu Sandhigatvat, a case study. Introduction to the topic. Joint pain is one of the very frequent complaints among the elderly people, especially due to osteoarthritis. Osteoarthritis is a chronic degenerative disorder which mainly affects the large weight-bearing joints like knee joint, hip joint. The present activities are prone cause of many diseases. Lifestyle, environment changes are the important terms which are related to the cause of the disease. Sandhigatvad is among the Vatvyadi and it is commonest form of articular disorder. Ayurvedic classics highlight the degenerative diseases under the concept of Dhatukshay and Dhatu Shaithilya. In Janu Sandhigatvat, Vat gets accumulated in the knee joint, leading to pain, stiffness, swelling, reduced movement, and cracking sound from the knee joint. Snehan and Sweden are described as the commonest treatment in the Vat Vyadi.
Sandhigatvat. Sandhigatvat is one of the 18 Anatmaj Vatvyadis described in Ayurvedic text. Foremost description of Vatvyadi is given in Charak Samhita. Vat Purna Druti Sparsha Shotha Sandhigat Vat Anile Prasadana Savedna is described in Charak Samhita, which means Vatapurna Druti Sparsha, coarse crepitation, Shoth means swelling, and Prasanan Akunchana Pravrutti Savedna, which means pain and during flexion and extension of the joint are clinical features of the Sandhigat Vat. Sthana Shanshri of the Vat dosh in the Janu Sandhi, which results in the development of disease known as the Janu Sandhigat Vat. The line of treatment of the Sandhigat Vat is mainly focused on the elevation of the Vat dosh. Acharya Charak explained the ventilated Vat dosh can be best treated with the oil. Snehan Sweden or affected part is advised in treatment of Vat Vyadhi, which helps in reducing the Prakupit Vata doshas, thereby decreasing the symptoms like stiffness, pain, crepitation. This improves the flexibility of the joint. संप्राप्ती देहे स्रोतांस रिक्तानि पुरेत्वा अनिलो बली करोति विविधान व्याधीना सर्वांग एकांग संश्रितान is described in Charak Samhita. Excessive intake of uncourteous food items, excessive walking, physical activities, direct injury, suppression of natural allergies are commonest factors which aggravates the Vata dosha. As Vata gets ventilated, its guna like Ruksha, Shita, Laghu, Chal are increased inform the natural levels in different combinations. Use of drug combinations with opposite gunas like Sneha, Ushna, Guru, Sthir are advised to normalize the ventilated Vata doshas. In the development of Vata Vyadhi, it is mentioned that aggravated Vata occupies the empty space of the body. In Janu Sandhigat Vata, Ruksha, Shita gunas are mainly aggravated, which leads to the Dhatukshay. चिकित्सा कुर्यात संधिगत वाते दाह स्वेदोक उपनाहनम is described in Yogi Ratnakar. In Sandhigat Vat Chikitsa, Bahya and Abhyantar Snehan, Svedan, Lepa, Anuloman, Raktamokshan, and Dahan Karma are described. In Dhatukshay Janya, that is in Nirupstambit Sandhigatvat, Bahya and Abhyantar Snehan are important. In both the Sandhigatvat, it is in Upastambit and Nirupstambit Sandhigatvat, Svedan is important. The line of treatment of Sandhigatvat is mainly focused in elevation of the Vat doshas. Acharya Charak explained ventilated Vat dosh can be best treated with the oil Snehan Svedan or affected part in the treatment of Vatvadi helps in reducing like stiffness, pain, crepitation, and thus increases flexibility of the joint. Janu Sandhi, Janu Basti. Janu Basti can be considered as Bahiparimarjan Chikitsa. That is, it is type of Bahya Snehan and Svedan. Different types of oils are used according to the disease. Where Mahanaran there is well-known Ayurvedic formulation that can be indicated in different types of the Vatvadi. For the case study, a 72 years old male patient with the head chief complaints of the pain over left knee joint since 3 years visited the OPD. Patients experienced difficulty in walking with pain with cracking sound over the knee joints. He had previous history, was taking anti-inflammatory medicines occasionally when pain increased, was having typical analgesic gait, and no history of the major illness or other trauma. On examination of the left knee joint crepitation was palpable and was audible. Skin over knee joint was normal and was visible swelling was present. After clinical examinations, assessment of patient was advised to take Janu Basti with Mahanera and Tel with followed by Dashmul Kwat Nadi Sveda. In this case, 7 days therapy session with follow-up on 14th day of treatment and assessment of parameters done before therapy and at the end of the session. Assessment parameters were Vatapurna Dhrutisparsha, Shotha, Sandhi Shula, Prasanana Akunchana Pravrutti Savedna. This table shows before and after treatment, that is decrease in the signs and symptoms of the patient. In this case study, patient initially had severe joint pain with swelling over the joint. After Janu Basti session, the symptoms severely relieved. Joint pain crepitation during walking in the beginning also relieved after Janu Basti. Nadi Swedan is among the 13 types of Swedan indicated in a treatment of Vatvadi. In this study, swelling over the knee joint was completely relieved after Janu Basti, followed by Nadi Swedan with Dashmulpat. This may be because of the Shothar property of the Dashmul. As Vat gets increased, its guna like Ruksha, Shita, Laghu, would also increase in the natural forms, from the natural levels. Use of herbal formulations having opposite gunas like Sneha, Ushna, Guru, Sthir are advised to normalize the increased Vat dosha. Janusandhigatvat is very prevalent musculoskeletal disease in the elderly people, chiefly caused by the Vat dosh. This case study includes that the Mahanarayan till Janubasti followed by Dashmukvat. Nadisved is effective in the management of Vat Vyadhi. Thank you.
Thank you, doctor. Next, I invite Dr. Kalyani Mittal Kumar. I invite Dr. Kalyani.
Dr. Kalyani, are you there? Next, I would like to invite Dr. Rahul for the paper presentation on the topic immunity enhancement in children. Dr. Rahul, are you there?
Hello. Good evening, sir.
Good evening, Doctor.
Hello.
Doctor, please share the screen, doctor. Your voice is clear, doctor.
Sir, please share my slide.
1 minute, doctor. Hello, doctor.
Hello, sir.
Doctor, can you send me the PPT to my WhatsApp?
WhatsApp, sir.
Yeah, doctor. Doctor,
Oh,
you talk here. I will share for you, doctor. 1 minute.
Hello.
ते बाहेर जर घेऊन जर काय नसेल तर घेऊन जाणार आहे काम करत
Hello, doctor. Is it visible? Hello, Dr. Rahul. Is it visible? Hello, Dr. Rahul.
हाँ sir, I am Rahul Hoge. This is not my PPT, sir.
Doctor, please send me
Hello.
your PPT in my WhatsApp. I will call you on after next.
Okay, sir. Sorry. Okay.
Next, I will invite Dr. Ashini for the paper presentation. Dr. Ashini, are you there?
Okay.
Hello, Dr. Ashini, are you there?
Yes, sir. Can you please share my PPT, sir?
1 minute, doctor.
Hello.
Hello, doctor.
Huh?
1 minute. Doctor, please start the session, doctor.
Okay, thank you, sir. Myself, Dr. Ashwini Parthi, PG scholar, Yashwant Ayurvedic College, Kodoli, Kolhapur. My topic name is Importance of Karna Puran in Daily Routine under the guidance of Dr. Chandrasekhar Moe, HOD, Head of the Department of Shalakya Tantra, Yashwant Ayurvedic College, Kodoli, Kolhapur. Next, here the image of Karna Puran. Abstract. Ear is important sense organ in our body. It enables hearing and body balance by using vestibular system. Karna means ear and Puran means filling and the pouring. Karna Puran is better option for ear diseases. Karna Puran means putting the medicated oil in ears. Karna Puran is one of types of Sneha Vicharana. It means Sneha which do not undergo in digestion system. It lubricates the delicate filaments of the ear canal, remove impurities and improve hearing capacity. The ears are considered one of the seats of Vata doshas and therefore prone to Vata disorder. Karnapuran aids in prevention and the management of several auditory disorders. Introduction. Karnapuran is unique procedure which is used in Udva Chaturgat Radhi. Acharya Charak explained in detail Karnapuran in Charak Sanhita in context of the Virechan Sneha. In Karnapuran procedure, warm medicated oil or the medicated liquid is gently slowly poured into the ears. Karnapuran begins with ear and partial head massage. Then slightly warm medicated oil is poured slowly in drops into the ears. For Karnapuran oil mutra swaras grip can be used. According to Ayurveda, Karnapuran used as a daily routine therapy for strengthening ear function and preventing ear disorder. According to Charak, ear disorder like the Vata ear disorder, Karna Shud, Karna Badhirya, Manya and Hanurok, Karna Strav, and according to Sushrut, Hanu Manya Shirorok Yogas, Karnapuran is used for the cure. Karnapuran can be used as a daily regimen or in disease condition. Aims and objective to study the Karnapuran, to review the standard procedure of Karnapuran, to study mode of action of Karnapuran. Karnapuran procedure according to Sahita. The material requires a small steel bowl, cotton, Karnapuran dravya, abhyanga table, dropper, stove, towel, and panchakarma room. Purva karma. Confirm the patient should be fit for this procedure. After examining the patient, if he is fit, we can start this procedure. After that, patient is given head massage with lukewarm oil around the ear area and the neck portion also. After Snehan Svedan like Tapa Svedan should be given to patient. Pradhan Karma. After Purva Karma, the lukewarm oil should be checked as a patient can wear that oil. The ear canal should be strengthened by the pulling the pin of ear backward and the upward. Then oil should be slowly poured into the ear. Hello? Hello?
Please continue, doctor.
Then oil should be slowly poured into the ear till canal is filled base of concave. After this, gently area over the root of ear massage in order to potentiate the action of drug. Patient should be retained in same position for 2 minutes, that is the 100 matra. Duration, according to Acharyas, matra should be in Karna Roga 100 matra, in Kantha Rog 500 matra, in Shiro Roga 1000 matra, in painful condition thin pain relieves, in Swastha 100 matra. 100 matra is approximately 2 to 3 minutes. Time, Rasadravya used before the meal and Tel Dravya used after the meal. कर्णपुराण द्रव्य, ऑइल, तिल तेल, सरसपादी तेल, निर्गुंडी तेल, अपामार्गादी तेल, बिल्वादी तेल, क्षीरबला तेल, दीपिका तेल, अर्क तेल, लहसुन तेल, घृत, पुराण घृत, स्वरस, अर्क, तुलसी, लहसुन, अदरक, अष्टमूत्र like गोमूत्र, अजामूत्र, milk, kanji. Till then can be used for the daily karnapuran. Paschat karma. After pradhan karma, the excess oil should be taken out of external auditory canal by dry cotton mopping. The ear should be cleaned with dry cotton carefully. If both ears are affected, the same procedure is followed one by one. Pathya. Acharya Yoga Ratnakar and Sushrup define Pathya for ear diseases. Acharya Yoga Ratnakar well defined Pathya in Sahita. Lagu diet like the Godum, Mugdha, Shali rice, Purana Grita, Yava, Patol, Shigru are used in Karnarogas. Other therapy like Svedan Virechan, Vaman, Nasya, Dhum, Shiro Virechan, Brahmacharya are recommended. In Mans Varga like the Lava, Mayura, Harin, Kukutak can be eaten. Apathya. A person with ear diseases should avoid the object introducing ear, humid climate, head bath, forcefully brushing the teeth, excessive talking, heavy exercise. These things should be avoided because it increases what? Indication: tinnitus, earwax, congested ear canal, karnakandu, karnastrav, karnashul, headache, neck pain, migraine, hearing loss, jaw pain, Meniere's disease, brahmacharya, vertigo, acoustic nerve weakness, Vata disorder. Contraindication: tympanic membrane perforation, chronic otitis media, abrasion, bleeding of ears. So next please. Importance in mode of action in Karnapuran. In Karnapuran, we use steel, swaras, grit-like material. These materials are like a type of Snehadravya. It nourishes the cells and canal ear structure very well. In Purva Karma, we give massage, that is the Sneha to head neck area with lukewarm oil. This activity causes rise in blood circulation in ear portion. And after that, we give Svedan for a while, cause increases in permeability in capillaries and vasodilation. It will help in more absorbing drugs. It will cause stimulation to nerve endings and the vessels. They'll have property like Vatshaman. It do not aggravate cough, and in Karna Rog there is vitiation of the Vat doshas. Medicated tail Ghita are made by the Sneha Kalpana Vidhi. That's why fat soluble active ingredients of drug easily gets enclosed and can be easily integrated through the nerve ending. Because of Karnapuran Dravya, medicine are absorbed by ear through skin and cures the diseases of ear and maintain the healthy ear structure. Advantages of Karnapuran. Karnapuran help in hearing loss. It improves hearing capacity. Karnapuran help in nourish the acoustic nerve. It will improve signal to brain. It also increases better interpretation of sound by hearing center of brain. Karnapuran helps to prevent the recurrent ear infection. It will help to strengthen the ear structure. It is very helpful for balance of our body, balance disorder like the vertigo and the dizziness. Karnapuran helps it decreasing the symptoms of migraine and headache. Medicated oils are used in painful ears. It will help to reduce the ear inflammation. Discussion. Ear is important organ in our body. Ear having the function like hearing and maintaining the balance of body. So for to keep in healthy state, we keep watch on ear continuously. According to Sushrutacharya, there are total 28 Karna Rogas. Mostly Vataja and Pitta doshas are vitiated. In Karna Rogas, the symptoms like Karnashul, Karnastrav and Karnakandu, Karnanath. So using Karnapuran, we can cure the ear diseases when in Karnapuran Mutra is used in otitis externa, ASOM, Krimikarna, furunculosis, causes the Shodhana of Strotas. Conclusion. In Ayurvedic literature, Karnapuran recommended as daily routine in Dincharya as well as using ear diseases. In this era, people's lifestyle is changed like a food consumption, their minimum daily workout, excessive headphone uses leading to early aging and weak the senses organ. Karnapuran like procedure prevent this early aging changes in the ear. Karnapuran is easy to perform, easily available, economical, and can be used as daily regimen. So next, please. Karnapuran having the properties like Shodhan, Shaman, prevention. And the Karnapuran Dravya Tel, Sneha made with herbal drugs, Mutra having properties like remove vitiated doshas. It removes the malasanga and cleaning the sotasa. They also provide the strength by the balya property of drug use. If various diseases are taken to account, different drugs should be used according to predominance of doshas. So people have very effective treatment without any side effect and the economical drug. In modern science, lot of strong antibiotic and anti-inflammatory drugs, steroids are available, but their effect is very less. They also have more recurrence rate. So for more effect, negligible recurrence and strengthening the ear, we can use Karnapuran as daily regimen in our daily routine. Here are the references. Thank you.
Thank you, doctor. Next, I invite Dr. Pooja Daghe. I invite Dr. Pooja Daghe.
Good evening, ma'am. Yes.
Good evening.
Good evening. Ma'am, can you please share my PPT?
Okay, doctor, please wait.
Hello, Dr. Pooja.
Yes, sir.
Doctor, can you send me the PPT to my WhatsApp?
Okay, sir. On this number, no?
Yes, doctor.
Okay.
Doctor, please send your PPT to Dr. Sabin.
Yes,
and you
madam.
can present next.
Okay, madam.
Now I invite Dr. Shivani Bhaskar.
Hello, ma'am. Am I audible?
Yes, doctor, you're audible. Please start.
Is my ma'am?
It's visible, doctor.
Okay. Am I audible?
Audible, doctor. Please start the session, doctor.
Good evening, everyone. Myself, Shivani Bhaskar Kosambe, under the guidance of Dr. Vrinda Kaknorkar, HOD of Department of Rog Nidan Evam Vikruti Vignan, Sumatibai Shah Ayurved Mahavidyalay, Hadapsar, Pune. The name of my topic is a case study on role of Shodhan in Shitapitta. Shodhan is a unique concept explained in Ayurveda for curing chronic and acute stages of disease and also for promotion of healthy state as only a part of treatment. Shaman Chikitsa has no satisfactory answer for the prevention of disease, and Shodhan is intended to cure disease from its root. Shitapitta is one of the conditions that is found in Bahudosha Lakshana and also mentioned in Charak Sutra 16th chapter as Pitika Kot Kandu, and its treatment being mentioned as adoption of various Shodhan therapies depending on the predominance of dosha in Sthan. Presenting a case, a 45 years old female housewife complaining about itching all over the body since 1 year, which was associated with maculopapular eruption and itching and burning sensation, which aggravated in the late evening and night. On taking history, excessive intake of curd, non-veg weekly thrice, stress, and history of typhoid 3 years ago was noted. Let us move to the Samprapti. Nidan Sevan, which vitiates Tridosh predominantly, Kapha and Pitta, which enters into the Dhatu, mainly Rasa and Rakta, which shows following Lakshanas. Sakandu Stoda Bahula Shardi, Jvara Vidahavantam, Udardam iti tam Vidyat, Shita Pittam Athapare. In Charak Chikitsa Sthan Jwara Adhyay, it is mentioned that Adishete Yatha Bhumim Bijam Kalecha Rohati, Adishete Tata Dhatum Dosha Kalecha Kupyati. As a seed remain dormant, uh, as seed remain dormant on the soil till suitable time when it germinate. Similarly, the doshas remain inactive in the dhatu, and during appropriate time it gets aggravated. दोषा कदाचित कुप्यन्ति जिता लंघन पाचनैः जिता संशोधने येतु न तेषां पुनरुद्भवः. In Charak Sutrasthan 16th Adhyay, it is mentioned that if Langan and Pachan is done on the aggravated dosha, there are chances of revitiation, but Shodhan eliminates the dosha from the root. Different modalities of Tiryagat dosha are Vrudhya, Vishandanat, Pakat, Srotomukha Vishodhanat, Vayoscha Nigrahat. Snehan and Svedan reaches up to the dhatu by Sukshma Guna. This increases the doshas and Kledan karma occurs. By virtue of Snigdha Sara Drava Guna, doshas liquefies. Svedan does Amapachan. Svedan removes obstruction in the srotas by digesting the am. Snehan and Svedan pacifies the Vat by Snigdha and Ushna Guna. By controlling the Vat and by Snehan and Svedan, dosha move from the Shakha to Koshta. Aim of my study is to study the effect of Shodhan Chikitsa in management of Shita Pitta. Objective to study the application of Shodhan Chikitsa in management of Shita Pitta. Materials and methods. 45 years female patient was taken with prior consent and sign and symptoms of the patient was noted before and after the Shodhan therapy. Treatment given on admission was Panchakol Fund 50 ml at 4 p.m. and 7 p.m. Snehapan done 5 days in increasing order 30 ml, 60 ml, 90 ml and 120 ml with Sukumar Gruta. Abhyanga for 2 days with Pinda Tel followed by Bashpa Swed was done. Virechan on discharge Kumari Asa 4 teaspoon was given bias a day before food. Suchekar was given 2 times 2 tablets BD before food. Tab Haritaki was given 2 times BD after food. Discussion. The concept of Shodhan is chosen in this disease in order to justify the statement of Acharya Charak in Chikitsa Prabhuti Adhyay as quote Utkot to be one among the Bahudosh Lakshana. The Chikitsa advises Shodhan. Virechan is the most suited therapy in above particular case. Sukumar Vruta is mentioned in Vidradi Vrudhi Chikitsa of Ashtang Hridaya Samhita. Trivrut Leha was chosen since it's indicated as Sarva Kalam Cha Deham. Draksha Kashayam was chosen with the interest of Anupan, which would help in the Saran of Mala, as also does the Pitta Shaman, controls Ayog due to its Mrudutva. On giving treatment, result was noted as itching reduced markedly, maculopapular lesions and burning sensation reduced markedly. No evening and late night eruption was noted. And conclusion was, quote, Udar the Kandu is mentioned as Bahudosha Lakshanas, hence Shodhan therapy is indicated and effective. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Kiran Purushottam for the paper presentation on the topic Study the clinical efficiency of Amrita Gugulu in the management of Saulya. Dr. Kiran Purushottam Gaikot, are you there? Dr. Kiran, are you there? Hello, Dr. Kiran, are you there? Okay, next I would like to invite Dr. Amrita Jagadish for the paper presentation. Dr. Amrita, are you there? Hello, Dr. Amrita, are you there?
Hello.
Hello.
Hello, sir. Am I audible?
Audible, doctor, but
Yes,
your voice is very low,
Doctor.
doctor.
Okay.
Can you please increase your voice?
Yes, sir. Hello. Hello.
Doctor, you are audible. Please start.
Please start the session,
Okay.
doctor.
It's visible, doctor.
Okay. Hello everyone, myself Dr. Amrita Rajendra, PG Scholar from Kiyashari Department of Government Health College, Umarabad, Maharashtra. My today's topic of presentation is the concept of geriatrics in Ayurveda. So starting with the introduction, geriatrics. Geriatrics means related to old age and I think is related to medicine. So geriatrics is basically a big word. Then the need of the study, according to the WHO between 2015 to 2050, the proportion of world population over 6 years will nearly double from 12% to 22%. As the pace of population of aging is much faster than in the past, all countries face major challenges to ensure that their health and social system has to be ready to make most of their demographic shift. Then geriatrics in Ayurveda, Acharya Bhagavata explained these 8 faculties of Ayurveda as Kaya, Bala, Grihna, Purnamka, Shalya, Darsha, Jara and Dusha. So this Jara is nothing but a geriatric. Then Acharya Sharandhara explained these 6 decades of life. In this, he explained decade by definition of body element. As in first decade, Balyavastha will be diminished. In the second, Vriddhi. In third, Chavi. In fourth, Medha. And fifth, Swaksnigdhata. And sixth, Drishti, and so on. So it basically indicates the steadily increasing catabolic processes in body, and this happens because of degradation of the bodily elements, that is the Paramanu Vibhaga. So we can say that Jara Avastha is the latter phase of life in which there is a declination of bodily elements and increased catabolic reactions in body. So as we all know, along with the process of aging, some structural and functional changes occur in human body, and it is quite tedious in old age to live with the same dietary habits, social and personal habits that we used to follow in our young age due to the physical and mental incapabilities that comes with the old age. So we need to adapt some lifestyle modification. So aim of this study is to understand the concept of geriatrics in Ayurveda, and objectives are to understand the importance of study of geriatrics and to understand the lifestyle adaptations in geriatrics. Then the materials and methods. These 4 classic Ayurveda texts I have used for this conceptual study, as well as from some recent scientific work. Review of literature. From birth to stage of early adulthood, anabolism is dominant in human body, whereas in adulthood there is a dominance of catabolic reactions, and there are several factors which can alter the rate of these processes and indirectly affect the aging process. So the factors that affect the process of aging include the temperament of an individual, that we can say prakriti of an individual, even more or a dietary habits, physical exercise regime. Hello? Hello?
Doctor, please continue.
Okay. So these factors include as a prakriti, and though the prakriti of an individual is predetermined by birth, the predominance of doshas changes according to the age. As in Balyavastha, there is a Kapha dosha aditya. So Kapha dosha Vridhijanya Vikara tends to occur more. In Tarjanya Avastha, there is a predominance of Pitta dosha, and they in the Vardhakya Avastha, there is a predominance of Vata dosha. So old age people are more prone to develop a Vata dosha Vridhijanya Vikara. Then, so for this purpose, lifestyle adaptation must be done by considering either age, sex, and habitat. In Ayurveda, mainly 2 types of adaptations are suggested. That is the aharas, that is the dietary regimen, and viharas, that is the exercise, etc. So starting with the aharas or dietary regimen, Rasayan Chikitsa is indicated in Jara. So various acharyas of Ayurveda explain this Rasayan Chikitsa by their own perspective. Like Sushruta says, Rasayana is the Vayasthapak, that is towards the aging process. According to Charaka, Rasayana is one thing which increases longevity, making Medha, etc. According to Sharandhara, Rasayana is one which cures the diseases arising due to old age, and Dalana says Rasayana is nothing but a continuous nourishment of a Rasadi Dhatu. Then second is sufficient intake of Snigdha and Dravadravya. Then third is Bahya and Abhyantar Snehana is specifically mentioned in lifestyle adaptation in Jara Avastha. Then Guru Guna Dravya has to be restricted from diet. Watch for the state of Agni before taking the heavy meals. As age advances, Agni gets diminished due to several factors, and this Mandagni is told to be the cause of origin of several diseases in Ayurveda. Then as this Mandagni is the trouble factor, adapt them for intake of Lagu and Siddhahara and in geriatric age group. In old age people, they may have rasakshaya, that is the relative deficiency of rasadhatu. So to overcome this, we have to advise them to increase the intake of Prinana Dravya. To get protection from the seasonal illnesses and contagious diseases, one has to follow
So adaptation to physical exercise. This Charaka explained this during this period of pandemic, as we observed, is grossly observed that people, old age people, seem to have more susceptible to negative changes in emotional and physical health. This physical exercise is most commendatory and cheapest way to get away from this negativity around. So along with the dietary regimen, one has to follow the exercise regimen to maximize the wellness of himself. Then second is Sadhavritta, is the codes of conduct. In Charaksamhita, Acharya Charaka prescribes this list of good conducts like ethical, social, mental, moral, and physical conduct, which dictate us about what to do and what not to do in day-to-day life. So these adaptations to these codes of conduct, one can live truly peacefully and healthy life. Then I think geriatric age group control over mana tends to lose due to the imbalance of sattva, raja, and tama, and vata vritti as well. So we can counsel them regarding adaptation to these codes of conduct. Then the pattern of social relation. As we interact with people almost every day in our life, sociologists have identified the different patterns of social interactions, which involves the exchange of emotion. As we say, sharing is caring. It is scientifically proven that good conversation with your loved ones can reduce the stress up to certain extent. Then the sleep pattern, as Ayurveda promotes a lifestyle that is in harmony with nature. So our biological clock is set as per pineal gland according to day and night. As geriatric age group people are mostly retired from their workplaces and degenerative changes are taking in the body, they tend to sleep in daytime. And as they are taking rest in daytime and reduce the physical exertion, their night sleep pattern gets affected. And this disturbed sleep pattern can cause various side effects in body. So setting their daily schedule and sleep pattern is important adaptation anyone can suggest. Then last is entertainment and dressing sense. In Charaka, it is explained that Suchi Vastra Dharana, that is wearing a clean and white cloth, helps to settle down the emotional disturbance. So this adaptation may add some stability in their life. Then last is discussion and conclusion. So based on above mentioned literature and facts, Vardhakyavastha is irreversible condition that can only be stabilized. Good control over Vata element in body during Vardhakyavastha can help an individual to ease the obstacles in achieving health by following daily regimen. And there is no treatment for natural aging. However, early onset of aging can be managed with diet and rasayana or rejuvenation therapy. Though we cannot stop or reverse the process of aging, we can surely slow down this process and help an individual to get older with so much ease by accepting some lifestyle adaptations. Thank you. Thank you, everyone.
Thank you, doctor. Next, I invite Dr. Pooja Dage.
Hello, madam.
Hello, doctor.
Yes, sir.
Dr. Pooja Dage, please start.
Yeah, ma'am. Ma'am, I have sent my PPT to Sabin, sir, WhatsApp.
He will share it now.
Okay, madam. Okay.
Doctor, please start the session, doctor.
Yeah, okay. Myself, Dr. Pooja Dhage. My paper presentation topic is the role of Ayurveda in management of molluscum contagiosum in eye. I am PG scholar from Shalakya Tantra department. Introduction. Molluscum contagiosum is a skin infection caused by virus Molluscum contagios. In Ayurveda, Ajyagalika is described in the context of Shudra Rogas, that means the disease which have less or no symptoms, with less pain or without pain. Ajyagalika is one among the Shudra Rogas mentioned in Ayurvedic disease. It usually occurs in children but can also occur in adults. In present study, Ajyagalika was treated with Pratisarniya Sharakarma, which is the line of treatment mentioned for Ajyagalika in the text of Chakradatta. The clinical features are shown in the diagram. The image of eye, around eye. The average incubation period is of 2 to 7 weeks. First sign is the appearance of small group of painless lesions around eye. In person with healthy immune system, no treatment is needed. The most effective treatment for molluscum contagiosum include cryotherapy, curettage, laser and topical therapy. According to Ayurveda, the chikitsa is The treatment of Ajjagalika can be divided into two depending upon whether it is inflamed or not. In non-infectious cases, application of herbal paste is done. Jaloka is advised for clearing the localized impurity of blood, that is the Rakta Shuddhi. Once it is inflamed, treatment of the wound spurred is done. The home remedies which are used are applying turmeric paste, lose excess weight or shred off the excess fat, apply apple cider vinegar intake, avoid intake of fats in food, and take enough omega-3 fatty acids. Yoga treatment can be done. Regular stretching and cardio exercise are advised. Specific yoga charya including Nadi Shuddhi, Pranayam, Bhujanga Asana, and Pavana Mukta Asana is also recommended. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Kiran Purushottam Gaikwad. I invite Dr. Kiran Purushottam Gaikwad.
हाँ सुन रहे क्या? हेलो.
Yes, doctor.
हाँ
Yes,
सुन
you
रहे
are
ना?
audible. Please,
हाँ.
please share the screen.
मैंने पीपीटी.
Doctor, your voice is breaking.
हेलो. हेलो.
Yes, doctor, you are audible. Please start.
हाँ क्या मैडम? हेलो.
G, share the screen and then start.
हेलो.
Hello, Dr. Kiran. Please share the screen and start your presentation.
नाही तुम्हाला दुसरं काम होतं.
हेलो डॉक्टर
प्रेजेंट
किरण.
करूँ क्या मैं?
जी आप कीजिए. First, share the screen.
हेलो.
Doctor. Hello, doctor.
हेलो. हाँ पीपीटी व्हाट्सएप पे भेजा था ना मैंने, वो इश्यू था मेरा. हेलो. हेलो.
Please start the
Hello.
session, doctor. You are audible.
हाँ. टाइटल है मेरा स्टडी द क्लिनिकल एफिकेसी ऑफ अमृतादी गुड़ इन द मैनेजमेंट ऑफ सौल्य. एब्स्ट्रैक्ट. सौल्य इज अ क्रोनिक
Excuse
डिसीज
me, doctor.
मेजर
Excuse me.
हाँ.
Please share the screen, doctor.
ये
Please share your PPT.
ये शेयर नहीं हो रही मैडम.
Okay, doctor.
ये शेयर नहीं हो रही, प्रॉब्लम है कुछ.
Doctor,
हेलो मैडम.
your voice is very.
मैंने पीपीटी व्हाट्सएप पे भेजी
Hello?
थी मैंने वो पीपीटी।
Your voice
पीपीटी
is
व्हाट्सएप पे
breaking,
भेजी
doctor.
थी
I think
मैंने।
there is some network issue. Yeah, you have to share it. If you can't, then we will try.
विदाउट शेयर नहीं हो सकता। हेलो हेलो
Doctor,
Hello,
doctor,
Dr. Kiran.
please wait. We are trying to share.
Dr. Kiran, please start the session, doctor. Hello, Dr. Kiran. Hello, Dr. Kiran. Hello, Dr. Kiran Gaikot. Can you hear me?
Dr. Kiran.
Hello, Dr. Kiran Gaikot. Can you hear me?
हेलो
Hello, Dr. Kiran. Please start the session, Dr. Kiran.
हाँ study the clinical efficacy of अमृतादी गोकुल in management of abstract. Saulya is chronic disease in and developing countries. Saulya is not like the disease which show symptom in primary Saulya. We hereby report having symptom excessive deposition, abnormal circumference of Drobal. 6 months was select hair had a flea in a day with Madhu and follow every 15 days up to 6 months. After this treatment, start effectively in Your Saulya, Amrutadi Gul, Madhu, and BMI. Introduction. Airway. Authorized Svikar Prashaman. Acharya has mentioned Saulya, one of the a person having pendulous appearance of speech if udar, abdomen, chest due to excessive formation of made and Mansa Dhatu along with reduced gel toward it's called Atistulya. Atistul can be correlated with obesity, deposition of fat tissue in the body before male patient with complaints of excessive deposition of fat or overweight. Sudaditya, abdominal circumference, Robanda. We are at 500 mg tablet of Amroti Google twice in a day with Madhu and follow every 15 days up to 6 months. After this treatment was effectively reduced symptoms which are above mentioned in patient. Discussion. Hello.
Doctor, please continue, doctor.
Dearrangement of Agni or digestive power
Please
leads to
continue.
production which disturb fish fiber of fatty tissue, Dhatvagni, and block form fatty tissue accumulate in the body, causing staulia. Lack of physical activity, frequent intake of food, various type of junk food, increased amount of drink resulting in obesity. Conclusion: Staulia can be correlated with obesity, extra abdominal fat, obesity as an abnormal growth of addition in fat cell number with combination of both. Disease: large number of drugs are indicated in Staulia disease. Among them are Amrutadi Gugul, are select because of all these contain of Amrutadi Gugul, Ruksha, market today and relatively cheap in Staulia disease, and below is a references. Hello.
Thank
Thank
you,
you,
doctor.
madam.
Thank you, doctor.
Thank
Now
you.
I invite.
Welcome.
Okay, doctor. Thank you so much. Now I invite Dr. Rahul Bau Saheb.
Hello. Hello.
Hello, Dr.
Doctor, you're
Rahul.
audible.
हाँ sir. Please share my slides.
1 minute, doctor. Doctor, please start the session, doctor.
Okay, sir. Hello everyone. My name is Rahul Bhausai Bhoge, Government Ayurvedic College, Nanded. My topic is immunity enhancement in children. Next slide, please. Abstract. Ayurveda is a natural health care system that originated in India more than 5,000 years ago. Its main objective is to achieve optimal health and well-being through the comprehensive approach that address mind, body, behavior, and environment. In Ayurvedic Samhita, there are description of various tonics or immunoboosters that builds up the child's strength to fight the disease. Next slide. Immune system is the cornerstone of good health. Immunity is the balanced state of the having adequate biological defense to fight infections, diseases, or the unwanted biological invasion while having tolerance to avoid allergy and autoimmune disease. A number of Indian medical plants and various rasayanas have immunomodulatory activity. In Ayurveda, it defined as the Vedic Shamakta. In children, it is improved by Lehan Karma by various herbo mineral formulations. The use of Ayurvedic immunomodulator improves the overall children growth by decreasing the morbidity and also mortality. Next slide, please. Introduction. Vedic Shamakta, as is understood in Ayurveda, has much wider implication that the term immunity used in modern medicine. Chakrapani Datta has interpreted the term Vedic Shamato as Vyadhi Bala Virodhitva, that is antagonistic to the strength and the virulence of the disease, and Vyadhi Utpad uh, Pratibandhakva, that is the capacity to inbuild and bind the cause and the factors of the disease. Also, childhood is the phase which seeks constant attention as well as freedom. At the same time, allow them top in the rain and sun, also them eventually by exploring, not destroying the nature, but before that make sure that basic health concerns are take care of. Next slide, please. Immunity enhancer mentioned in the Ayurvedic in children. Some important concept in Ayurveda regarding immunity are rasayana. Apparently, rasayana means improve the state of the nourishment, which in turn affords increase immunity and youthfulness. Rasayanas can be a drug, diet, or even a lifestyle and conduct. The rasayana are supposed to strengthen oja and bala, that is biostrength with natural resistance against aging and the disease. It is started to contribute to integrity of the body tissues and thus increases longevity. Next slide, please. Benefits of rasayana. Rasayana measured act by one of the following three ways: acting at the level of rasa, acting at the level of agni, and acting at the level of srotas. First one is acting at the level of rasa is thus directly improving the quality of nutrition. Acting at the level of agni, that is by improving the digestion and metabolism of the body and thereby affording better nutrition. And third one is acting at the level of strotas, that is by improving the microcirculation. It ensures proper perfusion and nourishment of the tissues. The integrity of the channels is equally important for the distribution of the oja and to the dhatus, which provides body immunity against the degeneration and the disease. Next slide. The other benefits of their therapy are the uh, promotion of memory and intelligence, the preservation of the youth, luster, complexion, and the voice. Ayurveda describes a number of drugs as a rasayana and ojavardhak, which are claimed to possess immunomodulatory effect. Some of the rasayanas are ashwagandha, that is Withania somnifera, amlaki, that is Imblica officinalis, tulsi, that is Ocimum sanctum, guduchi, that is Rhinospora cordifolia, pipli, that is Piper longum, punarnava, that is Borrelia diffusa, estimodu, that is Glycyrrhiza glabra. Next slide, please. Brahmi, that is Bacopa muneri, Bringara, that is Eclipta alba, Ativisha, that is Aconitum heterophyllum, Jyotismati, that is Celestis paniculatus, and Mandukpana, that is Centella ascetica, in which Guduchi, Tulsi, Brahmi have been extensively studied. Bringaraj have free oxygen radical scavenger mechanism. The activity principles of the Guduchi have been found to possess anti-complementary and immunostimulating activities. Next slide, please. Suvarna Prashana. Suvarna, that is gold. It is the one of the most ancient metals even used for the preventive and curative purposes. With regards to its early knowledge to Indians, in Kashyap Samhita, Suvarna Amruta Prashan has been mentioned as is important recipes for the child growth, memory enhancement, and also promote longevity in children and also immunity. Ingredients: Suvarna Bhasma, that is calcined gold, Grita, that means ghee, Guduchi, Brahmi, Vacha, Jatavansi, Shankapushpi, Yashti Madhu Pipli, and Mandu, that is honey. Time of administration: daily early in the morning or Pushya Nakshatra, an auspicious day, enhancing the efficacy of the medicine, which happens to come after every 27 days. Specific benefits of the Suvarna Prasana are as follows: Medha, Agni, Bala, Vardhanam, improve of intellect, digestion, metabolism, immunity, and physical strength. Ayushyam, that is promoting lifespan. Mangalam, that is auspicious. Punyam, righteous. Vrishyam, Varnyam, and protection from evil spirits and microorganisms. Next one, please. The specific benefits of the Suvarna Prasana, according to duration of the administration, have been mentioned in such as: if administered for 1 month, the baby will become Param Medhavi, highly intelligent, and Vyadhibhir Nachadrushya. It will not be affected by any disease. If administered for 6 months, the baby will become Shuddhara, will able to remember anything which are just heard. Suvarna Prashan can be administered in all children as in acts at level of the nutrition, metabolism, growth and development, physical strength, and also immunity. Next one, please. Other benefits: Suvarna Prashan also improves child's appetite. It helps to nurture early developmental milestones. It develops a strong defense mechanism in kids, which acts as a safety shield against disease and complements. It helps body recover early in case of any illness, reduces anxiety, aggressiveness, irritability, and attention-seeking behavior. Next slide, please. Karnavedan Sanskar. In addition to cosmetic value, it was believed that Karnavedan protects the baby from untoward the health complications like Graha, medical effect, both the preventive and curative, if any may be solely attributed to the metals or gems used to Karnabhushana. It is performed on 6th, 7th, or 8th month inference by puncturing the correct site. There will be not the severe pain, bleeding, and immediate inflammatory reaction. Benefits: injury caused by a way of puncturing activities immune mechanism so as to bring a secondary immunity against the several infections. Next slide, please. Kumar Bharnarasa. Kumar Bharnarasa is an Ayurvedic compound drug comprising of method of preparation, fine powder of the vacha, pipli, sunti, ashwagandha, amlaki, haritaki, and yashtimedu, along with bhasma of the suvarna, rajat, and praval, were taken, and one bhavana of with each of guduchi, swarasa, brahmi swarasa, and tulsi swarasa was given. Tablet of 500 mg each are usually prepared, and one tablet is once a daily, morning in empty stomach. Next slide, please. Bal Chaturvachurna. It is mentioned in various classical Ayurveda like Chakradatta, Bhaishya Ratnavali, and Yoga Ratnakara, specifically indicated for respiratory disease, vomiting, diarrhea, fever in children, as there is increasing the tendency of irrational use of the antibiotics in children. This has led the development of the super which do not respond to antibiotics are not posing the greatest challenge to conventional medicines. Bal Chitra Churna is quite effective in various childhood disorders, and if used in children, can minimize the use of antibiotics. Next slide, please. Use of Bal Chitra Churna. Diarrhea, that is atisar, dysentery, nausea, vomiting, asthma, cough, common cold, fever, improve appetite, digestion, and immunity, promotes the proper nutrient absorption and the growth, antispasmodic and cognitive action, which gives relief in abdominal gas and pain, protect the child from the recurrent infections. Next slide, please. Some other important immunity in children are Saraswarishta, Kumar Kalyanak Rasa, Arvindaso, Brahmi Grata, Kalyana Gruta, Savardhan Gruta, Ashtamangal Gruta. Next slide, please. References. Thank you.
Thank you, doctor.
Welcome, ma'am. Welcome.
Next, I invite Dr. Sandeep Borse. I invite Dr. Sandeep Borse.
Am I audible?
Yes,
Hello.
doctor. Please.
Am I audible?
Yes, doctor.
Can you share, please, ma'am, slides?
Okay, doctor. Hello, Dr. Sabin.
Hello, Dr. Sandeep. Please
Yes.
start the session.
Okay. Hello, everyone. The mode of action of Siragrandhi in the management of childhood asthma in children. Next slide, please. Introduction. The problem of children differ considerably from those of adults from point of view of different nature and types of many disease entities as well as different diagnostic criteria and medical therapeutics also. Air, food, and water are imperative to the survival of life. Air is the key importance. Respiration or breathing in and out is evidence of life. This function is very necessary to derive the happiness and benefits of one's life and is carried out by Pranavas since the time immemorial. Man has been in steady attempt to find solution for the life-threatening and distressing disorders which affects the human race. Once of such condition is stomach shwas, causing an impediment to one's respiratory functions. The prevalence of asthma increasing, especially in children annually. The WHO had estimated that 50 million disability adjust life years are lost and 250,000 asthma deaths are reported worldwide. On the basis of symptomatology, bronchial asthma appears very close to tamakshwas described in Ayurveda literature. Please next. This is review. Tamakshwas has been described elaborately in the both Bruhatrayi and Laghutrayi, which indicates its importance as a disease entity. Especially in Charak Samhita, the detailed description of Swas Rog is available, which incorporates its etiology, pathophysiology, and elaborate therapeutic modalities. In Ayurvedic texts, the 5 types of Swas Roga are described. Among them, Maha, Urdhva, and Chinna Swas are said to be incurable. Shudra Swas is produced due to exertion and relief on rest. Tamak Swas is said to be yapep and curable in early stage. So the management described for Shwas Rog in Ayurveda literature is mainly applicable on Tamak Shwasa. Please next. Criteria for selecting the drug. Vat Kapha, Kap Shamak, Kapha and Swasahar, Kapha Nisarak, Swarya Shothar, Strotorodhak, Strotoshodhak. It should not be Ushna, Tikshna and Katu that child cannot tolerate it because of their Aparipakwa Dhatus. It should be easily perceptible to child. So viewing above points, Shirish Twak Churna may produce great result in therapy of Tamak Shwas. Next please. This is the description of Shirish Twak Churna. धन्वंतरी निघंटू एक्सप्लेन रसतिक्त कैदेव निघंटू मधुर तिक्त कषाय राज निघंटू कटू भावप्रकाश मधुर तिक्त कषाय. Next please. Probable mode of action of Shirish. Ayurveda emphasizes on Strotorod in the manifestation of Swasrog. Strotorod is the resultant of disturbance in the equilibrium of Vata and Kapha. Hence, drugs which are beneficial in removing the obstruction and maintain the physiological equilibrium of Vata and Kapha are useful in this condition. The pharmacokinetic properties of the drug Shirish as per Ayurveda will be beneficial in counteracting the exacerbated Kapha and Vata dosh by virtue of Tikta Ras, Katu Vipak, and Lagu Gun. The drug shows Dipan and Pachan properties. The Agni, Dipan and Pachan function boost the metabolism and diminish the formation of arm. This property of drug is vital in preventing the disease. Madhur Ras is said to increase all the Shari Dhatus, Man, Indriya, elevate Vat dosha and increase the vital strength. Katu Vipak increase the overall metabolism. This increases the quality of Rasa Dhatu and thereby the entire status of the body. Please next. Shirish, by virtue of its Lagu and Tikshna Guna, has Kapha Nisarak and Stroto Shodhak properties as it decreases spasm of bronchi. Shirish has property to inhibit the histamine release, which obstruct the immediate hypersensitive reaction and prevents histamine as well as acetylcholine induced bronchospasm. The immunomodulator activity of the drug is already described in drug review. As per related study, the researchers has concluded that immunomodulatory regimen will play a key role in future therapies for allergic disease. These treatment modalities may not only treat allergic disease but also be beneficial in reducing morbidity and mortality for which it is responsible. Next. Yeah. Shirish has Shotahar Vishagna Vedna Stapana is Swasar property which reduces the symptoms of asthma. By virtue of its Vedna Stapan property, it reduces the chest pain during coughing, relief in dyspnea and wheezing where because of reducing the barrier in the way of pranavayu by Sam Kapha. The probable mode of action of the drug was because of its Tridosha effect, Katu Vipak and Lagu Tikshnagun. The drug was given with honey, which itself has good kapha action as per classic. It one of the best suggested vehicles that have yoga high property, which does not interfere with the drug property and it just transport it. Conclusion: increasing prevalence of bronchial asthma in children is a global issue of concern due to associated long-term compromise in the quality of life. Symptomatology of bronchial asthma in children closely resembles with tamak shwas, which is a kapha vata pradhan disease involving pranava strotas with some dushti of annava and udakava strotas. Ayurveda can constitute multidimensional approach for the treatment of bronchial asthma. The management of shwas in Ayurveda should comprise स्नेहन स्वेदन वमन विरेचन दुपन नस्ते उष्ण वातानुलोमक वात कफ शामक अंपाचक स्त्रोतोशोधक कफ निस्तारक and रसायन medication. Thank you.
Thank you, doctor. Next, I invite Dr.
Thank you, ma'am.
Himanshi Vats.
Thank you. Thank you so much.
Thank you, doctor. Next, I
Okay, ma'am.
invite Dr. Himanshi Vats. Dr. Himanshi, are you there? So next, I invite Dr. Pradhamesh. I invite Dr. Pradhamesh.
So thus we officially comes to an end of Siragrandhi national level paper and poster presentation by team Ayur APTA. And before winding up, on behalf of team Ayur APTA, I offer my heartfelt gratitude to each and every panel members for being there for us. And also I would like to thank all the participants who made this seminar functional. Thank you all.